You can start, sir.
Good morning and welcome to this second day of very special Gratitude Week, a tribute for our health guardians. I am Kamal Narayan, CEO of Integrated Health and Wellbeing Council, a not-for-profit social impact initiative to promote health for all. This extraordinary maiden edition of Gratitude Week is a 60-hour-long observation of expressing our deepest appreciation and thankfulness to all those millions of healthcare workers who are helping us live in safety. This is a massive day, 7-day long event where we will discuss various aspects of the healthcare ecosystem with its stakeholders ranging from pharma to biotech to researchers to policymakers and most importantly our doctors. We are also having some live concerts going on all through these 7 days where our artists are paying a musical tribute to our healthcare workers. We had a grand inauguration day yesterday and we were honored that the Union Minister of Health and Family Welfare for State, Ms. Sri Ashwini Kumar Chaube, joined us and helped us in making a grand beginning of this initiative. We were also privileged to have some of the finest and most distinguished healthcare professionals joining us yesterday, which helped us put together a really insightful discussion and to understand that how our healthcare workers are contributing to our society. Fortunately, we could start our initiative on a day which was observed as National Doctors' Day, and we are thankful for the entire healthcare community for making that as a grand success. Let's have some of the glimpse of our first day inauguration, which took place yesterday.
आपने विशेष करके जो हेल्थ केयर इकोसिस्टम को इंडिया में जो आपने एक हस्ताक्षर के रूप में ISW ने जो विषय आज का प्रसंग जो है, मुझे बहुत खुशी हो रही है कि डॉक्टरों का जो ये वर्चुअल मीटिंग आज आयोजित आपने किया है, मैं आप सबके प्रति आभार व्यक्त करना चाहूँगा, विशेष करके ISW के प्रति और आपके प्रति शुभकामनाएं व्यक्त करता हूँ। और जो भी आज के इस कालखंड में हम लोग एक दूसरे से जुड़े हैं, मैं आप सबको हृदय की गहराई से आप सबके प्रति आभार व्यक्त करता हूँ। आइए आज हम सब मिलकर के कोविड हारेगा, देश जीतेगा, इसमें कहीं दो मत नहीं।
Doctors accept it as part of their duties, and very often they feel that this is part of what we call an occupational hazard, and patient care is paramount despite the risk that they have. And they would see patients knowing that they are infectious, they can give them the infection and still continue to do that, because what really matters is that if you cure a patient, the smile on a patient is something that is what doctors really yearn for. No one is an island. And this is something that the pandemic has really taught us, whether it be governments, whether it be countries, whether it be public sector, private sector, everyone has to support each other if we have to fight this battle together.
Why we should also be proud of our profession is that it is a profession which is a service, not a business. And here we use our skills to serve a social purpose. And we deliver competent, committed, and conscientious service, essentially for the welfare of humanity. And that is the ultimate pinnacle of the profession's values. So I think remembering them and celebrating their contributions is a very important element, and I salute you for that idea.
तेरी मिट्टी में मिल जावा गुल बन के मैं खिल जावा इतनी सी है दिल की आरज़ू तेरी नदियों में बह जावा तेरे खेतों में लहरावा इतनी सी है दिल की आरज़ू डूबा डूबा रहता हूँ आँखों में तेरी दीवाना बन गया हूँ मैं प्यार में तेरी डूबा डूबा रहता हूँ आँखों में तेरी दीवाना बन गया हूँ मैं प्यार में तेरी ओ इलाही तेरा दिया मेरा इलाही तेरा दिया मेरा
Doctors, nurses, medical staff, आपका शुक्रिया, आपका शुक्रिया. You are the real heroes, आपका शुक्रिया.
Glimpse of our day one. I think we could not get sound, and our speakers could also not get sound, but I believe it was going to the live audience. We will try to play it again later when the technical problem is fixed. Today's discussion is going to be a very interesting one, because we are now going to talk that our saviors who are fighting on the front line of COVID-19 war, if we can say it as a war, what are the challenges they are facing? What are the stress they are undergoing? And so what it takes for them to really come out as a savior of this humanity. We saw yesterday the discussions about how sometimes system fails a doctor and he gets the brickbats of those lackings. The same may also be being faced by numbers of our healthcare professionals who are working at different parts of this country or the world. And the one important thing which we all can offer is the gratitude for them, that despite all the challenges which we or they as a society, as a professional, as a healthcare worker may be facing, we at least give them that kind of solace that we are with them. And this gratitude week is meant for bringing all our emotions and our support for these millions of healthcare workers who are working at different part of this ecosystem, which is there revolving around us, supporting us every day. We have some very distinguished panelists today with us, and interestingly, they are also the one who are fighting this war at the front line. So I would welcome our first panelist today, Dr. V.N. Gangadhar. He is the director of National Institute of Mental Health and Neurosciences, NIMHANS, one of the most famous institution of our public health system working in the area of mental health. He is an authority in matters of mental health, and he was also awarded Padma Shri this year and has received the coveted Sir C.V. Raman Award and Doctor's Day Award from the government of Karnataka in the past. He is undoubtedly one of the biggest authority in the mental health area in our country. We have another panelist today, Dr. Nitin M. Nagarkar. He's the director of All India Institute of Medical Sciences, Raipur. He is an ENT specialist by training. Dr. Nagarkar has a special interest in head and neck surgery and routinely performs onco and skull-based surgeries as well. Important part that he is heading an institution which is on the front line of COVID, response work from the government of Chhattisgarh, and is managing most of the COVID load, as well as providing lot of other resources including training and other know-hows for all other participating hospitals across the state. We will also be soon joined by Dr. K.K. Agrawal, the President of Confederation of Medical Association of Asia and Oceania and Heart Care Foundation of India. I'll begin with our two panelists for now. But before that, I would like to introduce that yesterday we started a campaign that as we see war memorials being created across the world to honor the soldiers who lay their life on the line of duty to protect their nations. This is the time when the doctors and healthcare workers are doing the same thing, and they are protecting not only the nations but the entire humanity. We are requesting the government of India to, when the normalcy comes back, they should put together a gratitude memorial to honor and respect all those healthcare workers who have fallen during this pandemic globally or in our country, and at the same time also to highlight the work of healthcare workers in our day-to-day life also, so that we as a society start understanding and highlighting health as the most important, most fundamental part of our life. For this, please sign the petition, and you can sign that petition by also going to the change.org link, which is there in our chat box. We will be collecting all these petitions and will be submitting to the government of India. And interestingly, yesterday the MOS, Health and Family Welfare, also unequivocally showed his support for this cause, and he said that he will take this cause and the suggestion to the government, and we look forward that we will have something of this sort soon in our country to pay our reverence and our respect to the healthcare workers. Now I come back to Dr. V.N. Gangadhar. Dr. Gangadhar, you take care of an institute which is not only providing health, mental health support, but also involved in the policy making related to mental health support for the nation and the people. COVID-19 war and the response which we have seen from the healthcare workers, despite all those scarcity and resource crunches, has also led or inflicted some kind of mental health. I think Dr. Gangadhar, sorry. So has also inflicted certain issues, mental health related issues on our healthcare workers. Yesterday we were talking that a doctor is supposed to provide care, concern, courtesy, compassion, and communication to the patient. I believe today is the time when the same thing need to be provided to our doctors also. What is your take around how our doctors are rising up to this situation, and despite all these challenges are ensuring that healthcare is being provided to the people who need it uninterruptedly? Thank you so much, sir. Please.
Okay. Thanks, Narayanji, for inviting me on this webinar. I'm also honored to be with our distinguished colleague James Raipur, Dr. Nagarkar. I believe ENT people are at the highest risk of getting iatrogenic or hospital-related infections for COVID. Sir, you are in the uh, war front, your department. I totally appreciate and bow my head down to your profession among the medical specialties. You are doing a great job. Coming back to what my profession is, being a psychiatrist, I want to share a few things which may be very important. COVID, although it's a viral infection, there are more problems related to non-medical issues than about medical issues. When I'm saying non-medical, I'm referring to social and economic issues. And these have indirect impact on mind and psyche. So the mental health, although it could be a part of the medical illness, making the person feel depressed, irritated, and low in mood, lose his well-being, but good amount of contribution also comes from other social consequences of the pandemic, lockdown, economic depravity, and 100 other things. So it looks like while there are a group of people who attend to only the medical problem, and there are a group of people who attend to only the social problem about lockdown, the police, the politicians, the administration. The mental health people have to borrow from both components and then work. It is about working on well-being of both the affected and those who are not affected. So it's a Herculean task. I think not just the medical profession, but a lot of other non-medical people also have to play a role in mitigating this stress-related distress which is there with all these populations. So firstly, I must say that the WHO's definition, there's no health without mental health. When I'm talking of mental health, I'm not talking here about mental illness, but a question of mental well-being, which is greatly compromised in individuals who are both affected and who are not affected with the infection. Both groups have a compromised well-being status. So this has been recognized, realized, and right from the day the COVID pandemic began, the work for mental health professionals has been on a top priority to the government. In fact, the government asked us to set up a telephone helpline for psychosocial distress mitigation. A helpline was started, and till now we have received as many as about 7.5 lakh telephone calls from all over the country. This is just one line that the government of India through us has established, but I'm sure there are a lot of telephone helplines that have been set up by a lot of well-meaning NGOs, many other medical colleges, psychiatric societies, and most of them have set up this facility to make sure that well-being is facilitated in a situation like this. Being well, being a person who has a lot of resilience can also provide indirectly some immunity to the infection itself. And it is known that if you have a will, you have a way. And the will of fighting the illness should also not only represent in the form of seeking medical help, making sure that your hygiene is protected, etc., etc., but also a will to fight the illness by way of your own energies or whatever you want to call it. This would mean that a person is exercising, a person is following some safe dietary principles, keeping away from drugs, alcohol, etc. So many of these, what we may call as lifestyle measures, are very important, which will come up if the person has a will to fight through this entire pandemic. So the mental health professionals take care of two aspects: promoting wellness and also the well-being, also help the individual to overcome other social concerns that the individuals may be facing. So in this regard, I have three important points to make. One is that the timely action by most health departments, whether state or central, in terms of responding to the individual's not just healthcare needs of related to the COVID infection, but also the psychosocial distress. On both counts, most ministries have taken a very prompt action. Prompt action in terms of releasing several brochures, small video clips, educating them and telling them what they should do during the lockdown period, what they should do in anticipation of a throat swab test, and a series of events. Many of them are already available in the public domain in the health ministry website. I'm not going to allude to that. So what is important is to be communicated to the public is extremely responsive departments of health across all states and across the center as well. To the limited possible extent, they have put in all efforts and tried to mitigate the concerns as regards the mental health and also about the COVID infection. So you have a fairly responsive governments at all levels. This is very important. The second issue is the degree to which people have adhered to rules. If a rule has been passed, majority of them have adhered to the rules. I must appreciate the public during the lockdown. Yes, you have seen in TVs, in various social media where people broke the rule. But I must say, for having seen the public, lot of them are following rules. It's a credit to the Indian population and an ordinary Indian citizen that he or she takes any ruling that is coming from the ministry seriously, and a good chunk of them follow. Yes, I agree. If all had followed, maybe we would have been more victorious than what we have achieved now. But I am sure the success, the credit of the success also goes to the majority population who have actually adhered to the rules of not going out, keeping social distance, wearing masks, making sure that they wash their hands before they touch anything, avoiding eating indiscriminately on the roadside, and making sure that their marriages or other ceremonies are small, avoiding unnecessary meetings and exploiting all telecommunication. This webinar is an example of me reaching out to people using telecommunication, telemedicine. See, for example, the Medical Council of India very promptly introduced the telemedicine guidelines, making it official. So on several fronts, I think the public have also reacted extraordinarily responsibly to make sure that this should be mitigated. So put together the responsiveness of the government and the responsibility that the public have actually shouldered. Both put together, I'm sure the people should now understand. I think they have understood that we are a responsible society, and I'm sure the stress and the distress has already to an extent been mitigated. To my impression is that. The second observation, the third observation which I want to make is, for some reason or other, from whatever I have seen, although I'm not directly in the war front of treating COVID individuals, from whatever I hear from my colleagues who are actually treating them, the magnitude or the severity of the condition among those who are actually found positive has not been as alarming as we have been reading in the Western literature or in the news elsewhere. So for some reason or other, it's a possibility, although it remains to be tested academically and scientifically. It looks like the morbidity related to this infection is not as grave as what it was thought when the epidemic started. So we don't know what is protecting us. That the biological component of what is protecting us remains to be investigated. So put together, my own observation in these 3-4 months of the pandemic, which I have gone through ever since it began, that there have been several lessons that we are going to learn, several reassurances that we have already got, and I'm sure all of us have to convey to the public. It's also important to say that continued vigilance, maybe for several months, maybe a couple of years, is very, very important to make sure that this is brought to as minimal levels as possible. So whatever we have learned in these 3 months of lockdown, worsening of the pandemic, etc., these precautions, I believe people have already realized that this has to be observed. I have to give you just one example of what has happened when the lockdown was lifted in the city of Bangalore. We thought we will open the outpatient services of Nimans. Initially, we had a gush of patients, long queues, poor social distancing, etc., etc. Although we had taken a lot of preparations, telephonic appointments, and a larger waiting hall, so many things that we had taken, but yet a lot of people started coming. Over the course of time, they realized that we have to make sure crowding should not happen. We should avail telephone services, telephone follow-up that NIMANS is offering. They also realize that priority is to avoid getting infected rather than having to jump to reach a hospital for not so emergency a psychiatric or neurological condition. The numbers have dwindled over the last 1 month ever since we began our outpatient follow-ups, making it available to the public after the lockdown was lifted. So it looks like the public are also extremely responsibly reacting, and I must congratulate our population, our compatriots who have taken this mission very aggressively. Only appeal is that we need to remember that this virus is going to be with us. It's going to be with us in some form or other. Eternal vigilance is the only way we can succeed in mitigating it as best as we can. I'm sure the same message will be passed on by other esteemed colleagues. And I also thank Narayan ji and all other colleagues who are with me. And for the first time, I'm able to directly see Dr. Agarwal. Namaste ji. I've been reading about you and honored that I am associated with such great personalities on this TV show or on the webinar. Good luck. I have an interview to conduct for the department. I was hoping between 11 and 11:30, I will be excused after that. Although I'll be listening to you, I'll be continuing my business. I want you to excuse me. I'll keep this audio on and continue to listen to the program. Thanks a lot.
Thank you so much, Dr. Gangadhar. And it's wonderful to hear from you that you have seen that there has been a proactive response from the government as well as the society, as you mentioned and highlighted. So thank you so much. We'll continue with this discussion with others. So let me now go to Dr. Nitin M. Nagarkar. Dr. Nagarkar, Dr. Gangadhar said that there has been a good response from both sides, and we are largely able to mitigate the pandemic mortality as well as the psychosocial distress as well. Dr. Nagarkar, you are on the front line of this war, and you are facing it day in, day night. Your people, your nurses, your paramedics are facing it. We want to understand that what is their mental state and what are the challenges they face, and how do you try to mitigate those challenges. What are the when a doctor come to the hospital every day, what plays in his mind during this time of pandemic? They are also equally vulnerable. We have seen thousands of medical workers getting infected, and obviously they are affected every day. Their families are affected every day. So, Dr. Nitin M. Nagarkar.
So thank you very much for inviting me. My pleasure. As very rightly said by Professor Gangadhar, it's a wonderful platform, and thanks very much to the Integrated Health and Wellbeing Council, Kamal Narayan ji, Himani Singh ji, and of course the rest of the team for putting it across. Thanks to Professor Gangadhar in his opening remarks, he's made it very clear that the Indian public has really responded very well to the call of the government and the health professionals. Dr. K.K. Agarwal, again, good morning to you, sir. I've been hearing and reading about you. I was in Chandigarh for many years before I came to Raipur in 2012 as the director. So nice to meet you and to hear from you. We have been listening to him on various occasions, on various topics. So again, coming back to the question which you very rightly mentioned, that the healthcare professionals are at the forefront today. And I think right from the time that the first case came up in China and then subsequently started spreading in other countries, our government has been very proactive, right, in the center and the state governments. This message was passed on that this infection is going to spread rapidly. The WHO had given a call that it's going to become an emergency, and it did become a pandemic. So there was a lot of preparation which was going on in the states also, and of course through the center and ICMR also. We have been lucky that being a Government of India autonomous organization, we follow all the rules of the Government of India and ICMR, and we teamed up very well with the state government over here. And we've seen almost close to 600 admissions in our own hospital. And at the same time, the challenge was to run the COVID as well as the non-COVID services, like Professor Gangadhar rightly mentioned that they had to open the OPDs also, which we also did. So coming to the point that how were the doctors, how was their approach, or the healthcare professionals, nurses? First and foremost, we made it very, very clear to all the individuals who are here that everyone has to work as a team during this global pandemic. There is no one single individual which can fight this particular infection. It's a global crisis. We need to follow the rules. And this is one particular pandemic or infection that we're going to face, which is different from others that we have faced so far. The world has known about Ebola or Nipah or Zika. Time and again, these outbreaks have occurred. But in India, to face an infection like that, doctors had already started seeing those images where the healthcare professionals wear the PPE kits and manage these patients. Then they started reading about how in New York the mortality rates are picking up and overwhelming even the Western countries where they are supposed to have possibly better or more geared up medical facilities. So a lot of preparedness was there in our case, if I'm talking about our own institution. We prepared them in the sense that whether to have a dedicated facility in the beginning because it is at the cost of some of the other non-COVID facilities. So we did develop a 200-bedded COVID facility with screening zone, isolation beds, HDU, everything ready over there. We teamed up with the state because we had to train their officials as well and handhold them. We were fortunate to have a VRDL, the Viral Research and Diagnostic Lab over here, which once we started receiving kits, we started doing the testing, which has been actually the main issue. And so large number of tests were conducted at our own institute, almost close to 60,000 tests we have done at our place, almost 1,000 to 1,200 a day on an average, and also help the other labs. So we kept on training them and telling them this is something which we are seeing is new, but don't worry about it. If we work as a team and if we are well prepared, then we should be able to face it. The first case came to our hospital on the 18th of March of this year, and when she came, she was a girl who had come from UK and had tested positive. So the entire team was ready. The team included the faculty members, the junior residents, senior residents, the nursing staff, even the person who's going to give the food to that particular patient, then the housekeeping staff and the security guards and ambulance driver. So an entire cadre had been created specifically dedicated towards managing COVID-19 patients. And then that small trickle started and became much larger over a period of few weeks. And we are now seeing approximately 150 to 170 admissions per day, total patients in the hospital, inpatients. Admissions range from about 30 to 35 per day. So anytime we have around 150 odd patients COVID positive, and all the otherwise sick patients, the pregnant women, comorbidities, very small children. We conducted 4 deliveries, 2 cesarean sections, and other surgeries also being done in COVID positive patients. So the whole thing was training them. Even yesterday we had another training session. So batches come, work for 10 days, and then they go for a quarantine for 2 weeks, depending upon which area of the hospital or high risk area they were working. Every time there is a training, every time there is an infection control team which is over there. Definitely when we ask them how they feel before the training and after they have completed their quarantine period and they come back to work, we ask how was the experience, like you exactly asked this question. Initially they were a bit worried, perplexed when they were going to face this kind of an infection for the first time. Even senior doctors haven't come across this kind of a pandemic in the past. They might have faced other infections or other life-threatening conditions, but not like this. So, but gradually the trainings have helped, and that fear had gone away because of the empowerment of the work that they were doing as well as the training. At the end, when they finished their tenure of 10 days and a quarantine of 2 weeks, they came back, I think, much more satisfied that they had actually given their best. They did mention about the difficulties, like, for example, wearing a PPE kit in this kind of a weather. It is really very difficult to wear it and see and manage a patient. It becomes very hot, one sweats inside. it becomes foggy, very difficult to do a procedure. Really, they have gone, they have given their best to the country, I would say. Really, they have struggled. At the same time, we know that some of the healthcare workers are bound to get the infection. All the time, even when even the person takes off the PPE kit, there is an infection control nurse to tell exactly how to donning and doffing. Everything is done under their care. But in spite of that, some individuals did have infections. Of course, they're fortunate that they all recovered, but that risk is there. And this risk is something that we really want to make it as less as possible by training, by sensitization, whether it's a junior resident, and then it's the responsibility of the seniors to ensure that even the healthcare worker who is at the whichever end he's seeing the work, the one who is disposing of the biomedical waste, each one of them is at risk, and we should take care of each and every individual of them. And at the same time, we should pat their backs. If they've done a wonderful job, they've saved so many lives. In Chhattisgarh, we are very fortunate to have a very good recovery rate, a relatively much lesser mortality rate than other parts of the world, I would add. So a lot of effort they have put in, and the ministry has supported us each and every time. So we were already having adequate PPE kits, N95 masks, other protective gear, so that our doctors or healthcare workers should never feel the shortage of that. So preparedness was the key. Keeping their morale was always the key. And again, the same thing happened with the patients also. When they got admitted, they were jittery, naturally afraid what has happened to them, like sir rightly mentioned. But gradually they realized that majority of them are going to improve and are going to come out like almost like normal healthy individuals. This is precisely what happened. Only few of them became very sick or could not make it. So I think a very good success rate. We should really appreciate all the healthcare workers. There's a definite risk of infection in this particular pandemic we are facing, but we should support them nonetheless at every step. Thank you.
Thank you so much, Dr. Nagarkar. And I'll now go to Dr. K.K. Agrawal. He is one of the most prominent figure of Indian healthcare system. And I'll again, introduce him also. He's the president for Confederation of Medical Association in Asia and Oceania, and also the head of Heart Care Foundation of India. A very prominent cardiologist, and has been working a wonderful work in the area of heart care awareness and as well as the delivery of care. Dr. Agrawal, you heard Dr. Gangadhar saying about the response of the government and then the response of the society. Dr. Nagarkar also has highlighted very well that despite there was some kind of fear initially, with the right kind of training, resources, and the management and also appreciation, they have been able to deliver good results so far. The entire event is about appreciation. We are here to appreciate the work of our healthcare professionals and doctors. But when they are working in these challenging times, definitely they expect much more from the system, from the public, and from their colleague. Dr. K.K. Agrawal, I would like to have your keynote address on that where do we stand there, and how as a nation and as a society we need to stand with our healthcare workers.
Thank you, Kamal, and thank you other colleagues sitting here, Dr. Nagarkar, Dr. Gangadhar, and thank you for inviting me. We are medical professionals, we are doctors. We represent the collective consciousness of the health status of the society. A doctor means somebody who believes in beneficence and non-maleficence. Sabka bhala, kisi ka nuksan nahi. And our job is to heal. Our job is to do whatever we want to do and leave the results to the patient's immunity and the patient's destiny. So our job is to heal. Very rarely we as a doctor gets an opportunity like an army man. He always looks for an opportunity to fight in the battle. This opportunity has come to all the people in this generation to handle a pandemic. A new disease, nobody knows what it is. Unfortunately, China never shared their experiences with others. So therefore, Iran had to learn of its own mistakes. Italy had to learn from its own mistakes. US is learning from his own mistakes. Europe learns from its own mistakes. And in India also, we are learning from our own mistakes. We are better prepared because we have seen mistakes of others. But even then, we will say, even we did mistakes of not declaring a lockdown on 31st of January when the first came in India. Doing a lockdown on 22nd of March, we had enough cases in the country. Therefore, now we cannot stop. So everything was evident and it was oncoming. We were only delaying things. Now today, we have learned a lot. Indian coronavirus is different from the Western coronavirus. It is different from other coronaviruses. It's different. In Europe and in US, we are seeing an inflammatory response in children. In India, we are seeing a post-COVID inflammatory response in everybody, the adults. India is basically having a post-COVID inflammatory response. So if I want to simplify a few facts, based on my experience of over 2,000 patients which I've handled in the last 1 month, one experience is that in children, mortality is hardly any. In women, the mortality is hardly any. There are two types of stages of corona. One is a COVID phase, one is a post-COVID phase. I define a post-COVID phase after 9 days when the virus becomes non-replicative, because as on today, we have no evidence that the virus multiplies after day 9. Therefore, in the that is the COVID phase, we divide them into 3 phases: first 3 days, middle 3 days, and the last 3 days. The middle 3 days are the ones which are serious, specifically for the pulmonary COVID. So if you have congestion in the chest, and if you develop a ground glass opacities in your lungs, and if you develop pneumonia, this is the time when you diagnose early. You can get happy hypoxia, you can get ARDS, you can get anything. Therefore, at the onset of a pneumonia, if you give them an intravenous antiviral drug, or with steroid, with any other anti-inflammatory, and if you give them at particular motion, if you give them a low molecular weight heparin, you will be able to save them. In a post-COVID phase, which is after 9 days, before in the COVID phase also, you have extra pulmonary manifestations. That means a patient may come with diarrhea, with cystitis, with right iliac inflammation in the right iliac fossa. They may come with loss of smell, loss of taste. All these are normal. They are all going to go away. They are non-serious. So the only serious is day 4, 5, and 6, and that is pulmonary COVID. Next comes is a post-COVID phase. After 9 days, COVID is gone. The virus is gone. The virus is non-replicative. Now you have a post-COVID 2 things. One, sequelae of what damage has occurred. That means a person may have a post-COVID bronchitis. A person may have a post-COVID irritation in the throat. And then comes this persistent inflammation. So after 9 days, if you find out of 4 parameters, which is ESR, CRP, ferritin, and LDH, if 2 of them are positive, you call them as a post-COVID persistent inflammation, like we see a persistent inflammation of arthritis in chikungunya. So therefore, now we treat them as a post-COVID persistent inflammation. They may have persistent fever, they may have persistent diarrhea, they may have persistent cystitis, they may have persistent inflammation in the right iliac fossa. So this is a post-COVID persistent inflammation stage. It may require a short course of steroid, hydroxychloroquine, colchicine, or NSAID. So this is what we are learning. I'm going to end by making 2 bold statements that it is very difficult to die because of COVID. You literally have to work hard in dying because you will have to ignore so many things to die. There are enough signals for you to save yourself. Mortality is an exception, not a rule. Recovery is the rule and not an exception. This is as on today, 2nd July of 2020. This may not have been true 15 days back. This sentence may not be true after 15 days. After 15 days, we may say 0% mortality. But as on today, yes, this virus mortality with adequate and effective and early treatment, nobody should die. Thank you.
Sir, thank you so much for describing this so well. And then it is very interesting to hear that you really need to work hard to die of COVID. But I want to also know from you that what do you feel for the entire healthcare community? What you said that they have got this lifetime opportunity of being a warrior, but are these warriors, adequately equipped? Are we standing with them? You have seen that.
Kamal, I am saying is that an opportunity was given to Ayurveda to come forward. They lost the opportunity. An opportunity was available to homeopath to come and become the frontline treatment-oriented people. They haven't come forward. An opportunity was there for everybody, and still the opportunity is. I have narrated what we need. At this moment, we need a drug to post-inflammatory, post-COVID inflammation. Let anybody come back and say. I'm very clear in saying is that we don't require hospitalization except when you need a ventilator. Therefore, infrastructure we don't need. If you are going to fill up the hospitals with patients, you are going to cross-infect the healthcare workers. So healthcare workers should manage only those patients who need a ventilator. If you need an oxygen, treat them at home. Home care and telemedicine care are the two achievements of COVID. Treat everybody at home, let the doctors be there, let every private doctor be involved, let every nurse be involved. Treat patients at home, give them full care, and let the doctors treat only patients who require a ventilator care. Make all oxygen concentrators available at home. You will require no infrastructure, because what is happening is by admitting these patients who don't require admissions, you are affecting the non-COVID care. A time will come, non-COVID patients will start dying because they are not getting the beds. So why should we, there should be a selected 2%, 3%, 4%, 5% who need ventilators. Let them be treated. Let all others be treated like a non-COVID emergencies are there. People are not touching them. People, I have patients who are lying with they said, I need a surgery. A doctor says, no, 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 and no. So non-COVID patients are getting absolutely ignored. Your COVID patient should be managed at home. I'm very clear about it.
Thank you so much, sir. So this is very important message that COVID patients should be taken care of as much as possible within the four walls of home, and which is much better for them to recover faster, I think also. And also it is going to help the entire healthcare system to focus on something which is of higher emergency, and so that no one is dying of heart attacks or strokes or any other major issues or cancer, which are, we are seeing the patients suffering because of this whole fear created around COVID-19. So thank you so much, Dr. Agrawal, for your time, and also Dr. Nagarkar for your kind time to join us on this inaugural session of day 2 of Gratitude Week. We place our heartfelt regards to all our healthcare workers, people like you, Dr. Nagarkar, Dr. Gangadhar, Dr. K.K. Agrawal, and millions of others who are working at every stage of healthcare delivery. And we will go forward to now playing our anthem, which has been created especially for in the respect of our doctors, and we'll also see some of the gratitude messages have come from the children from across the country. So over to my team to play the anthem song.
Hi, my name is Padamji Chelawat, and I thought of dedicating a special anthem, a song for the real Corona warriors, the heroes, doctors, the nurses, the medical staff, for their tireless, selfless service. Thank you. You are the real heroes. जो मैंने लिखा गाया कंपोज किया वही है. काम निस्वार्थ किया क्या बात है, मुश्किल में डटे रहे क्या बात है, खुद की नहीं परवाह की, क्योंकि पेशेंट्स के हेल्थ की चिंता थी. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. शब्दों में शायद न कह पाएंगे, शब्दों में शायद न कह पाएंगे, आपके ऋणी नहीं सदा खुद को पाएंगे, सांस खुद की भी थी दांव पर, डगमगाए नहीं पर तेरे पांव पे। डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया। You are the real heroes, आपका शुक्रिया। Thank you.
Thank you so much, Dr. Gangadhar and Dr. K.K. Agrawal. We would also request my team now to play the other tribute performances which we have got. And we will begin our next session at 12 o'clock, which is on the topic about who cares for our saviors. They are working amid scarcity, they are working with the resource crunch, and they are working amid the fear also. So are we caring them enough? That the session we will start at 12 o'clock. I would again place my kind, my regards and my best wishes for Dr. Nagarkar and his entire team who are working at the AIMS Raipur. And let's play the second tribute.
Artist, Asian Research and Training Institute of Skill Transfer, based out of Bengaluru, India, has a great mix of specialists, researchers, academicians, advocacy experts, public health experts, and the technology experts, bringing everybody on the platform to connect. Welcome to the IHW Council Gratitude Week on occasion of Doctors' Day. The team from Bengaluru, Team Artists, which expands as Asian Research and Training Institute for Skill Transfer, brings to you the ABCDE Health Quiz. A for anemia, B for building contraceptive choices, C for cancer cervix, kill it before it kills you, D for diabetes, don't allow India to become the diabetic capital, and E for essential and emergency services. Answer the quiz questions and be eligible for being declared as the health and well-being champion for the day. We wish you all the best from Team Artist Bengaluru. Hello everyone. Team Artist, Asian Research and Training Institute for Skill Transfers, brings you the health quiz on ABCDE. A for anemia. Our aim is to reach every girl, every woman as we march towards Anemia Mukt Bharat. Answer the quiz question now and have an opportunity to be the health and well-being champion of the day. What is the most common cause of anemia? Option A, too little sleep. Or is it too much sugar? Option C, too little iron in the blood. And option D, exposure to X-ray radiation. Answer right now and be eligible to be the health and well-being champion for the day.
I am Harshit Lohia from class 3C. This song is dedicated to all the doctors and other health workers. We just want to say thank.
Yeah, good morning. So we will continue. We just concluded our inaugural session of the day 2 of Gratitude Week. I would again like to inform our audience at our social media platforms. You just saw a quiz contest from our partner artist. You can answer that question on WhatsApp, Facebook comment box, or on other comment box of our LinkedIn, YouTube, or other platforms. And this is the Gratitude Week being organized by Integrated Health and Wellbeing Council, a not-for-profit health for all promotion institution, which is working towards the advocacy of ensuring good food, good air, good water, and good health for all. This is the time of pandemic when our healthcare workers, millions of them, doctors, nurses, paramedics, pharmacists, people working at the labs, diagnostics, are working hard to make sure that we get what we need as healthcare during this time of pandemic, and also for all other diseases which are already existing among our societies and our people. The next session I'm beginning here today now, which is going to highlight that when we are asking our societies to come in solidarity of our doctors and healthcare workers, and so the empathy which we expect from them also to these healthcare workers, what is the challenges and what are the hazards they are facing when they are ensuring that our continuity of healthcare is not broken, and we, all of us who require any kind of medical support, keep getting that. We have a very esteemed panelists with us now on this particular panel, and I would like to introduce them first. We have Dr. Sampath Kumar. He is the head of nephrology department at Meenakshi Mission Hospital and Research Center, Madurai, and a tertiary referral center for the management of high-risk nephrology cases. We also have Dr. Narayan Prasad. He's a professor, Department of Nephrology at Sanjay Gandhi Postgraduate Institute of Medical Sciences, Lucknow. And he's also Honorary Secretary in Indian Society of Nephrology. He was also a member of Global Burden of Disease, GBD 2016, a study. We also have Dr. Rajinder K. Dhamija with us. He is the head of neurology department at the Lady Hardinge Hospital in New Delhi, and a very well-known name in the public healthcare system and in his specialty of neurology. So we will also be joined soon by Dr. Nimis K. Desai. But before that, we'll begin our discussion today. And I would like to start with Dr. Professor Dhamija. Dr. Dhamija, you are working in a hospital in the heart of this country at the national capital, and you are seeing, a lot of COVID burden also being managed by your hospital, I believe. When you see these, your own colleagues, your own paramedics, your own nurses, and your own team of doctors, and what are the challenges actually they face when they go out and make sure that the continuity of treatment is not broken, or we keep providing the healthcare for everyone who need it?
Good afternoon, everyone. And at the outset, I would like to express my thanks as well as gratitude to the IHW Council and Kamal Narayan for organizing this mammoth event in the honors of doctors and other healthcare workers, and giving us this opportunity to share our thoughts and experiences during this crisis time, which WHO has rightly termed as a humanitarian crisis. So I have actually lived in Australia for many years, and my family lives there, and I have worked there with my other doctor colleagues. And I would like to start this, presentation by reading a tweet from one of my Australian friend who is a doctor. And this tweet he tweeted in the month of March. Mind you, we had about 500 cases in the month of March when we started the first lockdown, and Australia also had about 500 cases at that point of time. So he tweets that I am Dr. So-and-so. I am about to separate from my family within my home for uncertain number of months so that I can keep treating you while trying to keep my family safe. It hurts. No hugs from my daughters, no cuddles from my partner. Please, please, socially distance now to make my sacrifice worth it. So that was the kind of a expression from a doctor who was embarking upon a journey to COVID-19 pandemic. COVID-19 has brought entire world in a tough time. A lot of doctors who have been brought in front as a frontline warriors and are treating day in and day out for these patients, risking their own, not only their physical health, but also mental health at risk, just for the sake of humanity, for the treating patients, and on the face of fighting an invisible enemy on the line of duty. So in the next 10-15 minutes, I'll walk through this august audience three aspects of this scenario. One is how a medical professional is going through a journey through the COVID-19 and their families. The second is what society expects from us, from the good doctors, and what the doctors expect from the society. And lastly, I would also like to touch upon the other stakeholders, the healthcare system providers, the governmental organizations, the NGOs, how we can change this challenge into the opportunity of strengthening our public healthcare system. So let me begin with what makes a good doctor, what society expects from us during these times of crisis. So there are certain qualities which makes a good doctor in front of society during these times when we are going through the tough times of a pandemic. So the first one is compassion. So the compassion is basically an ability to identify the suffering of another patient during this time. So we have to imagine ourselves in a similar state in which the patients and the families are going on. So that is a compassion, and that is an integral part of a medical care system or a qualities of a good doctor. And it's a basic grounding principle on which whole holistic care is delivered. The second part is the second quality which I would like to emphasize is understanding. So what is understanding? The understanding is just not the knowledge. It's not merely the knowledge or the comprehension. This is ability to think and act within what we know. So understanding from the patient's perspective is equally important. So he is telling you something. So we need to understand what's going on in his mind, in his thought process, in his illness, in his physical illness, in his mental state. So that understanding imbibes in us in providing a good medical healthcare provision in these tough times. You're learning to improvise your understanding is something like playing in an orchestra or a piano. So it's a skill which comes with the time, and it's an integral part of the care provided being in this tough time. The third one and the most important aspect which I want to highlight is empathy, which you rightly pointed out in your opening statement as well as the subject of this session. So empathy is just not the warmth which we normally try to exhibit as a warmth. In more academic terms, it is actually a social emotional ability to having to understand two different things. One is you at the level of your affective, where you ability to share the emotions of others. The other part is cognitive affect, which is ability to understand the emotion of others. So these two things are very important. Empathy on the part of the doctors and empathy on the part of the society. So when we are dealing with this kind of epidemic or pandemic, they behave in a very set pattern. The pandemics are always known to come from international travel, affecting the rich class and their relatives and the families, going on to the urban slums, going on to the rural and semi-rural areas. So that is a set pattern which we are seeing it. And this pandemic of COVID-19 has also undergone this trajectory in last 6 months, from China to US to Europe to Indian metropolitan cities to the urban slums and to the rural and semi-rural areas which now we are going through. So empathy is one part of the expectations from the society, from the doctors. On the other hand, on the other side of the table for the doctors from the society. So that is very, very crucial part which we need to understand when we are facing through a crisis and fighting an invisible enemy on the line of duty. So we need to understand each other's perspective to deliver a good healthcare system. The next one is the honesty. We have to be honest to understand realistic approach, not a fearful approach. What we are going through is not a panic or a fear psychosis in the minds of doctors and their families, as well as in the minds of the patient itself. So we need to be very honest to ourselves and be honest to the society. And the another one is commitment. Commitment is a personal resource. This protects from the negative aspects of the stress, and which enables them to attach a direction and meaning to our work which we are providing. So commitment is our armamentarium which protects us from the stress and strain of everyday pandemic scenario which we face day in and day out. So apart from commitment, another comes the humanity. If most of you will be knowing Dr. Sir William Osler, he said a good doctor treats a disease, but a best doctor treats a patient with the disease. A great doctor treats a patient with the disease. So we all have to imbibe this principle, and being a good person, being a good human being is the paramount importance. We have to be good human being in everyday sphere of life, not only the hospital. We have to be good father, a good husband, a good citizen, a good person as a customer in a departmental store, or a good spouse, or even a good citizen on the road while driving. So a good human being has to be a good doctor, and on the other hand, a good person on the street. And last one, a good quality which I always attribute to a good doctor is the courage. Courage for a doctor is a moral courage to stand up. If something is going wrong, you have to stand up. Whether it is disclosure of a medical negligence or something not going right for your colleague, for your hospital, for your patient. So you need to have that moral courage to stand up and speak. whether it is the healthcare system, whether it is the community, whether it is the hospital, whether it is you personally, or related things. So all these things the society expects from us in these during the times of this pandemic. On the other hand, as a doctor, what I expect from the society, from the community, is community participation, which I call it as a Jan Bhagidari. So doctors are doing their job, the governments are doing their job, the administration, the other researchers, the clinicians, the lab people, they are doing their job. But as a citizen, what is my responsibility? I need to follow and adhere to all the advices given by the doctors, public health officials, the government. When I drive on the road, when I take my car on the road, I put on seat belt. I keep a distance from the others to protect myself and to protect others. The protection of my life is also in my hand. When I take a bike or somebody takes a bike on the road, you wear helmet. You keep on seeing on the left side, on the right side, keep distance. Similar thing happens now. So when you go out, you wear a mask. You keep a distance. You protect yourself and you protect others. So that is responsibility of the community, society, or citizenship, a responsible citizenship. That's what the doctors, as a doctor, as a clinician, as a neurologist, as a public health expert, I expect from the community to help me combat this pandemic, to change the virus, not the virus changing us. So that is very important from the society part of it. So what I need to tell you now, how to touch upon, I'll just touch upon the healthcare system, how to take this pandemic head on, and how to convert this challenge into an opportunity. So we need to come together, all the stakeholders, whether it is the public sector or the private sector, whether it is the NGOs. So we need to work collectively to deliver healthcare, to prevent the disease. We need to find out people who are harboring virus. We need to aggressively testing. We need to test enough to keep the positivity rate of less than 5%. So it is very simple. If you have 50 people in the community and you test 100 people, you will have 50% of positivity rate. But at the same time, if you test 1,000 people, you will have 5%. So we need to have more testing, more tracing, more tracking, and then treatment of those who are really sick. We don't want to bombard our hospitals with all the sick people at the same time. And that was the purpose of lockdown, that so many people should not come together at the same time, becoming sick with COVID-19. And that has given us time to build up infrastructure in terms of labs. More than 1,000 labs are now working. More than lakhs of beds are now in place. More than ventilators are in place. But still, we need one more focus point, which I want to highlight from your channel, from your platform, that we need to strengthen our public health system, primary health system, as well as district health system. You remember bringing a ventilator into a district in Punjab makes a headline in the newspaper. So that is the state of affairs of our district health hospitals, which are big hospitals actually. There was no ventilator in one of the districts in Punjab. And when the ventilator came, it was highlighted in a newspaper, a national newspaper, that the ventilator has come. So that is really, we need to improvise ourselves. We need to improvise our primary health system. A lot of groundwork has to be done to strengthen primary health system as well as the district health center. World over, all over the people are talking about primary health care, but we have not focused even on our secondary health care. We have a dichotomy of having a big corporate hospital, state-of-the-art facilities in India, where best can be available anywhere in the world. But also we have a very poor district health system. We have not invested much into our district or secondary health system, which we need to focus now. And we should take this opportunity to transform our, not only the primary and tertiary healthcare system, we should also change the secondary health system, which is at the district level. We have more than 700 districts in our country. If we strengthen that system, we would be better prepared to face this pandemic. Now, lastly, I just want to touch through my personal journey through this pandemic. So my family lives in Australia. So my son, whenever he goes to office from 9 to 5, outside 9 to 5, he always concerned about his dad, whether how many patients I'm seeing, whether I'm having my sanitizers in my car or not, whether I'm putting a new mask or not, whether I'm keeping all these precautions. As a son, he's always worried about his dad. My partner is always concerned about my well-being, whether what time I'm in the hospital, whether I'm coming back in time, whether I'm taking all new precautions, all advised precautions or not. And in this high-risk emergency situations like COVID-19, where the doctor is subject to a number of competing duties. So we have a lot of duties which compete with each other. So our duty to patients, our duty to protect ourselves for undue risk of harm, our duty to our own families, our duty to our own colleagues in the time of stress, strain, whether absence of one person who builds up another person's work and increases the harms in the one's absence, and our duty to society. All these duties compete with each other. But having said that, there is a great deal of pleasure. That is why we signed up for this profession. My mother, who lives with me, she's 80 plus, is always worried about me. But I always tell her, Mom, this is like being in the army. Once in a lifetime, you are in the action. So we have to do it. ये तो करना ही पड़ेगा. Lastly, the satisfying part of our professional duty is that we can, and we are in a position to make a difference. And we must embrace that. Thank you very much for giving me this question.
Thank you so much, Dr. Dhamija. Really a moving account, which included both your personal side and also the most interesting aspect of it, that what you highlighted about your friend who sent that tweet and said that all of us, the entire nation, the entire world need to make sure that what sacrifice our doctors are making, and this is a once in a lifetime opportunity. They are getting this, they are on the war footing. It does not come every time. But good part is that they are rising up to that occasion. And we as a nation and the humanity or the people need to make sure that we are, with them, and we are doing whatever it is needed to make sure that they are not getting any further risk, but at the same time their sacrifices are not going waste. So thank you so much for highlighting these aspects, and we really are grateful for you for your wonderful work you are doing, despite being away from your family, and ensuring that the care must keep reaching to the people. Now I'll go to Dr. Narayan Prasad and try to understand. He is in one of the the largest hospital of Uttar Pradesh, and one of the, I think, these are the mega institutions of our public healthcare infrastructure. Dr. Narayan Prasad,
yeah,
how is the life for you there in Lucknow's Sanjay Gandhi Hospital? And also, when we try to highlight that our doctors are working amid scarcity and there are resource crunch for sure. Dr. Dhamija very well identified that even a ventilator coming to Sangrur district of Punjab, Sangrur is the district, I believe, where has become a national news. So, and the same was the problem, I think, only also for PPE kits or maybe masks, or many of the hospitals have really seen that crunch. How was the life in Sanjay Gandhi Hospital, and what you believe, as a society we should be understanding about the medical profession now and forever?
Yeah, at the outset, I would just like to thank you, Mr. Kamal Narayan, and IHW Council for this opportunity to be with you on the social media. And this is one of the great platforms to expose yourself and to convey your message to the public also. The most important thing what we observed during this period, you have first talked about the Lucknow. You understand the Lucknow, particularly whole of the Uttar Pradesh, is a totally densely populated state. And it is the population of Uttar Pradesh is equivalent to a whole of the Australia that Dr. Rajendra Dhamija was talking about, the Australia. So, and in that situation, when you have, there is big gap between the demand and whatever you can supply even to the general public. When in terms of the healthcare, we all understand infrastructure of health is not that great, particularly in Uttar Pradesh and in many parts of the India also. This is overall the situation of the whole India, except some part of the South India, where you can see up to the marks like the Kerala and Tamil Nadu. But in majority of the places, we have very large gap. The region, what I am talking about, everything comes from your economics. When you look at the health economics of India, what you are spending on health infrastructure, it is only approximately of 3% of your GDP. When you will compare it with these other different countries of the world, one of the developed countries like USA. USA is spending 17% of its GDP. Germany is spending about 11%, Iran 9%, Spain 9%. China is spending almost twice of the India on their health infrastructure. So it is likely to be not that optimum. As Dr. Dhamija was rightly pointing out, the most important deficiency is there. Our primary health center is not up to mark. That needs to be built up. Here, asymptomatic patients of the COVID who needs to be, that patient can be taken care at the PSC level, that patient can be taken care at the DSC level. Asymptomatic patient, totally stable patient, no respiratory involvement. Why these patients should go to a tertiary care hospital to engage one bed where invasive ventilation and other important treatment can be given to them. So this is the biggest lacuna happening in the whole infrastructures. We need to improve our primary health center. We need to improve our secondary health care structures. Then comes this, definitely there is our health structure. Overall 80 to 90% is totally dependent on the private sectors. Only 10 to 20% is provided by public sectors. Of when you consider all health structures of India, then at this time of the COVID, when you look at, the majority of the burden comes from the public sector hospitals, and the public sector hospitals are overburdened. At the same time, the health policy is such that many of the non-COVID patients are suffering. They are not able to get their treatment. When you have this, suppose myocardial infarction happens in any patients, they want stenting, they want angioplasty, they need angioplasty many times. At non-COVID days, any such patient will get this stenting. But at present, what is happening? Most of them are enforced to go through your thrombolysis process. So you might also have, listen, this is not, this COVID is affecting the care of the COVID suffering person. It is also affecting the non-COVID persons. Recently, we have done the survey of the 19 different hospitals of 2,500 patients caring centers, where what we have observed, many of the patients are dialysis patients. I'm talking about the dialysis patient. These patients land up in the emergency dialysis. Many patients missed the dialysis. 9 patients immediately died within few days. So this survey was indicating that almost at the end of the 3 weeks of the survey of the first lockdown, when our total number of COVID patients suffering was only 500, when the first lockdown was announced on 25th of the March, within the 3 weeks, almost 113 patients, 104 was missing at the end of 3 weeks, and 9 patients had died. That was the confirmed death due to this lockdown effect. So what was this? Why this happened so? So this was totally, we all can understand, this was unpreparedness before the lockdown announcement. So there is a particular way to control this pandemic that we are not able to do, I can openly say, because it requires epidemiologists. This should be in the hand of the epidemiologist how to drive out about the lockdown. You need economists. You should have the balance between the two so that the progress should remain continued. That should not hamper. So all these things are, that has not taken in the way. But definitely, this was the greatest step that anywhere the pandemic like this happens, the most important things comes always in the mind about the lockdown. So lockdown, as you also might be experiencing, and you might agree with me, this lockdown, this has done? This could not prevent the spread of the disease. Usually what happens, this gives you the time to improve your infrastructure. In between, when you have the lockdown, pupils are not moving outside home, remaining at home, so you would have the time to improve your infrastructure. Once they would be out, there would be some peak of the disease, they can be taken care. And usually the ultimate aim happens for the herd immunity. So everyone has to wait for the herd immunity to develop. So this lockdown was not proper, what I feel. We need several things to be done from the basics. Improve our primary healthcare, secondary healthcare, and then it comes like this secondary healthcare. Definitely, Uttar Pradesh is totally burdened. Now the cases are coming. Our capacity at the Sanjay Gandhi Postgraduate Institute is about 200 patients for the COVID, 200 beds are there. Now, at present, we are full by 120. The last week, we had only less than 100 patients, but it is going on. Now, every day, 15-20 new patients are coming. Definitely one important factor which we observe here are the mortality. So many people claim that this mortality might be manipulated and might be underreporting of this mortality, and that many things came in the media also. But despite being this manipulation, we understand that the mortality and of this COVID in this part of India is definitely less. Then there might be many regions, but what I expect the most important region, when you look at as compared to your USA, our elderly population, when you expect that your elderly population of more than 60 years age is only 8%. In contrary, in USA, elderly population is there of 16%. If they take their definition of more than 65 years. So elderly population gap is there. Other important thing is temperature and humidity. Now there are several environmental studies came, and that has shown if with each degree change in the humidity and temperature, at least not the incidence, not the total COVID cases, but fatality go down. So this might be the other regions. And then definitely you might have heard the multiple news and media that the BCG vaccination is also activating your basic innate immune system. And so that is also preventing. And in India soon, the first vaccine given at birth is the BCG vaccine to any child. So that also might be the one of the factors for preventing and having the low fatality rate in India. As far as you have also pointed about the supply of the PPE and N95 mask, initially at SGPJ, we have a lot of problem in getting these old supplies. But now, for the last 1.5 months, probably that lockdown period has given us preparation for the times and getting all these materials supplied to the institute. Now, it is not looking like that problems. And our healthcare workers are also now acquainted for this. But definitely we are at stress. Half of the hospitals is still locked in the lockdown phase, that we are not able to start the routine care. But in half, beds are open for the emergency patients. Emergency patients are coming. We are admitting them, or we are caring for them. In the last week, we have done 2 renal transplantation also. And we are able to provide hemodialysis to all needy patients. And almost 100 of the hemodialysis are done every day at our institute. So that kind of care, we are trying to balance this COVID and non-COVID care at our institute. So I think nothing is more intelligent than human being's brain. I think a human being would be able to take care of this COVID also. And you also understand that there are so many antiviral drugs are going on, will likely to come. And it is likely that when the vaccinations would be successfully come out of this phase 3 trials, then definitely that will be the one of the major equipment for the doctors to take care of this COVID-19. And as this is a gratitude week, so I will not forget Dr. B.C. Rai. He was born in Bihar, Patna. So I am also from the Bihar. I am also from Patna. So this great man who died, whose birth date was 1st July, death day was the 1st July, great human being, great doctors, great philanthropists, whatever you can say, great politicians, on whose name this National Doctors Day is celebrated every year, and this is very official. So my all gratitude to him that one of the doctors name this National Doctors Day is celebrated across India, and my full gratitude to him. And my gratitude, one other important thing which I want to highlight about every time the people speak about the doctors as a corona warrior. So in the May, there was one newspaper article that was showing almost 30 doctors have died during this COVID period. So during this COVID, if they are warriors, some of the persons fighting at the borders, they die, they are declared as martyrs. And definitely all these fellows might have saved several lives than before their death. So through your channel and through your media, social media, I would like to express my gratitude to all these doctors. I will request you and all the publics to support that all these doctors who are dying here, fighting this or saving the life of the people, should be also declared as martyrs who died at the borders. If any soldiers died at the borders, they are declared as martyrs. Why not about these doctors who are dying, saving so many lives? And then they die at the end because of unwanted disinfection. So this is my point, and I will like to get the support of all the doctors and social media on this point. And at least this will be the real tribute, real gratitude to all of my colleagues and my doctors. Thank you very much for this opportunity.
Thank you so much, Dr. Narayan Prasad. And one thing which you highlighted apart from that, the martyrdom of the doctors, is that somehow probably we lost the opportunity of lockdown and we did not prepare as well as we could have. As far as your point of, giving the real gratitude to our doctors is concerned, I'm happy to share with you that from yesterday we started a campaign among the entire, we are requesting the entire population of our country, our people, that to request the government of India that we should have, like every nation creates war memorials.
Yeah.
In respect to the warriors or the soldiers for their country, or the wars they have won or even lost.
Yeah.
We also need to have a memorial of our health warriors. And these are not the warriors only of this pandemic. Doctors are always vulnerable for many infections at hospitals. And doctors are always fighting to save as many people as possible, with the demand that by having a national gratitude memorial for health workers, we will also highlight that health is something which everyone should respect as they respect the defense mechanism.
Yeah.
It may also help governments to look into health in a much broader manner, much more essential manner, like they look at defense. So as you mentioned that about the GDP percentage being spent in India vis-a-vis other countries, we also spend a good amount on defense. We must keep spending a good amount on defense. But we also should make sure that that defense is to save our people. And without healthy people or health of the people, that defense will be meaningless.
Meaningless, yeah.
What we will do by defending just a diseased population. So that is where we have started, and thankfully MOS Health, who attended our initiative yesterday, he has agreed that he will take it to the government, and he has said that he will also request to the Prime Minister, and he in a way said that probably Prime Minister is thinking something on this line. So let's wait, and we will be very, very keen to see that something comes which makes people remember about health every day. And
put my statement also there, so that because this is one thing which is hunting for. So if you are declaring as a warrior, doctor is such as other novel profession that everyone understands this year. It is possible that many of them things like this might be the second god on the earth, and that you also understand this is no longer existing as a second god, because there are so many disputes going on in the society against the doctors, for the doctors also, but there are a lot of disputed things are coming with the commercialization of the healthcare system.
This initiative is aimed to that, to bring back that trust. There is a commercialization, there is a distrust, there is a lack of satisfaction among the patients. There is also lack of satisfaction among the doctors.
Yeah,
patients need more empathy from you. You also need more empathy from them. Yeah. It is both way. Yeah. It is not always that a doctor is always negligent. Yeah. It is also that patients are also negligent, but nobody says that it is a patient negligence that killed the patient.
Yeah.
It is always a doctor's negligence. It's always a medical negligence, never a patient negligence. So what we are saying that at both sides it has to be balanced. Let me go to Dr. Sampath first, and he has been waiting, and then we will come back to have a little bit more discussion on these points. So Dr. Sampath Kumar, Dr. Narayan said that almost every part of North Indian region is not having that kind of healthcare infrastructure, highlighted by Dr. Narayan as well as Dr. Dhamija. You are in the more I think privileged part of our country as far as the healthcare is concerned. While you have a more privileged infrastructure, and I'm sure that it will also be supporting you well from the infrastructure point of view. Again, come back to the point that this is the time when our healthcare workforce is working amid scarcity, and scarcity of all type. It is not just the scarcity of having enough N95 masks. It is also a scarcity of having that emotional support system around them. So what you feel as a doctor, what is your opinion that what as a doctor, if you are in the front line of COVID-19 war or not, because even if you are not in front line of COVID-19 war, you are almost working in the same affected environment, if not infected environment. What you expect from the society, the government, and your colleagues?
See, thank you very much for this great opportunity to interact and give our views on the burning issues which are facing the society now. As far as the Tamil Nadu is concerned, initially it was sitting pretty, and then we realized that socio-demographic advantages are totally annihilated by the virus, which doesn't respect any included society's infrastructure. If you can see the type of havoc it has caused amongst the highest economies. So Tamil Nadu is a sitting duck, I would say. And you can see that the number of cases are tremendously increasing, putting great the strain on the infrastructure is tremendous. Whatever be the advantages that Tamil Nadu has in contrast to other parts of this countries. The important, as the war continues over the last 6 months, is that mental fatigue has set in. Mental fatigue amongst the healthcare workers is now going to be the physical stamina can go on, but once mental fatigue sets in, the other things will rapidly come down. So the enthusiasm to work and enthusiasm to see that the patients get better is slowly dwindling. And this is, I feel, is the greatest challenge, because the pandemic is not going to leave us, and it is going to be with us for another 6 months to 1 year. And we need to have strong messages coming from the government as well as the public figures, that this is the very, very crucial time when during the initial phases, when there are not many cases, both physically and mentally, people are prepared. Now, as the cases are peaking, both the mental challenges are coming up. This, I feel, has to be taken, and the platforms like this, once we are putting it into the Facebooks and in the community, I'm sure this will really give a positive messages.
Thank you so much.
Yeah.
So let me then go to Dr. Dhamija, and Dr. Dhamija wanted to share something. Dr. Dhamija, you mentioned about very well, you elaborated about that, the empathy and how we should look forward that from both the patient and doctors also need to have the same, the emotions. Dr. Narayan also has highlighted that the point of declaring our doctors as martyr. You wanted to say something on that. So first, your comment on that.
Yeah, I fully endorse your views and Dr. Narayan's view. In my view, if it is possible, we can also think of having a small memorials in the hospital. I used to work in Melbourne Hospital, where in the hospital there was a memorial for the war memorial, Vietnam War Memorial. So, like in Delhi, so far 6 doctors have died. This is data from the Delhi Medical Council. As of today, six doctors have died because of COVID-19 in Delhi. So why can't we have this small memorial in one of those hospitals where we have lost these corona warriors? So bigger on a macro level, the things are at the government level. On a smaller level or a micro level, at the hospital level, we can have a plaque, we can have something which can remind us the sacrifices made by our colleagues during this difficult time. So that's what I wanted to make a comment, that there are many ways we can commemorate, we can celebrate, we can remember these warriors and their contribution to the society during this pandemic time.
Thank you so much, Dr. Dhamija. It's a wonderful idea, actually, that to have some kind of those symbols and those memorial for these doctors who have led their life while trying to save others. And they could have chosen to be at home, but the demand of duty definitely make them go out and make sure that they are providing the care. But what my vision is, that the health has to come out of hospitals. If we want to have a memorial of health and healthcare workers, it need not to be always within the hospital. It has to be at a place where everyone can see and then remember that, okay, health is something which they need to be careful about. They need to remember about. They need to be taking care of it. So hospital idea is definitely a very welcome idea, and I'm sure you will also try convey this message. We are also running this the campaign, and historically countries have built war memorials, police memorials and monuments for leaders, legends, for their sacrifices, landmark contributions. And as a health and well-being institution, we at Integrated Health and Well-being Council request to the people of India and the fraternity and the medical community also to come together for this movement of noble cause and showcase solidarity for the purpose. We are also requesting our audience that they can sign the petition at the change.org, and the link is there in our comment box also. You can go there and sign the petition. I would also request my panelists today to go and sign that petition. We will also send that link to you directly on the mail so that you can share among your people and can get them also to endorse this idea. Dr. Dhamija, one important thing when we are talking about memorial, and I'll go take a one round of discussion to all of you. We are almost 47 minutes on our discussion now. We saw this, the Prime Minister requested the public or given a clarion call to the public that, to show their respect. And at the very beginning of the lockdown itself, we showed that respect by clapping, by, thalis, and also we showered petals on the hospitals, and the military, the warships were flashed the lights in our coastal areas. All that has happened, but at the same time we have also seen a lot of apathy, both from the society and also I think sometime from the system. Doctors are face of the system, but when the system fails, the brickbats goes to the doctors. What is your opinion on that? Do we have a system which protect and promotes doctors, or do we have a system which always puts doctors to take the blames when something goes wrong, and the credit goes to something else when something goes right? Dr. Dhamija.
It's a very, very interesting question and a comment from you. And the need of the hour is that we have to ponder over this and discuss it in an open domain. So all this what was happened was to motivate our young doctors and the medical fraternity to work with full zeal and the endeavor to cause of the nation and the line of the duty. Appeal by the Prime Minister did work initially, whether it was Thali or Diya. But subsequently, as you elaborated, there were a lot of issues regarding young doctors being thrown out of their flats, and because of the fear of bringing infection at these societies and at these residential areas. So this has not been a new thing. This has been going on for many, many years now. The trust deficit between doctors and the society or at the patient's level, we keep on seeing and reading in newspapers the doctors being beaten up by the relatives of the patients. This has been happening in last 10 years more often in major public hospitals, where the things can go wrong or things do go wrong in spite of best efforts and best available infrastructures. Eventually we treat and he cures. That means we only do our best, and everything lies beyond our jurisdiction also, that we cannot save all lives in spite of our best abilities. So this thing was there in the society for last 10 years, and there was laws. Almost each hospital has a signboard that this is a criminal offense to have an altercation with the doctors on duty, which are doing their best. But it did not work fully. The things kept on worsening, and subsequently during this pandemic, a law has been enacted by the government, which has made it a criminal offense with rigorous punishment. But time will tell whether this will also, make a deterrence to the people at large. You can imagine the stress on the doctor who is fighting disease as well as death in the hospital. He is trying to protect his own health and his family's health. He is also trying to do outside his capabilities on the line of duty. Not everybody is a respiratory physician looking after the COVID-19. There are people who have been being trained now, whether this is a general surgeon or a general medicine man or the other specialties. Everybody is pitching in to best of their abilities to tide over this crisis to save the human race. So see the contributions from all angles. In spite of that, the people have been facing social stigma. People have been facing the social boycott, and all these kind of things have been happening. The government, on one hand, has been very, very proactive in enforcing the law and order situation, but we need to do more at the society level. As I said earlier, that as a responsible citizen, we have to fight collectively with the doctors, with the government, with the hospitals, with the law enforcing society agencies, whether it is police or fire fighting, or it is ambulance, or it is paramedics. So we have to work as a team. Nobody can win a war without single-handedly. It has to be a strategy. It has to be all combat armamentarians work together. Even in public health measures, if I tell you, the sacrifices of doctors as well as public health measures, they go hand in hand. During the month of March, when we were just having beginning of this pandemic in India, and Europe had already had a pinch of it, when we were talking to our colleagues in Italy, their only advice was protect your doctors. In the month of March, there were more than 9,000 doctors who were found to be corona positive. There are more than 100 doctors in Italy, they have lost it. More than 100 NHS healthcare personnel were lost in the month of March. In a study done by International Nursing Federation, more than 4.5 lakh health workers have been infected by the coronavirus, SARS-CoV-2. So this is around 7 to 10% of all healthcare workers working in this field. And some figures might be even higher than that. I'm just trying to be very conservative. So see the magnitude of people, healthcare workers, the frontline warriors who have been exposed and who have got the infection. See their mental state, the uncertainty, what is going to happen. Even if you say there is 2% mortality, 1% mortality, even then the numbers are huge in our setup. So we have to care about our doctors. We have to sensitize society. We have to sensitize about the obligations on the part of the community. They have to participate along with the healthcare workers, along with the doctors, along with the government, along with all the other agencies who are fighting this virus, which is an enemy, which is a new thing. Nobody knew about it 6 months back, and we have learned a lot about this. So these are the valid points which I think we need to focus on. We need to prevent this. We need to be very, very, focusing on public health measures, whether it is going out, whether it is sanitizing our offices, personal hygiene and respiratory hygiene, whether keeping a social distancing or respiratory mask or the face mask. One thing I want to tell you, this is pure science. Nobody has made an arbitrary rule of 6 feet or 2 meters. There is a science behind this. Until 1981, based on previous pandemics, so Spanish flu and other pandemics, it was known that a distance of 3 meters, 3 feet is good enough. And that was based on a pandemic or an outbreak of meningococcal meningitis in 1981 in Texas, where it was found that a cluster of children sitting together within a distance of 3 feet were affected. And when they had a lunch together, about 31 of them got infected because they were sitting closer than 3 feet. But in 2009, a person on a flight from Hong Kong to Beijing had a SARS, and he infected 2 rows front and 2 rows behind. From then onwards, it was a rule made of 6 feet, social distancing, so that you keep yourself safe and the others also safe. So these things are based on evidence. These are evidence-based practices which have been told again and again, emphasized again and again. Similarly, for hand hygiene, there are a lot of studies before this pandemic for the respiratory illnesses and after this pandemic also. Similarly, the mask, whether it is 2-layer mask, 3-layer mask, surgical mask, medical mask, or N95 respirator mask. So there are a lot of evidence which suggests that wearing a mask protects the others as well as protects you. So it is a common platform that I protect you and you protect me. So that is the message which I want to give to the society at large, that be participative, take a participation in this war, and let us fight collectively along with the other agencies.
Thank you, Dr. Dhamija. A very important message, and also that you do understand, and then you too feel the pain of when the society goes against the doctor, and then the doctors are become the the face of failure. Dr. Narayan said a very interesting aspect, and he said that immediately after the lockdown was declared, and almost within a month time, doctor, around 9 patients died because of emergency dialysis or lack of dialysis. Now these patients, which Dr. Narayan said that it was showing that the preparedness was not made before lockdown. Now for these patients who failed, they as a patient failed, you as a doctor failed, or the system behind you failed that they died?
So Kamal, we published an article, non-COVID as an elephant in the room. So that article was published a month ago, and that basically emphasized that due to this COVID-19 situation, the non-COVID patients are suffering, whether it is because of the lack of transport, because of the lockdown, whether because of fear in the minds of people that if you go to the hospital, you will catch COVID, because of prevalent infection and majority of the hospital being focused on the COVID-19 patients, or it is because of the other reasons which we are trying to understand why the strokes have become less, why the heart have become less. I don't think they have become less. I think it is the patients who are not coming to the hospital, whether it is the transport issues, lockdown issues, or doctors' resources or the hospital resources being diverted towards building of infrastructure. Many wards were being prepared to take over the COVID patients. All the ICU beds were being diverted for the COVID patients. All the ventilators were being prepared or procured for the COVID patients. So we had a quite bit of neglect on the patients who are not COVID. So those aspects of the pandemic will be analyzed once we come over it. So there are so many learning points. It's not only the COVID. It's not only the pandemic. There are so many issues, whether it is the economic issues, whether it is the migrant issues, whether it is the treatment issues, whether it is the immunity issues, whether it is the vaccine issues. There are other aspects. At the moment, we are focused on two-pronged strategy. One is to decrease infection rate or the spread of the infection by aggressive testing, containment, and the isolation. And second is providing medical care to the really sick people of COVID-19 so that every life can be saved. So people who will get COVID-19, say 90% of people would become all right, and it will not make a difference after a few years to their life. But the person who has gone from this world because of COVID-19 will never come back. So for him, it is all over. We have lost him. So that life is also equally important. So we have to focus equally on that, saving the life, as well as preventing the morbidity or preventing the infection. So at this point of time, I think probably Delhi has peaked up at this. Let's keep our fingers crossed and see another 2 weeks. But my only fear is that this coming season of monsoon with other viral illnesses, with other vector-borne illnesses like malaria, dengue, and chikungunya, and this pandemic now, this trajectory going to the other parts of the country. We are seeing different peaks at different states in US also, and similarly, we are going to see the different peaks in different parts of our country also. The pandemic is now going from rich to poor to urban to rural areas now. And I'm afraid we are not well prepared in those rural areas in interiors of the country as compared to what we have prepared for our metropolitan cities like Mumbai, Delhi, Chennai, Ahmedabad, and Bangalore. So now the next stage of journey begins when we are going to see those parts of the country which are now going to see a lot of these cases, and we need to work on that right now. So we published an opinion piece in the Pioneer last week. Be ready now, what is coming ahead. So we have to be ready for that. And this is a time when we need to work on that ground. It's just not the diversion from the current scenario, but at the same time, we need to think about those people in next coming months who are going to face not only COVID, but also non-COVID vector-borne infections, and which will be very difficult scenario because there will be a mix of both. COVID and non-COVID parasitic infections.
Thank you so much, Dr. Dhamija. Dr. Narayan, what do you feel about it?
Yeah.
Who failed in that case?
Yeah, I just you must be remembering on 24th of March at 8 o'clock, our Prime Minister, Mr. Modi, who has announced this lockdown, and it came into effect from 12 night on 25th. So the order and the preparedness time was only 4 hours. So none of the hospital was expecting that at that point of time, only 500 total COVID patients were there in India. So none of the hospital has got adequate time to prepare your COVID pathway and non-COVID pathway. And then the sudden transport system was interrupted. Many dialysis patients used to come to the dialysis center. They are getting in-center dialysis coming from. You would be puzzled to see average more than 50% of the dialysis patients comes for the dialysis traveling more than 50 kilometers in India. So situation is not that great. So when your transport system is interrupted, the people are not able to reach in the time. So here, you cannot blame the doctors are very much willing. I, as a secretary of Indian Society of Nephrology, I guessed the situation. In this scenario, our majority of the patients are going to die because this dialysis patient cannot survive without dialysis beyond few days. They can only survive for 3 or 4 days, not beyond that. So immediately we have made one document, the guideline for the dialysis of the COVID patients. That guideline was exactly adopted by Government of India. That has been done. I would be very thankful to Ministry of Health and Family Welfare, Government of India, for adopting that guideline. And that guideline has been distributed, and since then the system has been restored. So implying this COVID Pandemic Act, this Pandemic Act came, everything was being governed by administration, by government, rather than the doctors' community. So they have been sidelined. They had not the whatever is the guidelines comes. That guidelines comes from Delhi to state to the hospitals, and many of us are imposed to follow these guidelines. So this is the one part where we are facing the problems. So this is the actual problems. I understand there are several things which needs to be taken care by the government during this, like travel, transportation, so many things like putting the persons in the quarantine, making this. So all these there is a gap. There is communications gap between the government machinery and the hospital machinery, or particularly the public sector hospitals were imposed. Private sector hospitals were spared from this initially in many parts of the India. So this created gap between the two, and the ultimate brunt went to the non-COVID patients, many non-COVID patients. So we should understand whenever it is not likely that this will be the first pandemic. It is likely that when you will read about the literature, more than 90 such viruses are circulating in the bats and other animals. And getting the opportunity, these viruses may also infect again human being. So because we are also, every persons are at fault. This commercializations, you are encroaching towards jungle. You are encroaching towards your forest. So where these peoples will go? They are incidentally coming into contact of the human being, exposing with the new viruses, exposing with these genetic viruses to the human being. So all these things are there are nothing one thing is responsible for such happenings. Multiple things are going on, and I think with many experiences out of management of this COVID-19, the government will learn, we doctors will learn, the societies in general, our general populations will learn that how to live and how to deal with this. At present, during the first unlocked. Our colleagues will agree with this. Whenever you I go out of my hospital campus, it is looking like everything is normal. Less than 50% persons are putting mask on their face. They are moving, putting hand together. So where is this? Whose failure it is? Whose failure it is? It is failure of the doctors, it is failure of the government, it is failure of the general public. So we should understand, we have to increase our basic education level. You can just, I'm giving you one example. See the difference in the management of the same COVID here in Uttar Pradesh, in other parts like Delhi and Mumbai, and you can see the difference in the such management in Kerala. Kerala had been able to control Ebola-like viruses. There were no such case. The fatality of that virus was very, very high than this COVID. So you can just see the basic education of the public is very important in taking care. When they come forwards, everything would be better. So that is the one part, and definitely you understand about the basic education system in our Uttar Pradesh, and particularly in the northern part of the India is not that great as you are expecting in southern part of the India and many other. But definitely this COVID pandemic is really things which will enforce many of the doctors, many of the government officials, many of the general public to think of, you have to live with this, as our panelist has also discussed about the things. We have to live further for many months with this disease, and we have to adopt the policy. Every hospital should have two pathways, COVID and non-COVID pathway. Infectious disease hospital should be, it needs to be built. It should be the part. I am just giving the suggestions to the government also. In every city, there should be one infectious disease hospital. Majority of the pupils in India are dying because of the infection. Infection, still malaria is causing death, still tuberculosis is causing death, still Kalajar is causing death in the patient. So many of the patients, even the swine flu will come after some time. That will kill. There will be multiple viral infections in the pupil. So there, one important infrastructure that needs to be changed. Every city should have the one infectious disease hospital where such kind of, whenever the pandemic comes, they need to be activated. The non-COVID patients should be taken care in the non-COVID hospital. Infectious disease should take charge. When you will acquaint with this, dealing with this, and as Dr. Dhamija sir was telling, he might have experience, and the many of the Western countries, there are concept of the infectious disease hospital separate. So that we should opt out. This is the time the government should learn. We should learn.
Thank you so much, Dr. Narayan. Actually, this is the time for everyone to learn, for public, for government, for doctors, for patients, their families. I'll go to Dr. Sampath and to understand from him. He is, again, I would say, relatively it is a better environment than what Dr. Narayan is describing about. And we also see, Dr. Narayan is also talking about the level of overall basic education of the people and their behavioral patterns. So, Dr. Sampath, what your closing remark now on what is going to be important when it comes to a patient's mindset towards doctor, and I believe it is made on the experiences of every patient. When Dr. Narayan says that people died because of dialysis, I'm sure the patient who lost that life, or the family member, for them it must be a failure of their doctor also, and it can be for many others as well. So or somebody who is going for a cancer treatment. I just got to heard about a case happened in UP only, where a cancer patient was kind of asked from 5 hospitals to go to the other hospital in 5 different cities of Uttar Pradesh. So they were almost traveling the whole week with the patient from one hospital to other to get the treatment or even the diagnostics, but nothing happened. So what is your opinion, Dr. Sampath? How should the whole system and the doctors community should deal with that, and how the patients should also take into the this into their consideration?
The only appeal that I would like to give for the public is that doctors cannot be equated as saviors for 100% of the patients that they are seeing. You will have to understand that the law of averages work in every disease, and also it also works with every doctor. In contrast to, if you see the comparison of the perception among the public about a sports person, for example, you take Sachin Tendulkar, but if he is treated as one of the greatest batsmen in the era of in the modern era, but you can just see how many times he has failed to score below 50. But those things are never taken into consideration in the public mind. But in contrast, a doctor is supposed to succeed in every patient that he treats to the amount that 100% of the patients that he treats has to become better. This is the public's mindset. That mindset has to change. If that changes, and if the public also believes that doctor works to the best of his abilities, if the disease per se is so serious and is severe enough, no doctor on earth can cure certain multi-organ failure patients. So that perception, realism should sink in amongst the public. Number two, as far as the role of a doctor is concerned in this scenario, I would like to say that there is a lot of fear amongst the doctors to treat COVID positive patients, fearing their own life and their health. To make things better, we need to have quick delivery of the diagnostic methods percolating into every state and every district level, so that once the patient is perceived to be a non-COVID patient, then the doctor's level of management and aggressiveness immediately improves. So that the diagnostic testing, be it RT-PCR or antibody testing, should be quickly coming into the every nook and corner of the country. The third aspect is that we have been concentrating too much on building low-cost ventilators. Now we realize, as we come 6 months into this pandemic, that ventilators are not the way to go. We need to have more personal protective equipments like N95 masks and also the foods and other things which are going to be most important as far as the healthcare worker containment of the disease is concerned. So that is also another area that I would like to comment on. Thank you.
Thank you so much. Thank you so much, Doctor. Dr. Dhamija, you wanted to say something. Yeah. Please, so we'll be closing in 2 minutes, please.
Yeah, I just want to convey my messages through your channel. There are three things. One for society, one for doctors, and one for the public health officials or the government. So I start with the public, that you need to adhere to the advisories given by the officials. Time and again we have been giving. At the same time, do not be socially isolated. Just maintain a social cohesiveness. Be in touch with your family, be in touch with your colleagues, be in touch through whether it is electronic media, smartphones or whatever. So be socially cohesive, not socially isolated. The point number two, which is for the public health or the governmental organization, is that we have been talking about the GDP expenditure, which is 0.9% in India and 16% in Australia. So we have been setting targets over the 10 years time that we will increase to 3% by this year, 2014, 4.5% to 2020, 2020, but we have not been able to do so. So I call upon the health economists, as well as the governmental, whether it is state or the federal government, to please look into this and strengthen our secondary as well as primary health care. And third thing, for our doctor colleagues, medical professionals, we have an opportunity in our lifetime to handle this pandemic. We are fortunate enough to serve this society and humanity. Most of us are standing and rising to the occasion, and I must compliment and feel that they should be acknowledged and complimented for that. Thank you.
Thank you so much, Dr. Dhamija, Dr. Sampath Kumar, and Dr. Narayan Prasad. We are really grateful to all three of you. You all are doing your best, and Dr. Dhamija is actually also fighting this coronavirus pandemic on the front line. And I'm sure all of you are trying to bring the best care to your patients, and that no life is suffering. We do understand that, as Dr. Sampath said, that it is not possible for doctor to ensure that every life is saved, but we do believe that you try your best, that you can save as many as possible and you can reduce sufferings of as many people as possible. To my audience, the pandemic has proven that while others can hang their boots, a doctor probably never hangs his stethoscope. We have seen that doctors who had taken up the other role returned to treating people, and many senior doctors, even I was told yesterday by Dr. Randeep Guleria that many of the doctors who have retired have come back to treat patients during this COVID-19 time. This is despite being this profession and this task of providing care for the COVID-19 patient as being very high risk, with a lot of apprehensions, as Dr. Dhamija said, from the family, from the doctors themselves, but they are there to protect us, and they are doing their best. My request to our audience is that, as John F. Kennedy once said, that once as we express our gratitude, we must never forget that the highest appreciation is not to utter words, but to live by them. And it is our duty now to extend all possible help to our doctors. And to extend that thought, I would again like to maybe remind you that we at ISW Council are running a campaign to request the government of India to set up a gratitude memorial for the entire healthcare ecosystem, for millions of those people who work from pharma plant to the delivery of healthcare, doctors, nurses, and everyone who is involved, so that it is etched in our mind, it is there as a teardrop on the cheeks of time, that we need to look for health, we need to prevent our health, and we need to protect our healthcare workers. Thank you so much. I would be signing off from this session now, and let's hear the anthem which ISW Council has prepared. And I'll request my doctors to listen, who are in the panel, to listen that anthem and then sign off for the day. And we will be back at 1:30 with our next session on the saving the saviors, and how safe our doctors are when they work. And my colleague Anisha and the senior media consultant and anchor will be anchoring that show. Thank you so much, everyone. Thank you so much, doctors.
Thank you. Thank you.
Hi, my name is Padamji Chelawat, and I thought of dedicating a special anthem, a song for the real Corona warriors, the heroes, doctors, the nurses, the medical staff, for their tireless, selfless service. Thank you. You are the real heroes. जो मैंने लिखा गाया कंपोज किया वही है. काम निस्वार्थ किया क्या बात है, मुश्किल में डटे रहे क्या बात है, खुद की नहीं परवाह की, क्योंकि पेशेंट्स के हेल्थ की चिंता थी. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. शब्दों में शायद न कह पाएंगे, शब्दों में शायद न कह पाएंगे, आपके ऋणी सदा खुद को पाएंगे। सांस खुद की भी थी दांव पर, डगमगाए नहीं पर तेरे पांव पे। डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया। You are the real heroes, आपका शुक्रिया। Thank you.
My name is Siddharth Suri. I am from class 3C of St. Columbus School. Gratitude to doctors and nurses. You are something special. In fact, you are the heroes to the core. With your efforts, we will make it through this war. You comfort this virus through day and through night. Thank you for keeping your compassion alive. We are so grateful and proud. All we want to say it out loud. The world says, thank you for your service, the lives you are saving. Thanks for all storms you braving. The nurses and the doctors, we are stand behind you strong. This fight is long, but from your courage and bravery, we say thank you for your service from core of our heart. Thank you.
My name is Hudail Das. I am for a St. Columbus School 20 class. I can't even go to school. This is the new rule. No friends, not even a hug. Be careful of a strange word. But my mom told me, hey, the doctor, you see, Corona say, the Rona. Just toilet it, all will be well. Doctors and nurses work so hard, day and night. From their family, they stay apart. And how they rest and how they rest. Because the sick ones take care. You are healthy, you are wise. Someone, somewhere has paid a price. To remember to do silent prayer where people who have shown such care. Thank you. We love you.
I am Harshit Lohia from class 3C. This song is dedicated to all the doctors and other health workers. We just want to say thank you for all the things you have done, the sacrifices you have made, creating such a difference. And we know our God sees each and every one of you. May He bless your heart forevermore. We just want to say thank you for all the things you have done, the sacrifices you have made, creating such a difference. And we know our God sees each and every one of you. May He bless your heart forevermore. Ho ho ho! We just want to say thank you. Ho ho ho! With our whole hearts we bless you.
Welcome to the IHW Council Gratitude Week on occasion of Doctors' Day. The team from Bengaluru, Team Artists, which expands as Asian Research and Training Institute for Skill Transfer, brings to you the ABCDE Health Quiz. A for anemia, B for building contraceptive choices, C for cancer cervix, kill it before it kills you, D for diabetes, don't allow India to become the diabetic capital, and E for essential and emergency services. Answer the quiz questions and be eligible for being declared as the health and well-being champion for the day. We wish you all the best from Team Artist, Bengaluru. Hello everyone. Team Artist, Asian Research and Training Institute for Skill Transfers, brings you the health quiz on ABCDE. A for anemia. Our aim is to reach every girl, every woman as we march towards Anemia Mukt Bharat. Answer the quiz question now and have an opportunity to be the health and well-being champion of the day. What is the most common cause of anemia? Option A, too little sleep. Or is it too much sugar? Option C, too little iron in the blood. And option D, exposure to X-ray radiation. Answer right now and be eligible to be the health and well-being champion for the day.
डॉक्टर्स ही होते हैं. Rural and urban people alike have revered medical professionals and blindly trusted them with their lives and that of their loved ones. But this is changing fast. Stress and workplace hazards of contracting infectious diseases are well-known risks. But even beyond these workplace risks, there has been a spurt of violent attacks on doctors and nurses. A study by the Indian Medical Association found that more than 75% of doctors have faced some kind of violence at work. Now, what has brought about this change? With the rise of corporate hospitals, there is some degree of mistrust among patients, with some physicians being accused of being driven by greed and adopting unethical practices. Government hospitals offering subsidized medical care are swamped with patients, and their attendants may sense neglect. And perhaps ineffective communication or delay in attending to a patient drives attendants to violence. But whatever be the reason, whatever be the provocation, no violence can be justified, not against doctors who are in the line of duty doing the best that they can. To discuss this issue of the safety of doctors, nurses, and healthcare staff, we have with us a very eminent panel. Please welcome Dr. Nimesh G. Desai, Director, Institute of Human Behavior and Allied Science, Dr. Sanjeev Kumar, he's the Chair of Indian Academy of Public Health, Dr. Sachin Bajaj, Founder and Director, Ujala Cygnus Hospital, and Professor Debashish Danda, he's Founder, Clinical Immunology and Rheumatology, CMC Vellore, and President-elect Asia Pacific League of Associations for Rheumatology. Welcome, gentlemen. Thank you so much for joining us and being with us on this very important discussion that we are having. And this is, of course, about the safety of our frontline workers, our heroes, our medical staff. Now, the good thing is that the government has now passed an ordinance making this a punishable offense. Should you hurt a doctor or a nurse at the line of duty, you could face penalties, even jail term. Now, let me start with you, Dr. Danda. What do you feel? Why have we come here? Why does a law need to be passed? And just because there's a law, will we not have any violence?
Dr. Danda, you are on mute.
Yeah. So, if you permit me, before I go into the physical assaults on the doctors issue, I would like to broadly outline the challenges and hazards which doctors every day, day in, day out come across, and what are the root causes for that. Only if you do that, we can address this. So please permit me to speak.
Yes, sir. Please tell us.
Yeah. So I must tell you one thing. In 1980s, India has passed laws which has made health as a purchasable commodity. When we are medical students, we read in community medicine very clearly, boldly underlined statement, health is not a purchasable commodity. Health is a basic human right. So moment you have done that, you have done the damage, because it is like buying sugar or buying gold, buying health. So this gives opportunity for the divide between the rich and the poor. And that is the root cause of today's all the troubles. I will enlist you all the common causes, common hazards which we come across every day in medical practice. Before the physical assaults, there are many other hazards we come across. The most important of all is the biological hazards. Even now, even with PPEs, a lot of doctors are getting infected, and more than 50 doctors have already died. But it is not only the COVID, even with HIV, even TB, there are doctors who got infected and died. Even today, doctors get TB and they die. Also, lifestyle diseases. The Indian doctors have the lower mortality than normal, lower lifespan than the normal population. Because of the lifestyle of the doctors is mostly seeing long hours of patients, lack of exercise, unhealthy food. All those things are also contributing to doctors' poor health. So this is a professional hazard. Number two is the stress-related hazards. The professional stress for doctors is too high. The workload beyond the human capacity, the workplace which is not the ideal, sometimes the pressure from the political or the VIPs. If you have a rich patient or a well-off or a highly connected patient, it takes your attention to that patient and affects the care of other patients, and that's a stress to the doctors. Also, you have the peer-related pressures. Sometimes there's a professional jealousy and other things. Social pressures, the doctors are expected much more than human beings can do. The academic pressure, those in the academic world, they are under pressure for publication. There is a word called publish or perish. If you don't publish, if you perish, and that leads to a lot of pressure. Family hazards. The most doctors in India are able to spend very little quality time with their family members. Many doctors' children are not able to do well because the parents have not paid enough attention to their children, and their families are also broken. There are a lot of divorces among doctors, especially those who work day in, day out in the operation theaters or fully dedicated to hospitals and don't have time for their families. There is also you have legal harassment. The moment the rules came, doctors can be easily framed into a criminal charge. What is a criminal charge is basically when you deliberately attack or kill someone. Suppose a doctor takes an injection and says, I'm going to kill you, Anisha, I'm injecting you a lethal injection. That is criminal charge. But if there is a medical error or if there is a side effect of medicine, that should not charge a doctor with criminal charges like thieves and dacoits. And that is a terrible thing which has happened to Indian healthcare system. And then comes the worst things, the physical assaults. You will notice for the last 15 years, there have been so high risk of physical assaults. I had heard from a legal expert from Mumbai in a meeting. He has said there's a 1 in 10 doctor has a chance of getting either criminally charged or physically assaulted. So these are the things which has happened. Why is it happening? What are the causes? Unless we address this, we cannot sort this. The first, it needs a detailed investigation by independent bodies. But I have some thoughts about it. The one is, I must say always, it is professional jealousy. Often, it is the doctors who go against the doctors. And that is a very unfortunate part because of some disagreement, some prestige issues. So when I was in Australia for 3 years, my boss said always, look at the first page of the patient's record. Is he belonging to a doctor's family or doctor's relative, or is he related to a lawyer? First see those things before you start addressing the patient. And I think that's very important. The professional jealousy is something doctors must be careful about because everybody's plate is full in India. There is no shortage of patients or opportunity. Number two is the harassment to take revenge. For example, doctors under stressful conditions in busy outpatients or wards, sometimes what they do is might have used a loose word or got angry or used a harsh word against a patient relative. And this sometimes provokes the patient relatives and gives rise to the revengeful act in the form of either a charge or physical assault. There are also money-making quarters. There are many money-making quarters who are irrational or unscientific, and there is a mushrooming growth of what I call is a God industry, who misuse in the name of God and treat patient in the pretext of many things, and they cause a lot of harm, and they feel sort of challenged by the scientific or modern medicine. So that is one. There are also goons which are provoked by vested interests to humiliate doctors. There are legal loopholes which I have mentioned to you, which can be easily used to frame doctors. The poor conditions of a healthcare delivery system. You will see that many government hospitals are just unlivable. You cannot just stay there even for an hour. The unhygienic condition, the poor work culture, the poor infrastructure. I think people can die there in the hospitals more. There's a chance of dying there more often than at home. So this is another poor condition of our infrastructure. Then the poor public awareness with misguidance and misinformation. You know, the internet and the social media are spreading more of non-science and misinformation and myths in people's mind, that the truth gets diluted by this and people get misguided every day, day in, day out. The people do not know what is truth and what is not. The next is the unrealistic expectation with the patients from doctors. Doctors are not gods. Doctors are human beings. Doctors can do mistakes. If you pressurize them and push them to the wall, they cannot deliver the best. So that is something you have to realize. And our poor quality of education from school till university and medical school. Half the medical colleges, schools today are corporate or the capitation fee based medical colleges, and the best may not always come in. So that is another issue.
That is true, Dr. Danda. You've raised a lot of important points. In fact, I have friends who have been overjoyed, saying that, you know, a friend of mine, her mother was a gynecologist, and she would say, wow, I'm so happy my mama is going to take some time out for my birthday, because she doesn't have time otherwise. She's always so busy.
Yes.
That I'm feeling so blessed that my mom is going to be with me when I cut the cake. So, you know, it is true, the lives of doctors is very tough. Now, I want to come to Dr. Sachin Bajaj. Dr. Bajaj, we've heard Dr. Danda outline so many workplace hazards, so many issues that the doctors face on a daily basis. Now, after hearing him, I just wonder, why would anyone want to be a doctor? In older days, people used to say it's noble. There's nothing more noble than being a doctor. People used to say after God, there is doctor on earth. But things are changing so fast. And what do you think goes in the minds of youngsters when they think about the medical profession? Is it now seen as a lucrative, profession, so people want to get in, or people still look at it as a noble profession where people can do good for the society? And what is the real reality actually?
Thank you, Nisha, for raising this. It's a very important point. So, see, you cannot get into the profession of medicines just looking it as a profession. There has to be something else in your mind when you're getting into this profession. And I tell anybody who's aspiring to become a doctor this exact same thing. That if you're looking to get into this profession for the money or for career security, something like that, you should definitely not think of getting into this profession unless and until you are willing to put in long, hard days without much reward. You're willing to put in many, many years of effort. And of course, if you are successful, if you are good at your profession, money will automatically follow. And we should not grudge these doctors that the doctors who work long hard hours. It takes 15, 20 years to really achieve super specialist perfection that doctors like Danda have. You need to work very, very hard for your degrees, your basic degrees, then your specialty, then your super specialty, then you do your senior residency, then you do your lecturership. Only after that do you achieve enough perfection in doing that one surgery that only maybe 10 people in the country can do. So if after that you do earn money, we should not grudge you that. But before that, if you feel that if I've done my MBBS and now I spent a crore of rupees on my MBBS, so I should start earning money now. If you follow that route, that is sure shot failure, and that is the reason many of the doctors will suffer from the problem of mistrust from the community, the backlash from the community that we see. So uh, like I did, I mean, I was pursuing my super specialization in a very big top hospital of Delhi, but then I felt that there was a need that was unfulfilled in the small towns of North India. People had to travel 5, 6 hours to get to Delhi to take healthcare, which should have been provided to them in the golden hour. People were dying on the roads because they could not access a cardiologist in their small town and they had to travel to Delhi. So we went to these small towns, opened 12 of these hospitals working in the small towns. We have cardiologists, neurosurgeons, intensive care in these small towns. That means that we have to work at very, very cut, borderline margins. We don't earn any money out of it. It's a daily struggle to meet our ends. But if we were just thinking that we'll earn money out of it, we would have shut these centers and come back to Delhi and, started working here. But there is something else, the joy of saving lives, the joy of seeing patients when they are getting well, the joy of Ayushman patients coming to us, and the ministers and the prime minister recognizing us that we are the biggest provider of Ayushman healthcare all over the country as an organization. So when you find joy in these things rather than just the money, I think medicine is a profession that will work very well for you. So right now, I requested you to put me in early because I am here as a volunteer for the plasma bank inauguration that the Delhi government is doing. So of course, there's no money in talking to COVID patients, in volunteering for them, and running helplines for them, and even trying to get a plasma bank set up and getting in donors here. So I'm here for the plasma bank inauguration. Of course, there is just the joy that comes in that sees that okay, maybe we'll do something that will run this, that will end this mad scramble run for plasma that is happening in Delhi right now. So if you find joy in these things, medicine is just the right profession for you. But if you don't and you find joy in money and foreign vacations and big cars, then maybe you should, think of other options which are much easier to do and you can reach them much quicker. You're on mute, Anisha.
This is amazing that you are helping with the plasma bank. It's really a very important thing in Delhi right now. There are so many patients who require it and are, asking their friends, family, social media, please connect us to a plasma donor. Thank you so much for putting
Yeah,
in your
maybe I
initiative
can go
here.
up. I'm just going up to the plasma bank now, so maybe I can share some visuals to you directly from there. I won't be able to say much, but I can show you what's happening.
That would be great. This is really a great initiative, and we have seen a lot of patients recover from the plasma therapy. We've even seen Delhi Health Minister Satyendra Jain recover. So it is really a treatment with so much promise at a time when everybody is so worried about the pandemic. Professor Kumar, I want to ask you, there is fear, patients have fear, patients have hopes, patients have expectations. All of this sometimes make a very heady dish, and very unfortunately, sometimes doctors are at the receiving end. Can something be changed so that these expectations, fears can be managed better? Now, I'm sure our medical education in our country is superb. There are doctors in our country who perform surgeries which people from outside our country come and get it done here because they're excellent, their expertise is unparalleled. Now, this must be coming to an extent because of the quality of education given in our country. Here, can we also have something about managing patient expectations, about better communications? If that perhaps is handled, perhaps we don't go into an area where somebody is provoked, somebody is driven to violence, or somebody just felt that it's not going to happen. What have you told me? You led me on. Do we need to do that as well? Professor Kumar, you're on mute. Can you just unmute yourself?
Pointing that out. So, Anisha, thank you. And it was a pleasure to listen to Dr. Debashish Danda, renowned immunologist and rheumatologist. And I'm glad he took time off from his busy schedule to talk to the audience. And I also learned a lot of things from him. And then Dr. Bajaj on the forefront of fighting, and he was mentioning going to plasma bank immediately after his talk was over. Let's look at the whole ecosystem, Anisha. I will maybe cover it under 4 points. One is the safety. Infection control measures. Routinely, COVID or no COVID have to be the best in any medical setup. Unfortunately, in India, studies have shown that out of 100, 11 to 40, the range, different setup have different range. People can get infected in hospital and they may die of conditions they did not come with. They acquired these conditions in the hospital. Lot of effort is going on. We have accreditation bodies. We also have Government of India promoting quality assurance under an initiative of the ministry. So we have sure COVID or no COVID, we have to have a very good infection control measure in place at every place within a hospital. When you have calamities like COVID, when they strike, it will be very easy for you to top it up with additional measures like use of personal protective equipment and so on. But the basic infection control measures are a must in every setup, not only for patients, but also for doctors. As Dr. Danda pointed out, today doctors are in news because many of them unfortunately made a supreme sacrifice, lost their lives. But there were doctors and healthcare workers who were dying earlier of other conditions in the hospital. So it's not only the patients who suffer, the doctors and the healthcare providers are at risk. And then you hear stories. If a hospital insists that before I take you up for surgery, I will test you for COVID. And then it becomes a big news. You cannot do it. Court says you can't do it. And in the court, in any litigation, they won't let anybody enter unless the person is tested for COVID. What is this? Court doesn't want to listen or admit a plea if a litigant is not COVID tested. And on the other hand, they take action against doctors who insist, because we unfortunately lost a very renowned anesthetist in #1 COVID hospital in Delhi. But
those are sheer double standards.
This is double standards. You know, doctors, healthcare providers, they need to be treated. We can't tell them God, but they need to be treated as the people who need to be protected at every level. Then care of hospital staff. If some staff member tests positive or has some mild symptoms, we have been hearing stories through media. People like you have been highlighting that no, continue on duty. You cannot take rest. You cannot quarantine. You know, this is not acceptable. They are the one sending people on quarantine whom they care for. But when they themselves have some of these problems, the restrictions are imposed on them. So that's the first point on safety for doctors and also for patients. Second point I want to mention is motivation. On motivation, pay and allowances. Today, in the newspaper, 2 government hospitals run by Delhi government, their doctors and staff has not received salaries for last 2 to 3 months. You are raising money to open big hospital, converting religious places into the largest COVID care center in the world, and you don't have money to pay to the doctor. They have families to run, they have rents to pay for the house, they have school fees to be paid. This is, I would call it, criminal. You have one of the best doctors in the world. I'm glad you mentioned that in your introduction. And at the same time, you're not ready to pay them on time. And then pay and allowances for doctors have to be commensurate with the best in the country. And they should be paid equal to, if not higher than, class 1 services. We have gradually reduced the payment to the doctors when you compare it with the bureaucrats in the country. Appointment, promotions, transfer, these are some of the aspects which need to be done. A bureaucrat, class 1 services, gets an order of his promotion well in advance from the date of promotion. That doesn't happen to doctors, and that affects their motivation, that affects their morale. We have the same system being followed for one privileged class of government employees. Why can't that be applied to the doctors who are doing the best work? Workload. And every day you hear beds added, new ward created. But what about people? There are same number of doctors, there are same number of healthcare providers. You are not adding. This time they should have walk-in interview. For doctor, you come, I'll give you regular appointment, not contractual. I looked at Delhi government in July 2018. 1400, this does not include doctors, exact number is 1281 posts were advertised for staff to work in hospital. It's been more than 2 years. Why these positions have not been filled up? And they're finding ways. Nobody will take people on contractual assignment. They don't get regular jobs. You have regular jobs which are vacant. This system needs to be looked into and addressed as a high priority. Call them worry, but at the same time don't pay them for what they services they have been rendering. This is another aspect which adversely impacts the motivation. Then the disrespect. You often hear people even up to chief minister level on the media coming on Doordarshan saying, oh, I will take action, I will take your license, I will de-recognize a private hospital, I will take the degree of the doctor if you don't do this. Suddenly overnight he is posted to another place. If you don't go there, your degree will be taken. One doctor was terminated because he raised issues in a government hospital of the personal protective equipment not being provided. He was terminated. There was a lot of noise, people like you in the media, and finally that person was taken back. But I am sure the discrimination against that person will continue, and rest of the doctors will get disappointed. Then you have laws. Medical care came under Consumer Protection Act.
Yes.
And when you work under constraint, and then at the same time you are always worried about legal action. Dr. Danda talked about it, how other countries also have this problem. So we have to take care of this. The last point I want to raise is accountability. If a hospital has vacancies which have not been filled up for years, who is accountable? Not probably the medical superintendent, because appointment are made centrally. Yes, there's some hospital, especially the private one, it is done locally, but in government hospital, accountability has to be fixed at whatever level, be it political level, be it bureaucrat level. They are never held accountable. So we have to have an appropriate level accountability put in place. If government doesn't allocate required funds to healthcare, 2002 health policy had put the target that 2% of GDP will be spent on health.
Healthcare.
It came to 2017 when I was heading a government institution that was assigned the task of preparing 2017 health policy. It had barely moved up to 1.1%. Nobody accountable. Why did the health sector not receive the money? Yes, you don't have government hospital, then you tie up with private hospital, provide free care to the people. You have not reached the target of expenditure. Healthcare should be, as Dr. Danda said, human right. And responsibility for that right is government.
And there has to be accountability. The buck has to stop with someone.
And I worked closely in the government for 3 years. Ministry of Health asks for funding for the budget. It gets cut down. Who is accountable? Either finance minister or prime minister's office. And that is the level when accountability is fixed for low expenditure on health. We have to go to higher level. It needs to be clearly laid down. Nobody wants to be accountable. Who will be terminated? Maybe a medical superintendent, maybe a doctor, head of the department. And when it is in the field, the poor A&M will be terminated because she was not trained. She didn't get the syringes. She vaccinated children with measles and children had complications. She will be the one terminated and everything will be quiet. So accountability is very important in
the medical profession. Definitely,
especially
absolutely
times
true.
like COVID. So that's all I have to say on this.
You're absolutely right, and we'll discuss these issues further. But we're joined by Dr. Desai as well. Dr. Desai, thank you so much for joining us. Before I ask you questions about all that is spoken of, can you tell us what has been your experience? Now, you have for years worked with patients across different, different strata of society. What has been your experience? And Dr. Danda has spoken about what doctors who may work in public hospitals go through. Professor Sanjeev Kumar has worked with the government, so he knows how it works from there. What has been your experience? How vulnerable are our doctors to safety issues, be it contracting diseases, to violence from attendants? What has been your experience? Dr. Desai, you're on mute. Can you just unmute yourself? Dr. Desai, we can't hear you. Can you unmute yourself?
Is that I heard your question. Hi.
Yes, sir. We can hear you.
I'm sorry. I was at a meeting and I'm being driven back to work. I should be at my desk in hopefully 10 or 12 minutes. But right. I have been in autonomous institutions for now nearly 40 years. Starting with NIMHANS Bangalore, AIIMS Delhi, and now IBAS Delhi for the last 20 years. But it's also that I'm on various government bodies and committees for other hospitals. I also am the CEO for the State Mental Health Authority, and so we do collaborate actively with the private sector in mental health and health sector. So one might have a sense of the larger picture beyond IBAS. I will try not at this stage talk about IBAS because we do hope and believe correctly that our NABH accreditation since 2012 is actually holding during this COVID phase also. Pardon me if my visuals suffer because I'm being driven. Okay. Whoever this senior colleague was, who I heard in last 10 minutes, I think the angst is justified. At a sociological plane or the socio-political plane, I think there is the usual ambivalence and the dualism that the society and all organs of the society, including the government, follow consciously or unconsciously. On the one hand, there is always a lot of talk about doctors and nurses and healthcare professionals being corona warriors. And on the other hand, there is perhaps lack of attention, if not active indifference to the genuine issues that health workers face. For me, frankly, this epidemic and the sharpness with which that has come into focus is only indicative of what has always been so. It so happens I'm also a trained public health professional, and so my interest in social science and public health always makes me wonder as to how and why non-revenue generating departments and activities like health and education do not seem to get enough emphasis. As I said, I worked in autonomous bodies, and so even if I compare myself with other autonomous bodies across ministries and sectors, there is a remarkable difference the way the autonomous bodies are handled by the society and by the government if you happen to be revenue generating and if you have a spending non-revenue generating agency. Forget small institutions like IBAS, but with all respect, even the largest of the institutions, without naming them, actually are. Can you hear me?
Yes, sir. We can continue, Dr. Desai.
Okay, all right. So I was saying that the autonomous bodies are actually autonomous only partly. The autonomy is quite often a token nomenclature. This crisis actually brought out the apprehensions and the sense of dismay in the doctors, I think, pretty badly. I would love to, being an optimist, being a meliorist, I'd like to believe, and within what I can handle, since we try and provide all that we can, and I think successfully, I'd like to believe that the larger scenario is as good as I see in my immediate vicinity. But the truth be told and reality be accepted, especially across the country and across districts, the overall scene is not very good. I think the society and the government still need to put their act together for more synchronous positive attitude, and especially because this epidemic is going to continue. This is not going away anywhere. For me, in a number of ways, this epidemic is only an opportunity for transforming society to a better level. And one of those transformations should be genuine respect and credibility for the healthcare sector. Without getting into public sector or private sector differentiation or
right. So
issues. Yeah, does that make sense?
Yes, Dr. Desai.
And then I'll be better on a desktop. Sorry about that.
That's right. We'll wait for you to get back to your office. We'll
in a couple of minutes, I promise.
Yes, we'll keep the conversation going nevertheless. So, Dr. Danda, we've heard, the experience of Dr. Kumar, Dr. Desai. They have worked with the government and government institutions. But, the only silver lining is that now at least more medical colleges are being set up. You had spoken about capitation fee and how the pressure starts from the word go. You're paying so much in your fees. Your parents invest so much in your education to make you a doctor. And you study for a really long time. For those who do super specialization, it is a really long time. So then you feel that you should get some return on the investment made. But, are we getting there? It is our healthcare infrastructure is perhaps the worst in the world. The demand and supply gap is so high that, to get into an ideal world where we will have, less pressure on doctors, not as many patients, will take time. It's not going to happen overnight. So Dr. Desai is saying that this pandemic is not going overnight. We are going to be in this pressure situation for a really long time. How do we make up for this gap? There are not so many doctors because there are not so many colleges. Doctors are falling sick when they're contracting this disease. Some have passed away. So this situation is not getting better. What can be done? You spoke about the unhygienic conditions of hospitals themselves, and that is a threat to doctors who stay there for us, patients as well. Now, the Modi government started with the Swachh Bharat Abhiyan to get the sensitivity about cleanliness going for everyone so that it percolates everywhere. But all this takes time. And now, unfortunately, we are running out of time. We have a pandemic, we have existing diseases which also have to be treated. Dr. Kumar mentioned that once you go to a court, before you go to a court, you'll be asked, have you tested? Because you cannot treat people unless they get the corona testing so that everybody is safe. So there is a big demand mismatch. How is this going to get bridged? What can we do? We want to say thank you to our doctors. We've beaten thalis, we've done all of that. But what more can we do as citizenry to ensure that in this time when we're going to feel this demand supply gap, there is less a mistake on our part?
So we have got on the right point, Ms. Anisha. This is what I'm going to, if you allow me, I will explain this in a broad perspective of the societal view of medicine in our country. There are two important aspects which matters in delivery of a good healthcare system. The number one is the basic education, how we grow our children from school to transition into a medical college. I will explain that with little detail. And number two, what are our healthcare priorities by the nation? I think first I will address the healthcare priorities, then I will go to the education system, which makes our healthcare defective. Number one is, if you see countries who made good healthcare delivery, even poorer countries than us like Cuba or even Vietnam, it is not by making high specialty highly technologically top class by public in primary healthcare, family medicine, general practice, and public health. These are the number one specialties. I was mentioning in another discussion yesterday, I was there in Australia for 3 years. The GP training there is the longest among all specialties. It's 5 years after their medical graduation. And they turn out to be the most effective healthcare providers. By the time a patient comes to a specialist, the GP has managed it perfectly in an evidence-based manner, and it is just referred for the next step. So we got our priorities wrong. There is almost non-existent family medicine in our country. The GP is self-styled in India. There's no training of GP in India. And these are the branches should be number one priorities by the government before we venture into higher specialties and other things. All should go on side by side, but our priority should be that. That is number one. So once you do that, number two, we need to have a huge number of public volunteers. You know, when the normal people from the society participate in healthcare, it makes like you have those healthcare workers who work in the Anganwadi and other areas. Those are the kind of people in Kerala. How did they contain Nipah? How did they contain Corona so well? Because they had lakhs of volunteers who came forward to help the government in different aspects of healthcare delivery system. These are the strengths. Doctors alone cannot do it. Doctor is a highly specialized person who looks after the medical aspect. But there are so many other allied issues of healthcare which are ignored if we don't have enough volunteers to take part actively, to educate, to run the support system. This is about the healthcare delivery system. I must say government should prioritize. Number two is our education. What is the way today children become doctors? It is often by the parents telling their children to become doctors, and that is not the way the aptitude is tested. Today, if you get 90%, you are average. If you get 90 to 95% school, you are just above average. And between 95 and 99%, you may be good. And 99 and 100% is only excellent. So even people with 95% above marks sometimes do not get into branches where they want to study. And this is not unusual. You see top colleges reject people with 90% marks. So our system of education is degree oriented. It is not educating people how education should be. Now coming to medical education in our country has been completely, it is too much of a degree oriented, too compressed, too many things. You know, I must tell you, 4.5 years is too short a period for someone to grasp basics of medicine. And it is too short, I must tell you. It takes 10 years to make an MD, which is the basic degree in America. And after BSc, we get school children after 18 years age, 17 years age, join medical school. They're pretty immature. And you have, look at in Australia, they have 6 to 7 years of medicine and they have 2 years of internship. India should have a longer, proper, comprehensive, holistic medical education where they look after the training, look after the trainees to grow into human beings, sensitive human beings, holistic carers. They should have ethical values, they should have understanding of public health, and they should not be just sitting in the medical colleges and just doing that. You know, you get Australia medical students are posted in GP's clinic. Can you believe that? Because in hospitals you don't see cough, cold or common diarrhea dysentery. They come to the GPs. So they are posted there to learn there. So we have to have really revamp of our medical education system to make our doctors competent. Moreover, the bond period after MBBS for 2 years in a rural setup. CMC Vellore has an excellent system. The 2-year bond is there for many years, and they all during this period are posted in the peripheral mission hospitals. And then they come every 3 to 6 months for a short period of 2 weeks in the medical college in CMC to update themselves. And at the end of 2 years, they get a diploma in family medicine. So what I'm trying to say that you should not waste every time. You can have medical course like, you know, anatomy, physiology, biochemistry, the first 1 year of MBBS.
Yes.
You know, each of these portions can become a full-fledged BSc course. It is too much. It is just inhuman to tax children to study those in 1 year time. I must tell you that India should also adopt the system of joining medicine only after BSc, and that BSc can be in these preclinical branches. Then, when you go into the medical school, there should be modules, and each module should give a certification. Like you have 1 year on medical ethics, public health, on sociological aspects, economy of health, all those things. They should have 1 year basic before they start seeing patients, and that should give them a certification or a fellowship. After that, you have 2 years of paraclinical subject like pathology, microbiology, pharmacology. They learn along with bedside seeing patients, and they learn to apply them in real life. And that becomes a 2 year, you have, they call it a fellowship.
Right, Dr. Danda, what you're talking about is a huge revamp. It's a huge mindset change. It's something that will again take a very long time. Dr. Kumar wanted to add something to this question. Dr. Kumar, please go ahead. What did you make of what Dr. Danda said? Very, very interesting ideas, but you know, we're not even getting doctors. I mean, we should prepare others to perhaps, you know, chip in. What do you feel?
That's true.
Dr. Kumar, you're on mute. Can you just unmute yourself?
What Dr. Danda said is very right, and I'm glad the Medical Council, the current incarnation, is looking at some of those issues. What I wanted to raise for you and audience is some of the soft skills are missing in our medical curriculum. When I was an intern, the first death I faced, I didn't know how to face the family. This patient, I still remember his name, and the whole picture comes back to my life. Not other patients. The patient has just died, and we normally put a curtain when you're reviving the patient. All my effort fails. My senior came, no, son, have stopped cardiac pulmonary resuscitation. The patient is gone. I was on the verge of crying myself. And when I came out, I had to declare it to the family. I didn't know. And mind you, I was trained in All India Institute of Medical Sciences. So some of these soft skills, communication, and the violence against doctors, one factor is there is inadequate communication between doctor, patient, and the families. We are not trained. We are not trained on listening skills. Before violence starts, you can read it that it is coming. If you are trained to look at non-verbal communication, you don't know how to deal with it. The doctors become, because they are the ones who are the authority in a hospital, they become arrogant, and the way they treat the patient precipitates violence. I wouldn't say every situation, but that is one factor. So some of these soft skills must be included in undergraduate curriculum: how to communicate with the patient, how to communicate with the family. Even if you are busy, you have to do this. The second aspect is you mentioned in your question about how do you move to the ideal world, and Dr. about is, first let's look at what has been planned in the country 20-25 years back. Have we got there? Then we can look at going. I'll give you just figures. I looked at the data recently. You have 6 beds in every primary health center. There is 1 medical officer. If you multiply, we have about 26,000 primary health centers in the country. Multiply 26,000, you have 160,000 beds available. And as Dr. Danda said earlier, now the COVID infection has gone to the rural area. You will need these beds. But these beds are not functional. 20% of them don't have doctors. Only 1 doctor is required, is not there. You go to the next level, that is community health center. Each community health center is supposed to have 7 doctors, 4 specialists, and 30 beds. 30 into, you have about 6,000 of them, 180,000 beds. You have 350,000 beds only on paper. You look at the vacancies. Number 1 vacancies are for surgeons and physicians. You need physicians in COVID outbreak. 80% of the post of the specialist physicians are vacant in CHC. You already have this infrastructure, but as I said earlier, who's accountable? Recruiting people. They are the ones who should be taken to task.
Taken to task, yes.
And all these infrastructure. Then you go, Dr. Danda was talking about it. How can we move to a situation where we can compare and be proud of? No, Indian system is as good as any developed country. So that's next stage. But we haven't got to what we had planned 20-25 years back.
Dr. Desai,
Hi.
Hi. you
Sorry,
heard.
all because of me. I'm now at my desk. But can I ask? Sorry, Anisha. Nice to talk to you. Do we have any other participants other than the 10 that I see in the list?
We have with us Dr. Danda, Dr.
No, I see the list. Yeah, I saw that list. Do we have any other participants, or are we having a small group discussion? I just thought.
We are having at this point of time a small group discussion with four of you. So Dr. Danda and Dr. Kumar have now highlighted for us, Dr. Danda, how an effective system works in Australia. Dr. Kumar saying that whatever we plan for, we are underachieving. But whenever we get there, however we get there, we cannot be trampling upon the people we need. We cannot have violence, and we cannot have our doctors not safe. We cannot say you just forget about having PPE or having the equipment required. You can't do this. You'll never get there then. If people are falling by the wayside, how will you ever reach a target? So in your experience, have you seen severe negligence where the minimum is not provided for, or violence against doctors which is completely uncalled for? Have you seen this, Dr. Desai?
Yes. I was asking you about the size of the group so that we can have a candid discussion. I mean, if you are trying to educate a larger mass, then the approach would be slightly different. From what you're saying, Anisha, there are 2 or 3 things that occur to me. One is I am with you in what you said in the last few sentences, and that's if I understood you correctly. in healthcare, like in almost any other field, but certainly in healthcare, for the consumers as well as for the providers, there should be some non-negotiables. And some of the non-negotiables in the current crisis or in the recent past would be the safety against infection for providers, safety against physical violence against healthcare providers, adequate or at least optimal salary paid regularly, as Dr. Sanjeev Kumar was highlighting some unfortunate parts, and a few others. So surely there should be, and there are some non-negotiables. Like I said, I'm an optimist, I'm a meliorist. So I tend to see the positives, and I still look at the future more positively than some of us might. This aspect of there being some non-negotiables, I think this country and this society are beginning to realize and accept and implement. The condition of the medical college is and civil hospitals in the 60s or 70s or 80s was actually much more pathetic. The entire idea of quality assurance that Dr. Sanjeev Kumar heads one moment of, and like I said, we have been a party too. I do want to see, and I do see the fact that quality assurance is catching up. Like almost everything else, that's also catching up at a very slow pace, possibly, when you consider the larger scenario, and at a fairly erratic manner.
Fashion, okay.
It is not uniform, it is not quick enough. But then, can I also come to the flip side of it? And I thought, in a small group discussion, we can kind of push the envelope. In general, for the society's coping, for the so-called and correctly acclaimed huge clinical acumen of the Indian doctors, and if I might add the third dimension, if you'll all permit, my teams and I have had huge experience in disaster and conflict situations. And we also worked with the NDMA closely. If there is one aspect that's emerging about disasters or conflicts, or by now one would say epidemics, and the mental health scenario or the psychosocial sequelae, it is the individual resilience, the family support, and the social coping mechanisms, proving the mental health scenario for the South Asia and Afro-Asia countries to be much better than the West.
Okay.
I also think that the much maligned lack of hygiene in this country and the habits that we have all had, golgappas at the street corner, beginning from there, is actually providing a much better immunity now. The recovery rates, I dare say. So I'm posing a problem, friends. Please understand. Like I started this part, in the 21st century, as we get modernized and professionalized as a human race, there will have to be some non-negotiables, surely. But at the same time, sadly enough, our strength seems to come from our weaknesses in a number of ways. Take my word for it for now, PTSD, the much celebrated PTSD, doesn't happen in this country, my friends. We followed up 35,000 population in Bhuj and Kutch for 8 to 9 years, starting within the first 1 month of the earthquake. No PTSD. The post-traumatic other mental health disorders, very minimal. Recently, we have had an occasion, would you believe, allow me to share this as a mental health person. The Supreme Court directed many states, and we kind of took it very seriously. In the last 8 to 10 weeks, our teams have fanned out to all parts of Delhi in those temporary shelter homes where we saw all the scenes on television screens. And believe you me, the psychiatric morbidity, even the psychological distress or the psychological discomfort, and we studied about, I think, 50,000 people, 53,000 in fact. The psychiatric disorder and the psychological distress is no more than the general population. Now, here is my question to myself, and I've been recently putting it up in webinars. Here is a group of people, not in Delhi, but all over the country, who were possibly at the lowest rung of the society. They anyway did not have much to go for in their life, right? They were merely earning their minimal wage and bread through hard labor. They were living in very difficult circumstances. Background. They went through this tremendous anxiety of their life, livelihood, their safety, and so they did the impulsive act of coming out on the expressways. The courts and the government did, I think, what was optimal, not the best, in giving them temporary shelter homes, giving them food, giving them a sense of safety. And their mental health and their coping was very good. How do these people achieve this? So there are those inherent strengths of the human race, human adaptation, and particularly of Afro-Asian continent and the South Asian Indian context, that we should not be losing. See, if you are going to become as modern as the Europe and US, the next epidemic, actually, we may not have all these strengths.
No, that is fair from
So
the patient
how
angle.
do we handle this? How do we handle this? Yeah.
I want to understand from the supplier side, from the doctor's side, because as Dr. Danda has pointed out, as Dr. Kumar has pointed out, historically our investment in our healthcare system it has been really remarkably poor. We as patients may have had better coping systems, but you know, for an epidemic we need the trained manpower, and we haven't had it because the investment hasn't been made. On top of that, you have your frustrations coming out on your on the doctors. You don't let them into your society because they may be exposed to COVID. You're beating them up. So you know, you are saying that general population copes with many anxieties well. But what about our doctors? If a portion of that society is not able to cope well, should they vent it out on the doctor?
Allow me, no, of course not. No, of course not. Totally with you. But allow me to share another dilemma. I'm really taking this in a small group discussion as my opportunity. We all need ventilation, including myself. Okay. So the thing is, or Dr. senior doctors or Anisha Abalao, in April, we started a telecounseling service on our own from IBAS with Delhi Medical Council, Delhi Medical Association, approved by Delhi government, specialized telecounseling service for healthcare workers. Okay. I got 12 and potentially another 12 senior most psychiatrists, private and government doctors in Delhi offer 2 hours slots of free counseling for any doctor or healthcare professional who might be distressed and who might get support. Okay. Believe you me, in the month of April, we had 4 calls.
Dr. Desai, that isn't because they don't take their stress, seriously. It's because they don't have the time. Look at our doctors.
Allow me, Anisha. I'm not holding the opposite. I'm only putting forth dilemmas. Now, of course, recently Amit Shah visited the Loknayak Hospital and advised the psychosocial counseling he provided. So the Delhi government came to us and said, okay, we named this very nicely, I thought, Samarthan. We tried popularizing the word across government and private sector. My dilemma is, and genuinely partly as mental health professional, as public health professional for our society, I don't think there can be any intuitive disagreement. I don't think there can be any disagreement about intuitive agreement that doctors and nurses are under stress.
Okay.
Sure. None of us would intuitively disagree. And there is enough evidence, at least indirect. How and why is it that somehow when you offer concrete help,
nobody takes it up?
Yes. After the government of the highlighted it, we have had 7 more calls. So there are a lot of imponderables that we need to, I think, recognize. But to, I think, come back to what you were pinning me down for, and I'm happy to be pinned down. Like I said, at IBAS, we have made sure no question of lack of BP, no question of any lack of support. Somebody is unwell, please go and leave, stay at home. Okay. We are a mental health institution, neuropsychiatric institution. We are a non-COVID hospital. But please be with me for a minute. We get these homeless mentally ill people from the street. And I've since February been worried about the COVID infection through homeless people. And believe me, we have had 10 COVID positive patients in neuropsychiatry. Not tested sometimes for a week or 2 weeks because the ICMR testing protocol does not permit homeless people to be tested. Because of which we have had 40 staff members who tested positive, including our senior residents in psychiatry and neurology. So we have had our share of handling the staff reactions, and it's not been easy. But I do think that, and genuinely, I mean, pardon me if I'm in a huge minority of even one here. I do think that in crisis situations, systems do as best as they can. And I think regardless of center, state, Bengal, Delhi, Maharashtra, national government, I think our governments have done at a cross section at least more than optimal. It may not be the best. There are always redressal mechanisms from the courts of law to public domains to, I think we have done all right. And I'm not being diplomatic. I'm not being diplomatic. I think as a nation and as a society, we have done all right. Even the lockdown and the behavior of people, I mean, there will always be instances of very responsible behavior where somebody organizes a wedding party and gets to 50 people. Given all the constraints and difficulties, we have done all right. We can always keep pushing the envelope, asking for more. I would like to see it positively still. There are huge pockets of negativity, I agree.
Okay, definitely. Yeah. Dr. Bajaj, we saw some visuals that you showed us about the plasma care center. If you can hear us, have you been able to catch the conversation that we've been having with the doctors here? Dr. Kumar, Dr. Danda. I think Dr. Bajaj can't hear us, so we'll continue with our talk. Dr. Danda, you did talk about how we need more GPs, and if we have a system in place where more people with their health issues get addressed first, and the pressure on the specialists will be lowered and perhaps will have better delivery. Now, till we get to that ideal place, how do you protect all doctors, whether they are not specialized, where they don't have a super specialty, they're just MBBS, or they're specialists, and how do you protect them? Do you think that that ordinance that the government has come up with is enough? Because, you can only scare people with the fear of the law as much, right? I mean, the law is there, but you got to implement it. And first, before you implement it, there has to be a fear for the law. In our country, it doesn't seem like there's a fear for the law. So how effective is an ordinance going to be? To your mind, Dr. Yanda, what do you think?
Thank you very much. Coming back to the same main issue of the hazards to the doctors, I fully agree with Professor Desai and Professor Kumar on what they said. And by no way I would say that our government has done too badly. Our government has done reasonable, not too good, not too bad. But what happens is, I will come to first this protection of doctors issue, and then I'll go back to permit me for 2 more minutes on the broader aspects. Yes. So basically, for any problem, there should be some short-term, long-term, and immediate action. Okay. The immediate action government has done by passing the ordinance, no doubt about that. But all of you know the ordinance lasts for 6 months. It has to be passed in Parliament, otherwise it has got no value. Yes. And I must tell you, even today after ordinance, there have been instances of violence against doctors, not one, not two, more. There are even difficulties in, I do not know what's the reason why the doctors are not filing cases against those, but there are people are getting away. So it should not be a ordinance just for this crisis time of COVID for 6 months or 1 year. It should be a long-term solution.
A law,
yes. The second thing is we have to have some short-term plans. But I must tell you that, again, it goes back to our priorities of healthcare. Why people are unhappy with us? Because our healthcare delivery is suboptimal. Why is it so? Because we do not have enough primary care doctors, we do not have enough family physicians, we do not have trained general practitioners, not self-styled general practitioners. That makes no sense. The MBBS doesn't become a GP. It is 5-year training. So because of this, these have to be strengthened. India had that plan. The 1918 pandemic of Spanish flu killed almost, how many crores of Indians were killed? Because up to 2 crore Indians are killed, and that time the undivided India's population was less than 30 crores. So there should have been a pandemic plan in place. Australia, before WHO declared a pandemic, started their pandemic plan. Many other countries have done that.
Yes,
We
even
never
South
had a
Korea
pandemic.
did. Yes,
we never had a pandemic plan in place. So that is another thing we should have had, and we should have it now. It's not the fault of the government. It is the fault of 100 years in the past. So we should have, like now government has got disaster management plan. The similar way, there should have been a pandemic plan. So there has to be some short-term, long-term. Long-term plans are important. Certainly, the pandemic will last for some time, but it will become a low grade after 6 months or 1 year maximum. By 6 months' time, certainly it will die out to a very minimal level. That's what the prediction we're giving. But what we have to, as you said, it is not just the COVID. COVID will die out one day, but there
something
are so
else
many.
will come up.
Absolutely, and it's already coming up, and many more normally existing diseases. Our healthcare delivery system has to be geared towards that. And as Dr. Kumar said very rightly, communications. I was trying to say, maybe you interrupted me, so I couldn't say, is that before the medical students start seeing patients, there has to be some core strength areas. The core strength areas should include sociology of health-related and cultural beliefs of people, medical ethics, the knowledge of traditional medicine, what is the people's belief in that, the economics of health, the public health, epidemiology, the critical appraisal of scientific publication. You know, today, 99% of publications are trash. They are just for career enhancement. They don't really make sense. So there is a way of studying, it's called critical appraisal. And the medical students, before they start seeing patients, they should know what to read and what to throw as a junk. 99% of junk, I must tell you. The other thing is the basic communication skills, scientific communication as well as the day-to-day communication with the patients, the doctor-patient relationship, the knowledge of dietetics. No doctor knows about diet at all. Nobody knows. People ask always, what should I eat? What should I not eat? I do not know. I have to read and I have to tell them whatever scientifically I can say. They should have exposure to acute care, primary care, as well as the people's beliefs on the traditional systems, legal aspects of medicine, bedside manners. Most doctors have very poor bedside manners. In front of patients, they discuss, you have cancer, you have this, you have this. Patient is frightened to a mouse because he may be talking about some other patient. The doctors are talking a whole lot of things in bedside rounds. That is not warranted. And this is not taught in our MBBS curriculum anywhere. The other thing is what shall I say, the bedside, what shall I say, and also the students should not be pressured into make a diagnosis. You know, they should be first learn how to address the problem. I always tell my students that it doesn't matter you call it rheumatoid arthritis or a psoriatic arthritis. It makes no difference. You call it inflammatory polyarthritis. If you understand the basic principles of the pathology and the treatment approach, you will be able to treat it. So a problem-based learning has to be taught, and patient should first of all learn to be holistic as a social teacher. Doctor is first of all a teacher for the patient. The word doctor came from the word docere in Latin, means to teach. So what I'm trying to say is that 1 year they should spend in developing these skills, from ethics, from communication, to all social aspect. Even we should learn why people go after alternative systems of medicines and swamis and babas. People should learn this. These are people's beliefs and faiths. And unless we understand them, we cannot respond to the patient very well. So this is the core area. And then I must tell you that the government should make thousands, not one or two, thousands of family physicians, primary healthcare physicians, general practitioners with appropriate training who can cope with our system. We don't have to make too many cardiologists or too many gastroenterologists anymore. We have enough of them. And I like the one, of course, we now have reasonable numbers, so we can justify the saying Dr. Desai said about the hygiene hypothesis. Yes, it's true that we live dirty, we are protected for even for rheumatic diseases. We say we get less rheumatoid arthritis because we are infected with. But of course, we cannot be complacent with that. We have to. There are diseases which kills. The hospital-acquired infections kill patients, who would not have otherwise died. People at 60 years old who are diabetic or hypertensive, today he can live up to 90 years with medication. He should not die of COVID. So there are many preventive things we can do. Hygiene is really very important still. I'm not saying that the hygiene in that sense. So what I'm trying to say that overall, we should have very good primary care oriented family medicine and general practice at the topmost of the base of the pyramid. The base of the pyramid should be family medicine, GP, and primary care doctors. And this has to be done properly. Secondly, what the government has done is, government had economists, government had epidemiologists, government had virologists, government had cardiologists, respiratory doctors to make a policy. But what happened is, to make a unified policy, it does not mean you satisfied everybody at 20%. The 5 experts give 20% of economy, 20% of virology, 20% of epidemiology. That's not correct. What they should have done, they should have taken a bold step. We could see the government started off very well. I became an admirer of PM Modi when he announced lockdown 1 and 2, because certainly it has affected and brought down our level of infectivity. But under the pressure of various people, all of you know that government has relaxed from lockdown 3 onwards. And if you didn't have this, you would have had much better scenario today. Economy can come back faster if the lives are saved. Economy will go for a 6 for years if lives are affected. And I must tell you one thing, that we should have now a system in place, not a knee-jerk response to whatever happens. Every time Ahmedabad earthquake had happened, and then we had the new plans to make houses which are protected against earthquake. We should have all the plans in place, and I'm sure the government is now under a lot of pressure. And I must tell you, the government has done a good job in spite of the limitations, better than many other governments. But we could have done better, and we should have a total revamp of our healthcare delivery system, have more public participation, train people as volunteers who can come forward for any disasters. And thank you very much.
Right.
Makes any sense.
Dr. Desai, you've been nodding. So I want to come to you. Dr. Danda says that we have done well. Dr. Desai, you're muted. Now, Dr. Danda has said that there are a few things that our healthcare administration has done well in response to the pandemic, but we should be prepared with a plan to look ahead and be ready for that. Now, to your mind, when it comes to doctors' physical safety, their mental stability, and the resilience, what can we learn from others? Some, people, how do we prepare for the future? We would have seen somebody gone through something and learn from them. So what can we learn so that our doctors, our healthcare professionals, they are safe, they are happy, and they're resilient?
One huge disclaimer. One huge disclaimer. I am politically non-aligned and non-affiliated. But look at Kerala, look at Rajasthan, forget Delhi. Okay, so there are, like you're saying, Anisha, what can we learn from the world? Sure, and I'll come to that in a minute. But one doesn't have to even go far away from home.
Anybody, sir, not just
right. But allow me. Why I was nodding repeatedly is that my lifetime passion has been, and my generation, and I guess reasonably failed, in getting across what both these colleagues said so eloquently and so well, both Dr. Sanjeev Kumar and Dr. Danda, about what I refer to as humanizing medical care or healthcare. See, the human face of medical care or of medical education has been such a gap. And allow me, Anisha, you might not know, if I might take liberty, or you might know, but at least much before time, because it was much before my time. 75 years ago, Sanjeev Kumar साहब आपको याद होगा, definitely Dandari को याद होगा, Sir Joseph Bohr Committee report in 1946 spoke about two aspects: top-down approach and top-down. Please imagine, I still get gooseflesh when I think of. Way back in the mid-40s, this one gentleman and the commission were able to think of what are the three apex institutions that you want. All India Institute of Medical Sciences, Biomedicine, Hygiene and Public Health, Calcutta, and Mental Health in Bangalore, AIMH, which has now become NIMHANS. So that was the top-down approach. But even that's a bit aside. Bottom-up approach had only two things: communitization, and that's my word, but he said community orientation for both medical education and for healthcare delivery system. What both of you are saying so much on target. Somehow again, I mean, I get distressed, but I don't allow myself to be distressed too much so that it doesn't affect my performance and outlook. The progress has been very, 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 very slow. It's now happening. You know, the behavioral sciences in medical education that Dr. Danda was referring to, the human face, the interpersonal skills, soft skills that Dr. Sanjeev Kumar referred to. I won't say it has not happened, but it's happening too slowly still. And I'm at one level very impatient, especially for societal good. Like I said, I try to keep convince myself and say, okay, maybe a society or a nation like ours requires and operates at a different pace. You know, maybe we are not Switzerland or the Nordic countries or New Zealand or even the US of A, with all its pluses and minuses. So that was one take on it. The other thought that I had as I was listening to both these colleagues was, we as human race learned a lot from the HIV pandemic. This same aspect of the importance of social and behavioral aspects got at least somewhat generalized from HIV and AIDS to the rest of medicine and healthcare. To some extent, the fact that, you know, there needs to be some amount of behavioral science orientation, yet, my own sense, and I've been involved in NACO about all this work quite a bit, the attention that NACO or the governments or we as society paid to the HIV counselors was pathetic. In the National AIDS Control Program, the HIV counselors were up to 2009 or 10 being paid 6,000 or 7,000 rupees per month. And I should train them. Even now, the HIV counselors are paid about 13 or 14 or 15,000 per month. My unskilled houseman or daily wager in the hospital under the government of Delhi gets 14,000 a month. A master's qualified psychology or social work counselor for the HIV program gets about the same amount. So what I started with from the car about health in general, about the soft aspects that both these colleagues are saying so totally correctly, about soft skills and the human aspect, the behavioral aspects, all of human race and Indian society particularly has had this huge dualism. We will pay lip service, but when it comes to action, we cannot take bold steps. Having said that, the other difference, if I might put on the table for all of us to consider, is that see, HIV pandemic was all said and done. Now when you look back, operating at a moderate pace. That time it seemed like it was growing like a tsunami. Now we know through this epidemic what a tsunami of epidemic is. You know, last 3 months have taught us how a highly infectious disease can actually scare the entire human race. So now when you look back, HIV pandemic was at a moderate pace. And yet, all of health systems benefited somewhat in terms of funding, in terms of emphasis, in terms of behavioral science orientation, recognizing the value of privacy and confidentiality stuff, you know. Ethical issues came to medicine much more to the forefront only after HIV pandemic. So are there lessons that we are beginning to be willing to begin to crystallize that human race can learn from this epidemic, that healthcare delivery system can learn, that we in medical education or medical service delivery can learn and should learn? Like I said from the car, it's a transformative experience. Right? The world is never going to be the same again. But for us, in small think groups like this, larger, what are the lessons that we can crystallize? As you've all been saying, surely safety of the provider, at least at par with safety of the consumer, if not a notch higher.
Definitely.
The robustness of the healthcare delivery system, the service conditions being fair to the healthcare providers. Most importantly, the hygiene and cleanliness. And like I said earlier, this is a double-edged sword. For psychological resilience, I am very willing to argue that the East is better than the West. Like I keep saying, the collectivism, please be with me, the collectivistic society that India and South Asia are fare much better in disasters than the Western world ever does. Can I argue the same unidirectionally for hygiene and cleanliness? No, I can't. So our society will have to learn to say we retain the old values and patterns, but maybe we learn to go to Ethiopia at Habitat, and we learn to have the golgappas in a hygienic manner, not from the street side with that fellow dipping his hand in the. I do believe that for psychiatry and mental health, for public health, for clinical medicine, or all humanity, there are lessons to learn. And allow me to get what might sound philosophical, if not metaphysical. For individuals or human race, micro or meso or macro level, it's fairly easy to crystallize lessons after the experience is over. It's not too difficult a task, no big deal. The trick, it seems to me, is in crystallizing lessons to be learned when you're going through the experience.
Like now.
Can we right now, as human race or as a nation, we need to crystallize what lessons do we need to learn, how do we implement them, not wait for the COVID era to end. And to that extent, I really think, allow me to repeat, I think we have done all right. I think we have done pretty well.
All right, Dr.
See, doomsday seers will be plenty, Hannah. Sorry.
Dr. Kumar has a few words to say in closing. What would you like to say, Dr. Kumar?
Thanks, Anisha, and good to hear Dr. Desai as well. Let me take you back to tsunami. When it happened in 2004, I was posted in Geneva. Geneva is the relief capital of the world, and India stood out as a country which managed it very well.
On its own.
On its own. And they told everyone else, hold on, we have system in place, we will be able to do well. And thanks to the disaster management system which was put in place, and then we formally had a National Disaster Management Act, we have been able to address COVID-19 pandemic much better. And one of the reasons is we have this act, and in that act, to clarify what Dr. Danda said, we have a provision of dealing with outbreaks, and I train people in disaster management in the health field. So that's one thing we came to our help. And then looking at the silver lining, yes, there has been gaps. The cracks which were in the health system have become widened. We have seen those cracks, and no person less than a minister is now aware of the cracks we have in the health system. Hopefully, that will bring health and investment in health to a higher level. Many other aspects, the silver lining. My wife is a professor in a university. I see her every day taking classes online for the students sitting in remote parts of the country, remote areas in Bihar and other parts of the country, through their mobile phone, those who have access to internet through their so that's one thing which was in the coming but has been
now here.
I must have participated in at least 10 webinars, some for teaching doctors and some for general public like this one, and I have not stepped out of home. I'm in that risk age group, hypertensive and 66 years of age. So there are many things which have happened which we could not imagine can happen before the outbreak of COVID. It is private sector. We know 80% of hospital care in urban areas provided by private sector, 60 to 70% in rural areas. But they were always on the margin. And if you recall, they were on the margin for a few months after the COVID-19 outbreak took place. It was only testing in government labs, government hospitals when it was expanded, and then maybe later on when they realized they couldn't manage. So another aspect is that government can no longer close its eyes to private sector, and we have to mainstream private sector. It should be seamlessly passing on patients or people who need health care from public sector to private sector or vice versa. So these are some of the positive aspects I see, which we can learn from this pandemic. And I'm sure we have done well in the past. When you look at mortality indicators, life expectancy, yes, we haven't done as well as we should have done. But I was speaking somewhere and I said 2.2 million children in a year are dying, are prevented from dying, compared to the number of children who used to die in 1990. That's a huge number, more than 3,000 every day. So no, we are moving in that direction, but some of us get restless. I include Dr. Danda in that. We get restless. No, why can't we do more? Why Bangladesh has lower infant child mortality than India? Why Sri Lanka is way ahead in literacy and life expectancy or other parameters? We can do much better. So restlessness to current situation, and then why can't we do better? That's what is driving us into making some of those comments which may sound negative on what we have not been able to do. Thank you.
Right.
Sorry.
Dr. Desai,
Yes.
very quickly, we're now running out of time.
Okay.
Very
Dr.
quickly.
Dr. Sanjeev Kumar has actually prompted me much more. Thank you, sir. Especially about tsunami. Allow me to share quickly. In my lifetime till now, I have been to perhaps 25 or 30 bilateral Indo-US meetings. Forget the multilateral. The one meeting that I'll never forget was in Agra about disaster and emergency preparedness in 2005. Soon after tsunami and the what was that? One of those disasters in US. Yeah. And believe you me, sir, the entire 2.5 days, we were on the front foot. And the US team was on the back foot. Two major things. One, our own community and societal resources are humongously strong. And at least in terms of emergency and disaster preparedness, whatever we may say about our healthcare system and the preparedness, even civil administration, like you said, was very good. So we need to, and NDMA has actually crystallized that well. The other thing occurs to me, and I must share this, we're having a wonderful chat. It bothers me immensely when professionals or organizations or magazines go to town saying India is the diabetes capital of the world. India is the most depressed country. Bull. Pure bull. Like I keep arguing, because we are second largest in population, obviously the number of people with diabetes mellitus or number of people with depression is the largest or the second largest. Elementary, my dear Watson, I would want to tell them, you can't go by absolute numbers. You need to go by
percentages,
proportions. No, please understand what happens, especially in current era. And I keep saying this on all platforms. If I'm vulnerable to depression, biologically or psychologically or socially, and then I read the lead magazine article saying India is the most depressed country, what do you think happens to me? I only become more depressed.
I'm done for. That's what I feel.
You can't let that happen as scientists or even as responsible media professionals. Factually incorrect, sensationalizing stories is a huge disservice that also we need to do something about.
It undermines everyone's effort to, get the two. Thank you so much, Dr. Danda, Professor Kumar, Dr. Desai. Thank you so much for sharing with us your thoughts on how we can keep our medical professionals safe, motivated, and of course, how our healthcare delivery systems can also come up with with what we have right now, the infrastructure that we have right now. I'm going to hand over to Kamal now, who's going to take us to the next session. Thank you, gentlemen, for joining us.
Thank you so much, Anisa, and thank you so much, Dr. Danda, Dr. Desai, and Dr. Kumar. It is always very, it is wonderful to hear all of you always. And I was, especially pleased to hear that when you shared your, experiences of that our healthcare system and disaster management system could do better than that of US. And that is something which, I take as a silver lining, and also underlines, our effort of, expressing the gratitude for whatever we have. We have less, we can improve on it, but at least we have something which is helping us at time of pandemics, at time of diseases, and at time of crisis. So thank you so much for highlighting these points, and I believe our audience will also take this positive message around. And I do, fully agree about how we can avoid sensationalizing our, the facts or the stories, which sometimes does not give the right, the picture of what we are, we are as a country, or we are as a society, or as a system. So thank you so much. So now we take forward to the next level of our discussion. We are on a 60-hour-long gratitude marathon for doctors, for medical professionals, for workers, for everyone who help us, get the healthcare when we need it. We are on a second day of our effort. We had a wonderful beginning yesterday on National Doctors Day with a lot of most distinguished people of healthcare system joining us, including the MOS Health, Mr. Aswini Chobe, who gave a very good kickstart for this whole initiative. We are also demanding and requesting the government of India, like we have war memorials across the world, and we give gratitude and remember the the sacrifices of soldiers. Our doctors are also in the middle of a war, and it is a lifetime opportunity which has come on them, and they are rising to the occasion. Not only doctors, the whole healthcare ecosystem. And we are requesting the government to please think about putting up a gratitude memorial for healthcare workers and professionals who have always been trying to bring good health for our country and the society, and are fighting this war. I believe my fellow panelist and the speaker, it was duly endorsed by the MOS Health also, and he promised us that he will take it up to the government and will also discuss and request the Prime Minister if he can do something on that. I'm sure they can do that. And I will request my audience today that they too can join our campaign by signing a petition on change.org, and the link for that is available on the chat box of this live show. Please do go and sign this petition and show your gratitude and support for the healthcare system. We believe that by putting up a memorial, we will not only pay respect to the healthcare professionals, but will also make this public always remember that health comes first. And we need to ensure that we are taking care of that. Thank you so much, Dr. Nimis Desai and Dr. Sanjeev Kumar, Devasis Danda. Now I welcome Dr. Hema Divakar and Dr. Sanjay Pandey. Dr. Hema Divakar, a very, very distinguished gynecologist and champion of women health, had joined us from Bangalore, and she is also the former head of Foxy and heading an institution called Artist, which helps in skilling of women health professionals. We have Dr. Sanjay Pandey. He's a very senior urologist from Kokilaben Ambani Reliance Hospital, joining us from Mumbai. I have seen Dr. Pandey doing, some of the most remarkable community services, and have been seeing his, wonderful work which he has been doing in the area of urology and other disease areas. So thank you so much, Dr. Pandey and Dr. Hema Divakar, for joining us today. I'll begin with Dr. Hema Divakar, and she is going to have a very interesting talk today. And this talk is about this whole session, we have been hearing multiple aspects of our healthcare system. We have heard about the system deficiency. We have heard about, the extraordinary work our doctors are doing, and we have also heard about a lot of good things which we have. We want to now go a little bit more personal about how our doctors, how do they feel and what do make them, keep moving in their profession, which is considered to be a selfless service to the society, something which is near to God, and many times, comes with lot of inflated expectations. So I'll go to Dr. Hema Divakar and would like to understand from her in her talk that what makes her what she is, working for the women health, and what makes her or keeps her going as a doctor.
Namaskar again to Kamalji, Sanjayji, and all our viewers. So the title of my deliberation, which I chose on purpose because that has been the story of my journey from passion to purpose. Through yesterday and today, I think Kamalji and IHW Council has exposed us to a variety of the thought processes and perspectives of various leaders and the frontline workers, which has all the more strengthened our resolve to do more. So in healthcare, when yesterday, I think Dr. Sandhu said, as we mature and be over the hill, over 50 years, we slowly start recognizing that it is time to give back. Well, even before we mature, actually speaking, there are two aspects in this. One is the business and one is the service. So most industrialists, the businessmen, for example, they will look at what's there in it for me. Okay. And ultimately, when they reach some level of maturity, they say, oh, it's time to give back to the society. That is all about the CSR, or corporate social responsibility. So even they feel responsible, but maybe it comes at the defined point of time when they have something to give concretely, tangibly, to bring things to scale. The other aspect is the service aspect, where we as doctors think, not what is there in it for me, what can we do to make the world a better place? So in that context, okay, always I have been thinking bit by bit, what is it that I can contribute? And of course, what's there in it for me is a lot of look back satisfaction, which some people may think it's just crazy, but ultimately that's what a person needs and aims to. So if Himani will permit me to share my slides from passion to purpose. There has been a lot of personal experiences, which, as Dr. Nimish Desai just said, that there is hunger to do more. Okay. And also there is a recognition that, yes, not too bad. We are working under all kinds of constraints, but still we have to manage to get so far, and we have to move still more further. When he talked about the media saying India, diabetic capital and suicide capital, and these many depressed people, there's a cue we have to take from that. Yes, it is our job to showcase the positive stories to reach everybody. Because if anybody from the West is challenged to manage our situation, if they may be seeing just 5 patients in 3 hours, just imagine when there is a limited access to healthcare and there are about hundreds of patients that a doctor has to see in that same 3 hours, how quickly, how innovatively his or her mind has to work to spin things as fast as he can, because he has to do his best for the community that has reached out to him. So our journey from passion to purpose also began because of the underlying hunger to do more in the space of women's healthcare sector, and the big vision of bringing some of our initiatives to scale. So our organization, as Kamalji mentioned, is called ARTIST, which is Asian Research and Training Institute for Skill Transfer. So what do? Research and Training Institute. So obviously the research and the training. So research is not research, it's the implementation research. Actually, when I was interviewed with the media in the early part of this corona crisis, I said, no, we have to do something innovative. Oh, what more innovative can you do? She asked me, because this whole information about corona is just 3 months old and nobody has a clue what to do. I said, whatever is known, when we have to implement it, we have to find novel methodologies, innovative methodologies for implementation. So we are focused in our research about implementation science. We have our own ethics committee, have some publications, have got some policy changes working in small sectors in rural Karnataka, but taking it to scale with our parent organization, Foxy, to diversify this pan-India and set our goals as to what works for us in India and implement it to make that happen. So the CME Excellence Award, etc., have only increased our responsibility to do more with an entrepreneurial spirit, implementing the innovations and also taking it very, very proudly to the rest of Asia. You would see the Health Minister of Sri Lanka signing our document on a novel, simple, one-step test for diabetes, which we are using in India, and it has been taken to the rest of the South Asia as well. So research is one. Training is the skill transfer. Training is not about only giving some certificates with a piece of paper, but the skill transfer, which is truly standing as a testimony to the confidence and the competency of the healthcare providers. You are only one person in the team and you can't do it all, and you can't do it always, and you can't do it everywhere. So we need a whole battalion of our task force. When the government makes many task forces, yes, it is the task of the thought leaders to give the tasks and disseminate it with competency and confidence to the rest of the people in the chain who will execute it as well. So the Artist Skill Gurukul is a center for skill enhancement based out of Bengaluru and recognized by our parent organization Foxy and some of the other international organizations as well. So our philosophy has been to connect and collaborate, the energy and passion to convince others to join, to connect and collaborate, and discipline to align our strategy with financing to build up to a sustainable and a scalable model, because everything cannot happen just because of passion. If it has to stay on, and if other people need to be involved, and it has to be a pan-India, millions of things to be done, then it needs, as I have always joked with Kamal, the vitamin M, somewhere, some support from the CSR to fulfill social responsibility. So research and skills, but the main vision is to translate the research into practice on the philosophy of empowering women, educating the girls, moving towards tomorrow. If we are thinking about yesterday all the time, we can't have a better tomorrow. So we need to work our way forward, however fast, however slowly, but we have to move forward. So the health and hygiene initiatives in schools, the Parivartan or the change of mindset and decision-making program in colleges, the diabetes awareness to action movement, the Sweet Heart Initiative. Sweet disease today will lead to a heart disease tomorrow. So that is the Sweet Heart Initiative which we launched, which caught the attention of many young people who recognize that what we are talking is about something long-term, something which has become such a familiar word, the diabetes, because every family member seems to have one diabetic. It pinches their economies, it pinches their mood swings and mindset, it makes them less productive, and it carries a lot of burden just beyond a disease process. So to resolve and solve every problem that we can with our might, no matter what, and persistent efforts, believe me, 1,000 times we will fail. But that should not put us off, because this is a very diverse country. What works in Karnataka will not work in Uttar Pradesh. So we have to model it a little differently, because there are a lot of, when you see the differences in culture, food, practices, and the languages, you can very well imagine that there will be something that we have to tweak and work out a little differently. So from passion, crystallized into a purpose, because we wanted to do a lot of things and a lot of sectors, but we need to focus. Yes, and the focus, as how it has been elaborated in the quiz program going through the day itself, is the ABCDE. We just hit upon this acronym because we want to address the girls and women at every age in her journey through her life. So to prepare the adolescents, investing in the youth, which are our future for tomorrow, making them healthy and prosperous, will produce a productive nation beyond reproduction. Yes, we have lots in the country, but we need to empower with good health to do more and to do better. B is to build the contraceptive choices, because again, the population explosion really is an underrunner of many of our problems, which needs education and empowerment of women to decide the family size, etc. The cancer cervix. In the West, only 300 women per year die out of cancer cervix. Why should 70,000 women in our country die out of cancer cervix? That is a lopsided proportion. So we need to work our way towards the preventive aspects. Diabetes. We just heard Dr. Desai saying, and our campaign has been, don't allow India to become the diabetic capital. We don't want to declare India as a diabetic capital. We have to get a handle around this problem and do something better, do something more in early detection, prevention, those aspects where we contain this menace, because even in the corona pandemic, the maximum mortalities have been because of those with diabetic and cardiovascular diseases. And essential obstetric care. We strongly believe, as how I told in the opening remarks yesterday too, we should not allow mothers to die while giving life. How can you accept that she loses her life in giving another life? So this sentimental thread will have to be magnified many times, because needlessly we are losing mothers. We can do some simple things, as how I will elucidate as how we move forward, which will bring about a lot of difference in saving lives. Sanjeev ji just said why Bangladesh should run ahead of us, why Sri Lanka should run ahead of us in the infant and maternal mortality containment, why we have not been able to achieve. Well, in keeping with the SDG goals, universal healthcare, reaching it to everybody, is also aligned with another goal of education, is also aligned with another goal of gender equity. Everything has to come together. It is again not in silos. Just by tackling and skilling some people, we cannot achieve anything. It has to be integrated with so many other things which we have to think holistically. So what have we done and what more we want to do? So anemia care, we said, well, let's fight out the anemia. Let's put her in the best of health. So girls and women, 4 lakh girls in the last 2.5 years. But dear friends, there are 330 million adolescents. 4 lakh is no number. It's a big number by itself, but we are not going by absolute numbers. We are not fooling ourselves that we've done a great job. We need the connections and collaborations to do more. Maybe Kishori Swasthya Yojana, where we have to see that no girl, no women should be left anemic in the country. Parivartan is another massive fight against population explosion. Hashtag who decides? Because oftentimes the women are not empowered to make the decision about the age of marriage, about time to have children, or how many numbers of children that they would have. So building contraceptive choices and preventing 15 million abortions per year. Be the change, we say, educating the girls so that they can decide to have their pap smears and the HPV vaccine. Well, diabetes, which is one of my very strong passion areas, we say, let's move from awareness to action. Let's move from illness to wellness. Pehla Kadam. Yes, interestingly, Pehla Kadam is a project which we have borrowed from Pakistan, our neighboring country, which had this, take the first step. Test all pregnant women to check whether they have high sugars in pregnancy or not. So defeat diabetes. Don't let India be the diabetic capital. Bacche ko pata hai, this test has to be done. So we are creating this bus so that every lady who goes to the antenatal care, nowadays the proportions of them asking the doctors, "Are mere sugar ka janch nahi kiya aapne?" So that is the kind of change with the awareness that we are bringing about. So the SDG goal 3, health and wellness. The ongoing COVID-19, dear friends, you will agree, is creating the biggest health, economic and social crisis the world has confronted in the living memory. When it ends, it'll leave behind a bruised and battered health system, economies, individuals, and the families and the societies at large across the world. The biggest impact, no doubt, will be on the economy and health system, and there will be a need to reassess our priorities in health. That's why I told Kamalji, when the memorial is built, people will also recognize that health is wealth. Jaan hai to jahan hai. That is also the key message that the memorial will be giving, because the spread of the highly contagious COVID-19 has taught us how each one in the chain have to be responsible for their own health. Population health, disease surveillance, preventive care, which are most likely to dominate the agenda of international development agencies as well as our local, region, and national development. So we at Artists want to do more and more. See the change in the women's healthcare, because that is our forte. As how I had remarked yesterday, the key time is the pregnancy, because you're programming the little one in the womb for the generation next. We were told that we are taking care of two lives, the mother and the child. But now we are told we are taking care of two generations, the mother in the postpartum, long-term period, and the little one in the early adulthood. I believe a lot has been done and we have come a long way. That's the positive note, but we have just made a beginning to prevent illness and promote wellness. So what did we do in the COVID times? The closing is with the action points taken. Again, I would emphasize, let's not ask what others have done. Let each one reflect and see what we can do. And the moment we recognize that the COVID preparedness is required, there's no use just saying we are COVID warriors. How to prepare these COVID warriors? So we tied up with the Rajiv Gandhi University of Health Sciences, and 3,650 staff nurses span Karnataka on the digital platform, guiding them on all simple implementable changes in their own settings. Private hospital associations joined hand with us for the advanced courses. We had the photographic evidence of how they have changed in their own setting, how the security is behaving, how the consultation rooms scenario has changed, and how the intensive care, the idea to the OBGYNs about prevention, about early detection, when to transfer the patient, and how to manage the deliveries. Everything can stop in a pandemic, but not childbirth. The UN has declared 20 million births are going to happen in India in the next 6 to 8 months, and we have to battle with that with the utmost care. Similarly, the task shifting, 1 million frontline healthcare workers for 30 million safe deliveries, because you should never die just because you are living in a rural remote place without any access to healthcare. So training the paramedics from interiors of Rajasthan, Assam, UP, Karnataka, Tamil Nadu, Maharashtra for saving lives. Actually, nobody is allowed to sit in the class. Everybody has to go to the skill stations and keep doing and repeating. I often give them the example of the oxygen mask which dropped down in the aeroplanes. The several times that we would have heard about how to wear the mask, what to do, etc., which the hostess says, but unless once you do it yourself, you may not be really skilled to do that. So again, our concept of connections and collaborations, the public-private partnership, we believe it's important. If the matter is so important to you, you will find a way. Otherwise, you will just find the excuses. So with all the organizations like JAPIGO, like FOXY, MacArthur Foundation, MSD for Mothers, the nationwide movement of Manyata to respect and give quality of care to mothers, digital platform training, which we started 2 years ago, it has caught on like wildfire now, because everybody is onto the digital platform. Because 2 years ago, when we started this, nobody would trust us that we can transfer the skills through these. And just look at us today, talking to so many of you face to face, but on a virtual media. Not underestimate our rural women. They are very much more tech savvy than what you and me think. And there are many messages that can cross to them and guide them as to their own healthcare behaviors. And we believe that for diabetes, it will not be a new insulin, but it will be a digital technology, which will guide us the way forward. Coming back to my last 2 slides, which says that maternal and child healthcare, you may think it's all about women, girls, and you're just delivery process and there it ends. No, there it begins, because the new era of NCDs, the tsunami of NCDs is actually originating from here. So the cardiovascular diseases, the cancers, the diabetes, the chronic respiratory ailments that you see today have begun long back when your mothers were carrying you. So the maternal offspring health and the future NCDs need to be linked, and reproductive healthcare, as in the women's healthcare and the girls' healthcare, have to align with the NCD prevention and access to universal healthcare. Everybody has a role to play. You too can make a difference. So join us. And at the end of this whole process, you may still ask, good health and well-being? Oh, what does that really mean? It means something like this. The health and well-being of all people at all ages lies in the heart of sustainable development, and that's where we want to go. And it's my vision, collaborate for actually implementing functional health and wellness centers under the Ayushman Bharat scheme, where many, see, there are so many stakeholders to be involved in this. So let's join hands and do our best, ensuring healthy lives and promoting well-being for all ages. Many times we say, connect the dots. I would say to Kamalji and others, it's not only the dots, it's the circles, it's the triangles, it's the pentagons, and it's the squares and the rectangles that we have to connect. So almost every sector we need to connect and collaborate. So to ensure healthy lives and promote well-being, moving from passion to purposeful, targeted, focused initiatives which are implementable and will make an impact, we humbly submit that there is more to understand, and of course there is much more to do, and we are ready, and we believe that together we can do it. Thank you very much for this wonderful opportunity, because every time I place my thoughts in front of you or the audience, it re-emphasizes my resolve that I have made a public commitment that we will do more and we will ensure that we will walk the talk. Thank you very much.
Thank you so much, Dr. Diwakar. It is always very inspiring to hear you and the kind of grand purpose you have built around your passion and your practice, and how starting from as a doctor you have started the whole movement of taking health and well-being to almost every segment of the society, especially women and adolescent girls. Now I'll move on to Dr. Sanjay Pandey. Dr. Pandey, I believe you are with us.
I'm with you. I'm just trying to get back and look at this was a presentation to hear, and I'm very impressed with the way we heard the entire journey which she presented. Am I audible to you? Am I visible to you?
You are very much visible, and your audio is also very good, and I can see so many of I think degrees and certificates and then the achievements of yours, and I'm sure that what you have been doing, and I think we know for last 10 years almost, and I'm sure the work which you are doing is also being duly recognized. So here I present Dr. Sanjay Pandey from Kokilaben Ambani Hospital in Mumbai, and he will be sharing his ideas and his thoughts as a doctor, what keeps him moving, what is his thought of from passion to purpose, and what gives him biggest or happiness when he treats his patients. So Dr. Pandey, over to you.
Good afternoon, everybody. At the outset, Kamalji, you and the entire organization, I think it's a very emotional story to be given a chance to be speaking about yourself. When did somebody ask a doctor, how are you, doctor? But the era has changed, When people walk into the clinic, they first ask, how are you? And the question goes back reverse, how are you doing? What brings you to the hospital? So I think when we look at this entire aspect of give and take, it is important today on a very Thanksgiving day to be able to give back to everybody what they deserve. To the platform that you have created over years, which is holistic in terms of getting to the society so positively, so P for positive. And as she raised the topic of passion to purpose, I think I looked at positioning of all this above in today's healthcare. Passionately, over the next 10-15 minutes, I want to take you through some slides. It's about just to give you a flow about a personal journey and evolution into this subject, experience that we have over the last 22 years in urology and allied specialties we started. The evidence that exists, which helps me to work, and as she said, it's all about evidence-based medicine today. And finally, the expectations of individuals who expect that from you come as patients across the table. But remember, they are partners to us in the society. So today, we hail your entire effort in the last 2 days and over the first 7 days of July. We also hail the effort of all colleagues who have joined us today to take the stimulating talk which just happened. I'm very impressed, with the kind of passion that she has taken forward to the highest possible level. So passion to purpose comes with a little bit of change, and I want to give you a little perspective before I move forward. It possibly is an epoch-making day today to be relating my story in the subject that I've taken so far, and the one which I call as a journey of 1,000 miles, which started as a single step when I started working in urology quite some time back in CMC Vellore. But the single step which I possibly got to take was a single step of default. That means a step of crash expectations when I did not qualify for my engineering entrance exams in the era 1987. Way back in this golden town of Rourkela in Odisha. And medical entrance came by a hard work that followed at that age of 18 in the dream town in Rourkela, where I was born to parents, an engineer father and a homemaker mother. So that was a cosmopolitan and happening in a vibrant town in that era in 1987, where my foundation was created from possibly would be an engineer to a doctor. I've never looked back since 1987. So it took me from Odisha, from SCB Medical College, Cuttack to Tamil Nadu, to CMC Vellore and to JIPMER Pondicherry, moving from the MBBS to the MS surgery days to MCH urology. And then I moved into Sri Ramchandra Medical College, Chennai as an associate professor in urology for close to less than a decade before I did my first and possibly the only job change, which brought me to Mumbai to Kokilaben Dhirubhai Ambani Hospital 12 years ago in 2008. That's how I had a small stint in AIIMS, Delhi, and also in Rajiv Gandhi Cancer Institute in Delhi. What does it mean? It means that I was born in East, I studied in South, I had stints in Delhi at AIIMS and Rajiv Gandhi in North, and I finally now serve to be as an Indian like all Indians in the West. So I attempted to look at understanding the subject and the country in whole. So my purpose of the entire passion is to bring about positioning of the entire aspect. And to bring you that today, friends and society, which has actually come in large numbers for a program that you have created for a Thanksgiving. I carry greetings from Kokilaben Dhirubhai Ambani Hospital in Mumbai, where we follow a motto, every life matters. I think it's not our motto, it's everybody's motto, it's your motto too. So everybody follow the same motto. So today we are here and such a wonderful tour of luminaries who are actually discussing the way healthcare could be taken forward in the crisis that we are in. Very candid confessions which have actually come in around. Is about to improve the quality of life of every individual, and every individual matters. So individuals who come to the hospital happen to be patients and they need to be treated. While healthcare has moved into the hospital, healthcare should move out of the hospitals to the society. That's where you have got it. You have actually taken it forward to the highest possible level. I heard some interviews you took in around where you actually took this very social cause of promoting health to the society, which means a wake-up call to individuals who may be suffering through something, but will not be probably looking at getting to a doctor at this point in time. What does a doctor deal with? He deals with two important things. He possibly deals with life-threatening diseases like the trauma and the accidents. He deals with cancers and malignancies which spread and probably take away your life. On the other aspects, he deals with quality of life issues. What are they? Something like incontinence of urine in my subject. Something which you gradually postpone around. My black hairs are turning gray and I'm not very bothered about it. Why? Possibly it's a very gradual and a slow change. Came March and we suddenly, with one clap, the whole lifetime change. It was a tectonic shift in the world which a civilization never saw. It was a sudden onset change. Compared to a gradual change which happens in quality of life diseases. For example, somebody lives with incontinence of urine in a diapers for a decade and then comes and sees a doctor. Is it important for you to live for a decade on this? Is possibly not. And that's where the quality of life which individuals suffer for multiple reasons, that needs to be taken forward. And that's what the change it is. So I show the U to you because dial U for urology, that's my subject. but every bend that you have to take in the road is not the end of the road. That means we as human civilization, we as doctors, we as a society have moved together, and probably in good congruence, we have not failed yet to make a turn, the turn that is required for today. For example, if I look at my colleagues, COVID warriors in this hospital and smaller hospitals and all cities and countries in the world, I know what they're going through, what their family goes through around. That means all doctors who are serving you today, while you stay home and stay safe, which is the motto that we need to follow, spontaneously each doctor puts in his hardest best, and that he has always done. It is only probably we are waking up in Corona times to understand that many front health workers actually take a real life threatening at themselves to take it forward to the highest level. So in other words, in my journey in the last 22 years in medical science, which now comes strongly based with my foot on the ground and my head on shoulders, understanding diseases and patients in these years, the message has been very loud and clear. A human being could dance to a tune of his dreams, improve his quality of life, take the goals to such high levels around, possibly if he could meet his doctor and complain in time. Sadly, we don't do it, but it's time for us to wake up to this important aspect. So while a doctor balances his ethics, he looks at preserving physical and mental health of individuals and looking at quality of life issues. He controls that without a compromise. It means he always thinks out of the box to what you complain. If you come and complain about fever, that could be a bother to you. But the fever could be resulting from a pneumonia or from a malaria or from a tuberculosis. So he has to go deep inside and search the cause. That means he has to balance your complaints, pick up the diseases and treat it. And this is something which I'm not saying new. It's been 1,000-year stories. So thinking out of the box in today's era when newer diseases are coming in around is where the wake up is to possibly partner, and I think we should all partner. In the era before, we had miles to go because we were on an acceptable therapy. But we knew that what got us here to January and February 2020 would not take us to January and February 2021. We are in very crucial times at this point in time. Each individual in the society has done his bit. For example, remember, hand washing was only known to healthcare. Now we all are obsessive, compulsively washing hands every 20 minutes. Mask was never known to even physicians. Only surgeons used to wear masks, and anesthetists and doctors and nurses inside the operating room. Mask has become a way of life. So to accept something as a way of life today is possibly a way to move forward. I think we should look at a teamwork in all aspects we can do, because what we could contribute is what is important. And therefore the teamwork is what I'm looking forward in a subject which is probably shrouded, a subject which is a little hidden, partly because urology is something to do with urine, with kidneys, and possibly people did not take so much of heed because dekha jayega jab zarurat padegi to. That's not what it is. We need to be prepared for, I think this pandemic is waking up to be prepared for future around. So we will do teamwork to take it forward to the highest possible levels, because the dark clouds which looked very dark in March and April have actually gone away. You've got great sunshine right now. I can tell you, we are also glittering because of the hard work, which machinery could include everything that is helping to stay us home and safe, is making India glitter. It's making India glitter. And obviously, the medical community is just a bit, and there are so many communities we are taking care of. Just don't forget that our northern and the northeastern, the western borders are being taken care of so amazingly. So there are frontline workers in all aspects. But when it comes to health, you live only once. All who deal with health, which includes those people who are sick and those who treat you, today is a wake-up call. Life comes to a full circle of a disease which evolves, does not hit you on the day because you have had trouble for a long time. So the evidence and experience of medical fraternity and mine is about matching the expectations as early as possible, and it can always be faster and better. So journey that has been for me has been on ethics and on empathy, which is still evolving. I'm 22 years in urology, and I know that we can make sweeping and fascinating changes when we partner society, and that has been proven by so many ways. Mahatma Gandhi said, and I think he lies up there, in my room up there, and he says, "My life is my message." That means that's a very, very strong statement. I mean, you probably keep it on your laptop all the time and you know what it is. But if I look at 2020, the health burden and challenge, both of them are becoming bigger. The burden is becoming bigger because of newer diseases and advanced presentations of diseases. The challenge is becoming bigger because of umpteen needs and reasons, because of the kind of requirements, the kind of healthcare requirements and infrastructural requirements, which you possibly have never thought of. We Anybody alive today in this entire civilization never knew that we will be hit so hard and we would see a pandemic of that kind. Friends, the bad news is that time flies. And we'll be coming very close to it very soon. But the good news is each of you is a pilot. Each of you drives your own plane, which means good things take time, but the bad things when happen around, it's time to take help. It's time to move forward and look at this burden, which is only getting bigger and bigger. My subject is only getting bigger because of the shroudness of shame and postponement. Look at what I deal with. Every doctor deals with a huge amount of subjects. So I deal with people born with trouble, adolescents who are growing with hormones and organ changes, adults who live with problems, epidemiological diseases, and I'm sorry I put females on the bottom, the females come at the top out there, who deals with urinary problems and they don't know where to go to. A woman at home is a homemaker. She takes care of her in-laws, about her children, about her husband, about everything from home, and also carries her passion to pursue the work that she probably was decided to doing it. While she doing so, she suffers with urinary incontinence, stress incontinence, urinary infections, painful bladder syndrome, and possibly doesn't get the right chance to see it. So as we really heard from the erstwhile speaker on women's health needs to be empowered, and I think we all combine to empower. Are you aware that 1 in 4,000 individuals will be born with only one kidney? That means if you have only one kidney in your lifetime, don't panic about it. That means it is good, and it's possibly that one kidney is good enough for you to survive. And that happens to be my motto when I go every year to talk about organ donation program. Remember, there are end-stage renal diseases, end-stage kidney diseases, end-stage heart and liver diseases around, where the organ has taken it to the end. In kidney diseases, if there is a kidney failure, you can still go and undergo a dialysis. But what happens if there's a heart failure and liver failure? You only got this much time left because you will perish. There is no dialysis for a heart failure and a liver failure. For a kidney failure, imagine what happens around. Somebody has a renal failure, he undergoes a dialysis, and dialysis is only a stopgap management. It is not a cure. Let me use this platform to make people aware that dialysis is only a stopgap management. Don't take it for a decade of therapy. The cure is an organ transplantation or a kidney transplantation. So there's a possibility that one individual who wants to donate a kidney to his father or brother or sister sadly could be born with only one kidney. So imagine how lucky you and I are. We are born with 2 kidneys, 2 hands and two eyes. So we are so lucky. There was an individual who flew in all the way from United States to donate to his brother. When everything was being done, the first thing is a sonography, and we found only one kidney. We did a CT scan and DMSA scan and picked up only one kidney. We understood and said, sorry, you can't be a living donor. What does it mean? The organ donation program and this entire issue about life is about the organs gifted to you in this era. When you go, you possibly could give those organs to somebody else. There's only a gift that you can give to somebody whom you don't know. Whom do we give a gift? We give gift to somebody whom we know, number one. Number two, when do we give a gift? We give it only on anniversaries and birthdays. But imagine a thrill that I and you can carry. If we agree to give a gift to somebody, at least agree, I'm sure we'll not be so lucky enough to die in an intensive care unit where an intensive care team will be taking care of us and possibly be maintaining our organs, which can be then transplanted to somebody. But at least the very thrill of signing an organ donor card is good enough in lifetime to be so altruistic that I am an organ donor. Wish in my life I could be donating something to somebody whom I don't know. So this is very altruistic thought completely wrong. So somebody could be born with one kidney. But just trying to take you evolution into all. Men go through changes around. For example, in my disease process, there are at least 2 things which I want to bring in. Women live with incontinence of 2 kinds, leakage of urine. One could be when they cough and run and jump and walk stairs, they leak urine. This happens in the prime of life because of hormone changes and pelvic floor changes. On the other side of men who undergo a hormone change where the testosterone brings about a prostatic enlargement and obstruction to urinary flow. Both these changes are very slow. And please believe me, people who walk into my room between 50s to 90s are suffering for it between 1 month, 1 year, and even 10 years and continue to live with it. Imagine you and I don't get up even once at night, but elderly people get up 2, 5, 10 times at night. It's such a sad story because nocturia or getting up multiple times at night is a sad story. Health awareness should be that there is something called in World Health Organization World Sleep Day. That means March 17th every year is an awareness day where please sleep soundly and nurture life and regenerate yourself is an important aspect. And similarly, then something called as a World Bedwetting Day. We never knew all this. Last Saturday of every year is a World Bedwetting Day, which means children between 6 to 15 years should stop bedwetting. They should see their pediatricians and urologists in time. And I would use this to articulate way in 2017 to open up a clinic for nocturia and bedwetting, for quality of life issues, by putting out very sound and a strong statement that nocturia and bedwetting can be treated. And people walked in. 9 patients walked in from a place called Thane, which is 2.5 hours away from Andheri, which means 2.5 hours away by flight to Bombay to Delhi. People came in and said, what did you write? Did you say you can treat? I'm living for last 6 months, or last 2 years. My daughter is about to get married and she's still bedwetting, etc., etc. So quality of life issues can be sorted out. That I deal with reconstructive urology. I also am in a social platform and domain to look at awareness of all aspects which I deal with. 28th November 2019 was an epoch-making day in the history of this country, where individuals who don't know where to go to, not because of any fault of theirs, but because they are born with that kind of a brain wiring, which they think is right and the world think is wrong, finally got what WHO had actually talked in 2016. This is a step forward in India today that a transgender bill could be passed. I'm deeply involved in transgenderism and gender reassignment surgery of male to female and female to male, something which is being accepted across the world, and I am an Indian representative to WPATH. I've taken this forward to the highest possible level to take it to a documentary movie, which is there by a 20-minute documentary, for people to know that Anna had a lifetime issue about society and about parents and about peers. So friends, we are all motivated. It's a motivation which brings me here. The passion to do something brings me here. These are all big motivators in the country and the world who actually take you forward around. So the motivation comes only when you hear somebody else's story. It actually makes a difference around. So my his life was his message. My journey is my message. And what do patients say? I love my doctor. I love my gynecologist who takes care of my wife and my children and my young daughter. I love my urologist who takes care of my father's prostate. And we love our doctors because they have done the job. They work on. There is no 8 to 5 job, please. The day ends when the last ball is bowled. That's how we work around. Happy that my passion has a purpose all the time, because every life matters. We've taken it to very high levels. It is important to balance this and take it to extremely high levels. And that is what I did talk when I did give a TED talk on a subject that I'm following. So to me, it's a take-home message. That means every patient tells a story. Every doctor lives the passion, and that's his only purpose. His purpose was to serve. He continues to serve in the capacity he can do best. Dedication and inspiration need to be recognized or rewarded? Not at all. Nobody wants to be recognized and rewarded. His reward is when the patient gets well. His reward is when you get a thank you on 1st of July every year. So it's an ultimate sacrifice that a doctor does in very unearthly hour and unearthly circumstances. When we snore at night, there's a full emergency care happening across the country at this point in time, where COVID warriors take task to help people out. So COVID warriors are doing their best. Doctors continue and will do their best. It's only faith which can move mountains, and your faith in doctor has possibly taken it to such high levels. So when I understand that we can do this together, impossible is what about I am possible, or we can convert impossible to possible. Finally treatable and finally curable. In the words of erstwhile President of the United States of America, yes, we can, it's not me. We is stronger than I. I think we always combine together. And to my senior gynecologist colleague right now, we know that we are partners in pelvis. We require each other all the time. We cannot do without each other. We complement and we work each other, and that's how it is. So that we understand health preservation in these years, as I said, quality of life is important and life is in your hands. It is important today to bring healthcare to the front row seat. Don't leave it somewhere postponed. Behind every successful man is a woman, and behind every successful urologist is a gynecologist. Behind every successful minimally invasive program that we do, it's an intricate man, machine, and medicine, which takes a revolutionary task to help you. So I think we combine a man, we combine a machine. Machine could be a robot or a laparoscopic or an ultrasound instrument, which a doctor uses to take healthcare to the highest possible level. And the medicines which are Make in India campaigns are great. I always believe in awareness, and good news story. I wish we could have good news like this every day. Awareness on various aspects and diseases is an important aspect. Friends, as I come to close, it is important to understand that we are today living in an era of stress, an amazing stress that we all are combining together, and we're thinking out of the box. We are staying safe, we are staying home, our cars are still biting dust, our offices are all closed, our bills are changing completely. that stress is invisible. We're also living in an era of innovation. We have learned to live into so many new things. Where could I, without Kamalji's help, reach the entire country to be able to talk to all of you in the society and tell you that it may be an era of competition, it may be an era of evidence-based medicine, an era of anonymity of disease and data. But we promise you, as doctors in this country, to set very high orders of safety and very high orders of evidence-based medicine in Indian healthcare. It's important that your participation becomes a game changer. Because only when you arrive to a doctor's platform and say, I have a problem, the doctor would decipher and probably do A to Z to get you sorted out. So next time in my subject, if you think of prostates, kidney, uterus, stomach, etc., if you think of stones which could be gallbladder or kidney stones, if you think of urinary incontinence or fecal incontinence or anybody in diapers, if you think of reconstructions, which I do, which is niche area, some surgeries I do last 2 hours and some last 15 hours non-stop. If you think about urology, gynecology, oncology, and cardiology, you are thinking about life-saving, life-changing, life-extending, life-modifying treatment for both critically sick and needing patients, because you're bringing them back to active and full life. Please think of yourself. Please think of yourself. It's important time to think inward, because you are the game changers, because each of your lives matter. So for me, awareness is a need today. Management has always been a dream team work. It is we who's stronger than I. I believe in implementing it. Though it's a challenge, it possibly will be taken to highest possible levels. Friends, every patient also has a story. It may not be right to tell any patient's story, but there are patients who have actually gone back and have written a message and note after a month, after a year, and after a decade, saying that that important step you took to change my life with that healthcare work you did changed me completely. I come back to probably salute you today. So as you salute doctors around, as we salute each other, because doctors salute patients who come in time and probably reach them out around. This platform which has been created today is probably an awesome platform. I've never spoken from this platform, Kamalji. This is something which binds me to India together. We are on all aspects at this point in time with the country as doctors. We know that we can do well. We can do well with your help. When the machinery at this point in time, which includes everything I would not name, government, etc., and our leaders, I think is important to team up with. We will win this war, which is going to take a toll on the entire healthcare, obviously. But I'm sure we are doing better and better. I think it's time to call it a day, because it is my end, and in my end is my beginning. I salute everybody for allowing me to have the passion which I've followed to a purpose which continues till the last ball is bowled every day. Thank you so much.
Sorry, I was mute. Sorry. So thank you so much, Dr. Pandey. And it was really fascinating to hear your story, beginning from a humble start of Orissa, and then how did you take this whole journey and are now one of the finest and most vocal champion of urological health and many other. And I have a lot of stories, and I would like to share some of them, which gave a purpose to us also. But before that, I would like to hear from another a great personality who is now actually helping this society on the front line of this COVID-19 war, and leading the whole team of Max Smart Super Specialty Hospital in Delhi, the whole COVID-19 response team. Dr. Arun Diwan, Senior Director, Critical Care and Associate Director of Internal Medicine. Dr. Diwan, am I audible to you? Dr. Diwan, your voice is not coming. Is your earphone plugged? Your voice is not coming. I think he hasn't connected with the voice. Maybe at the time of connection. I would request Dr. Pandey and Dr. Diwakar to bear with us.
Sure. At the end, Kamalji, while I thank you, we thank our teachers, we thank our parents, we thank our beloved wife and kids who actually bear with us while we take our passion to actually study, go to medical colleges, rise up in the Achillean from a specialty to a super specialty, and reach such levels where society allows you to probably do what you can do best. So I think it's a huge Thanksgiving while doctors are being thanked around. We thank our families back home. We thank our parents. We thank our teachers who actually gave us that level. And we also thank our colleagues in practice, our own teamwork that we create.
And also, Kamalji, one more important thing which Sanjay ji said, that we work for you is a no-no. We work with you is actually the way forward, because it's really collaborative in every sense. With whomever we are connecting and collaborating, I think the synergies will get us multiple times more ahead with greater speed and greater quality to achieve what we want, because this is such a big country, and enough is not enough is what we are forced to think every time, because it's just if a handful of patients are walking, just imagine, Sanjay, there will be thousands of poor like that who by chance may have read your article but can't access. That is
I'll come to one of that story also, Dr. Divakar, and that's what I wanted to share. And it's about how lives are changed even by one article also sometime. Dr. Divan, am I audible to you?
He's now joined here.
Dr. Divan is new.
Okay, so he can hear us, but Dr. Divan, we are not able to hear you. And
yeah. So is there any way he could connect to the audio, please? He could connect with the audio.
I would request your team, if अगर वो सुन रहे हो तो अगर किसी दूसरी डिवाइस से या मोबाइल फोन से कनेक्ट करने की कोशिश करें. Himani, could you please help Dr. Divan's team to get it connected? I think he is normally during the day in the COVID related work. So,
Kamalji, yeah. I also need to, while we're waiting for it, I need to actually, Dr. Hema Devakar's very important topic of passion to purpose. As a doctor or for any other fraternity, while Dr. Arun Divan comes over, professional success is achieved only if you are passionate and have a very clear and well-defined goal. That means you may not be knowing your goal in the beginning. You have some kind of a movement around. I never knew I wanted to become an engineer. I worked hard to what I wanted to do. So if you follow your passion, it will lead to you to the purpose. Hema, that is what you have done. You're led by the front. You're led the foxy by front. I think Dr. Arun is around.
Can you hear me now?
Yes, sir. Yes, sir.
Yes, sir.
Am I audible?
Yes, sir.
Sorry to have kept you waiting.
No problem, sir. Thank you so much for actually sparing time. I know you are doing one of the most critical work, and it is our privilege, and we are really grateful that people like you are there on the front line of this pandemic response and helping us protect ourselves. Dr. Divan, today's day, so as I told you when we talked earlier also, this is a 60-hour long, 7-day long gratitude marathon we are doing, where we are trying to showcase this the collective salutation and gratitude for our healthcare practitioners, workers, and everyone who is involved. And since you are on the front line itself, I heard that you are leading the whole team there at Max. Interestingly, it was the institution which was showered with petals by the military choppers also when the government decided to show its gratitude. Dr. Divan, I would like to hear from you, how is the life at the front line of COVID-19? And when you see so much of apprehension, fear among your patients, and also among your team, doctors, nurses, who are equally vulnerable, how do you manage this whole, team to ensure that the treatment and the cure continues?
Thank you. So what I'm going to roll through is the journey that we followed. And in that, you will have all the things of what came to our people's mind and our mind and everybody's mind. And I think that hopefully answers whatever is going around with the people. So we know COVID-19 has been the biggest medical catastrophe in the past century, both in geographical spread and the magnitude of spread, both in duration as well as numbers. It has been going on in the entire world for now almost 6.5 months, 7th month in progress. And this has probably changed the entire world order. Doctors, and I should surely mention all other healthcare workers, and also the entire support staff, which is from administration and the non-administrative support staff. They have been at the forefront of managing these sick and dying patients, despite all challenges that we had. And as you mentioned, we were amongst the first private hospital in Delhi to open a COVID facility, which was a tertiary care facility. We gradually started from 100 beds, and now Max Saket complex, we are 350 bedded COVID facility. My own hospital is entirely COVID hospital, which is 250 beds, and 100 is with our sister hospital at Max Saket. So 350 are these beds, plus there's a hotel along with us where we have another 150 beds for people who have very mild COVID symptoms and who have issues remaining at home, whether they have very elderly parents or small children, or they do not have enough space where they can be isolated. So this is what it is. But I must say that the journey has been quite arduous for the past 3 months, but very, very fulfilling. So when we were the ones who were told that, yes, now we are going to accept that challenge as a COVID facility, the initial challenges that we faced were, most importantly, motivation of our healthcare workers, doctors as well as other healthcare workers. There were morbid fears of the severity of disease, especially when the TV was full of the Western world where people were dying on the roads, China where people were dying on the road. It was thought as a disease which is a killer. So everybody was very, very reluctant to join. So the first batch was the most difficult to get. Not only that, if the doctor was ready, there were a lot of family pressures to the point that naukri chhod do. Don't join the job, quit the job. So they had to overcome those family pressures from the wife, from the parents, from people around. And then there were social issues. Some people wanted to join the fight, but as you know, in the cities like ours, they are one generation families. They could have small children. There could be ladies who could be lactating, who as doctors had to join the duty. So, or they were elderly parents at home in small dwellings of say 2-room sets, or there were local issues in the places where people were staying as tenants, the landlord issues and others. So these were very big challenges for people to join the fight. Fortunately for us, when we started talking of it, we started counseling people. Our first batch, though with great difficulty, got ready. So this was an extremely big challenge. I think it took me around a week to 10 days of small counselings, small batch counselings, addressing people at different fronts. But finally, once we got going, I was sure once we are getting going, we can now be running the show. Then, as this is an absolutely new disease, we had no idea what was going on except for the literature and what the world was showing. We had to prepare well for the fight, and I'm happy that we had around a week to 10 days to prepare for the fight. So we formulated care protocols, we rehearsed those care protocols. We then, extremely important for all of us was protect yourself while you're taking care of others. So we had to have significant healthcare workers safety protocols, which involved doctors, which involved nurses, our frontline housekeeping staff, our GDAs, our people who are working in the kitchen, our security. So all of them had to be told how to wear what we call as donning of personal protective equipment, where to, what mask to wear, and then extremely important was doffing. They were not only taught, they were also made to rehearse those. So I will say, to make them battle ready and now psychologically ready, we had to make them ready for the work which they were to go into. And not only the protocols had to be formulated once, as this was a newly emerging disease with new data emerging of various things which could be helpful, and also government changing its strategies every day in light of the new data is coming. We have to keep on updating the protocol, which have been doing regularly depending on what is the evidence emerging. So in this way, we were ready to fight. Then when the people went inside, as you understand, usually the air conditioning in the hospitals keeps the temperatures around 23 degrees centigrade. And as per the COVID guidelines, we have to keep the temperature which is higher, usually 26, 27. And the people wearing PPE, the temperatures inside the body rise by another 3 to 4 degrees. So you can imagine they were almost in an oven with a fully clad PPE, and with the temperatures rising, they would be sweating to their vests totally. They would be exhausted. They would not be able to drink water, because at the entire time when they were on a COVID duty in a COVID area, they could not have removed anything to even have a sip of water. For 6 to 8 hours, sometimes 11 hours duty, people could not go for a call of nature. So there were people who were not so strong, they collapsed also. And any one collapsing, the fear goes around in many other people. So there were psychological issues with that. But gradually they overcame. We would have sessions to the point of this thing, that if somebody was coming for duty, say at 8 o'clock, we would teach them to wake up at 6:30, have enough water so that they were well hydrated. They would have their breakfast, which would not be fries, so that they don't feel thirsty. And then they would be asked to have a fruit before leaving, because that gives them enough fluid to maintain themselves, which is gradually released. And of course, do all their calls of nature before they're coming, so that they can hold on. All said and done, people could hold that quite well. And then wearing all these gears and everything, whatever most efficient person would be, the efficiency would not be more than 50 to 70% at the max. So they could not be the most efficient. And this was further hindered by people when we were supposed to wear the goggles, when we were supposed to wear the head shields, the face shields, they would be fogged, so the vision would be impaired. Then clinical challenges were, you would see a doctor always with a stethoscope. I think all of us have forgotten stethoscope for the past 3 to 4 months, because when you are fully clad, you cannot put any earplug, anything into your ears, because that is exposing your body. So we would work only on symptoms, only on data and everything. So we had to change our way of treating patients on data, on patients' complaints, on various things, and looking at their oximetries and saturations. So it was much more visual cues and the lab cues on which we were working, rather than what is actually which we have been taught right from the word go. So, but yes, all said and done, we manage ourselves. And then second important thing is, we are a fully computerized hospital where every drug comes only when there's an entry. So I would say that extremely important was the role of people who were not on COVID duty. We formed a control room where the seniors would be sitting, the youngers who are not going for duties in the COVID area would be at the back end, writing all the notes, asking for samples to be sent, everything to be done as much as possible at the back end. Then I take care of intensive care as well as medicine. We would take virtual rounds of the entire critical care area with our teams upstairs. We had smartphones, we had Skypes upstairs. So we would even manage small things as much as like setting if our doctors who were senior enough upstairs, but if they were caught on a ventilation or something, we would even ask them to take the Skype over there and adjust the ventilator settings and look at the patient. Then psychological aspects of patients. You would see that everybody is in white suits, no face seen, nothing seen. You can imagine anybody lying for 10 days, 12 days in the ICU or in the ward with no face seen. So he would be, there'll be a lot of psychological trauma, there'll be ICU psychosis. So what we used to do was, we would have, after taking the tele rounds, we would have a tele chat with the patients. A video chat with the patient. So at least a face like mine or face like anybody else was seen. that made them feel at home that yes, we are seeing some human faces. Fortunately, in the present time of, I would say, the COVID, and also with smartphones being available, we were always allowing all people except those who were ventilated or very sick to carry the smartphone with them so that they could be in touch with the families, they could be in touch with us, we could speak to them and reassure them. The reassurance was extremely important. So this was the physical aspects of them. Then let us talk about what is the emotional factor involved in this. The most emotional factors was most often in the intensive care. Because here you are treating a patient who has come to you very, very sick, because we are being a tertiary care hospital. Many people will take time, or in smaller hospitals, they'll be coming to us at the time when they will be hinging on a ventilator. So as all of us know that there's a very small subset which requires ventilation, but those are the most difficult patients to handle, and they have an extremely high mortality, because if you know what is called a cytokine storm, they're already in storm. They already have the lungs which are opaque with no place seen. There is no ventilation occurring. They are in multi-organ failure. Once you see them, then the doctor inside is so much psychologically upset that he's seeing a 40, 45-year-old man who is he's helpless, that he can't treat him. He has nothing in front of him to take care of him. Over time, we have been able to overcome that aspects gradually, because we have learned also with time that we need to preempt. Look at the markers, we look at things, and we would preempt things by doing various non-conventional therapies like plasma.
There seems to be some connection problem. It is a wonderful story.
Yes.
Yesterday, this was on Times Now. Yeah.
I think he's back. Yes. Yes, Dr. Diwan. Dr. Diwan, please.
He's muted.
It's on mute, Dr. Diwan. Just see if you can see the icon there and unmute itself.
Can you hear me now?
Yes, yes,
yeah.
yes.
Sorry, I'm so sorry.
No
So, so this emotional trauma to you would have nothing to take care of them, and would have you would be losing them, and that would be there. Every few minutes, every few hours, and they would also be right, but then we would not be able to do these things, because if we kept on only talking to them on phone, we could not take care of families, and then there will be 15 separate relatives who would be talking to us and wanting to get the answers. So then what we devised was, we would very politely tell them that yes, probably the best answer is, why don't we, all those who are interested, please come on a conference call. That to finish, but to be able to talk to 5, 6, 7 people who are interested, and very firmly but politely told that yes, we cannot do more than this. We can only answer that, and let us spend time on treating your patient rather than answering every family member. So we would always ask them to choose one family member who would be doing. But then that led on to a lot of emotional drainage from our doctors who were inside. We were outside, we could still handle them, but our doctors inside were physically as well as emotionally drained them. Then the doctor not only was a doctor, he acted as a psychologist, he acted as a nurse, he even sometimes acted as a GDA, somebody who's looking for water and GDA was running around for something else, and intensive care doctor will pick up the glass and give him water and take us. So they were all rolled into one, and they were quite happy about it. But one is person doing a duty there. He's got spent 6 hours, 8 hours with the patient. He comes exhausted. Normally one will go to the family, one would be chatting with parents or children. Here you would be, after your duty, you are quarantined into a room, after your duty hours. At the maximum, fortunately, you have smartphones where you could look at something. Those who were lucky enough, of course, in our any access to TV also, nothing to look at. And anyway, unfortunately, TV only gave us negative news. So you could not be very happy looking at those. So there was a lot of loneliness in them, because you would either be working and the rest 16, 18 hours, you would be not even be mingling with your other friends, because you would be only quarantined to your room. Then after you were over with all this work, you would be going on a quarantine for good. Initial guidelines said you would work for 2 weeks and then you will go in for a quarantine for another 2 weeks. So 28 days you were away from your family, and quite often, because there is such a lack of manpower, many people, boys and girls had to come back and redo the duty. So you can imagine you would not be with your family for 1.5 months, 2 months. Maybe you're only virtually talking to each other. So this is very big emotional things. Then others concerns which would emotionally drain them was either in the news that some doctor got affected, some doctor who became unwell. Then there'll be news which will be flashed on the TV that yes, unfortunately we lost this healthcare worker or the doctor. That will again drain them emotionally, which had to gradually they had to strengthen them. But I must tell you, if we look at the history of all those people who were affected with COVID as healthcare workers, and in our own experience, see, we have experience of more than 3 months now. The people who have done COVID duties, and I think at least 900 to 1,000 healthcare workers would have gone in for COVID duties, including doctors, nurses, and everybody by their turns. We have had only 4 COVID positive patients, because here the enemy is known. You are ready for the enemy. You are already well prepared. You are wearing a PP. Whereas we had a huge number of people where the enemy was not known. Those were the people who were in non-COVID area, where you did not know that yes, somebody has come for dialysis but is COVID positive. We have had occasions when we have had patients with the malignancy has come in. The patient is COVID negative, but the attendant, we had a father who was with the child, and child was weeping if the child had malignancy. So many nurses went to handle. The child would be in the father's lap. So many doctors would go and cuddle that child so that he's happier, because the mother was not there. The father could not handle. And to our horror, on 3rd day, the father turned out to be positive. So you can imagine another 50, 60 nurses in the ward had to be quarantined till they were turned to be negative. So there was a drainage on manpower. So I would say this thing needs to be brought home, that the people who are well protected, when your enemy is known, when you are on the front and you are fighting, you are aware that the enemy is in front of me and I am ready with my everything. Unlike when you are unprepared and a terrorist strikes. So people who were on COVID duties were very small numbers who got affected. Knowledge of who was an enemy, and I should not call it an enemy. I'm saying enemy is COVID as an enemy, where you would get caught. So I think this is what our doctors gradually learned, and what they realized later on was all that initial reluctance of people who were very, very reluctant to come, they came forward to do the duties now. So now we are fairly comfortable. There are people who are now ready to go for a 3rd cycle of duty. There are people who were absolute no to doing duties are now ready to come for duties. So the emotional part is well taken care of. Now with the COVID cannot be dealt with by people from medicine, from pulmonology, from critical care or anesthesia alone, because these are those medicine people who can handle. We have recruited people from ENT, we have recruited people from urology, super specialists from neurosurgery, because all of them have a basic MBBS knowledge. We only had to brush them up for taking care of COVID. Fortunately, it's a single disease, so you did not need a lot of training to take care of them. So once the protocols were formed, we could overcome these challenges. Right now, I have a neurosurgery 3rd year resident who is doing COVID duties on the floor. So you can imagine the person who is becoming a super specialist doing these duties. We would have our first year postgraduates who have been trained to take care of these things. So we have been able to handle those things. So I would say over the time, medical fraternity has been able to win over all these challenges and are all out to win our war against corona. And I would say, I think if we are able to take these challenges at this time of our career, and this such a long challenge, which now my career spans over 35 years plus. In my own career, I would have had severe episodes, say, of like when we had the first dengue or when we had the H1N1. But we have never had such a long, drawn struggle and fight and fear of unknown. And if we are able to face this challenge, I'm sure all those people who have been able to face this challenge as medical professionals, I'm talking of the positives that we have had, we would surely be able to win over anything which comes in way of our life, whether in our personal life or in our professional life. If we can win over this, we can win over everything else. And secondly, I think this time has taught us that yes, there's something called meditation, something called relaxation, something called your own time. That has really helped us to go away from only the worldly things, also think about ways where we can relax. I think these are very big positives that we've learned. And I hope we are able to win over this. We are still in a mildly increasing curve of the country, but that is basically related to few areas. Other areas are coming down. We have been able to, I will not say we have been able to flatten the curve, but we have been able to slow down the curve. And with all the lockdowns, etc., a country of which is such a mammoth size, and with healthcare, as you know, we have had enough time to prepare. I think this is what we have been able to do, and we have scored over all the Western nations and others who had no time, who could not take care of things. And I would say our public and our other people, especially during the time of lockdown, have been the best people around, and they have allowed us to take care of them and allowed us to prepare ourselves well. And I think we'll be able to win over it in some time. Thank you.
I'm sure, sir, we will win with people like you on the front line. And I'm really, it's overwhelming to hear. And I just felt that it should keep going on. And it was really heartening to hear, despite so many challenges which you described, and you described so, with the, it's so, I think naturally, and it's hats off to the entire team of your doctors and medics working at Max and at any other part of the healthcare system. And I'm sure Max is smart. I have seen it's one of the most I think advanced hospitals we have around in Delhi and in our private healthcare sector. But there are so many people who are also working in relatively deprived hospitals and trying to give this care. So we salute to them as well. And thank you so much, sir, for sparing time today and sharing your thought. And I place our sincere gratitude from the entire team of Integrated Health and Wellbeing Council, as well as the the entire nation, to you for your wonderful service. And as you said, if we are going to win over this challenge, we are going to win over any challenge of our life ever. So thank you so much. Thank you, sir.
Bye-bye.
Dr. Pandey want to say something. Yes, please.
So we were actually soaked in complete immersion when Dr. Diwan spoke. And I must add, sir, thank you so much for giving the real story. We did not want to bring in that story which you are going through and the residents go through at Max, which is in every hospital, including the critical care up on the 4th floor out here. So you took it. It is a bonus for the society to be able to hear you. You actually talked about a role which a doctors play, and doctors are playing umpteen roles at the same point in time. They're going through their own trauma, and everybody could actually write a full story. So while you talked about that change is one constant phenomena which is going to happen around, this change is taking a little longer time for us to go away. I go back to teachers like you who actually taught and allowed us to become practitioners of the art which we preach today to our students and forward. I think it was a brilliant master stroke to be at this entire panel, sandwiched between two wonderful masters and leaders in the subject on different specialities. And that is how we partner each other. A man, a machine, and a medicine is what I say. So if the man is a doctor and a man is a patient and both understand each other, then I think machine and medicine could be used to our use. I think India is really shining and glittering with the kind of program that you held on a gratitude week today. I'm more than amazed and feel very thrilled to be here. It empowers us and it empowers you too to probably do more for the society. Thank you again.
Thank you so much, Doctor. I'll just come to you, Dr. Diwakar. You might have seen some young faces coming on the other screen. I would like to inform you that in this whole gratitude week, we are also engaging school kids and children to share their thoughts about doctors, because these are also the people, these are the next generation of our nation who should also understand. And I'm sure this memory of pandemic will be etched very deep in their minds, but they should also carry the memory of that our doctors, our medical workforce helped us come out of that crisis. So we are engaging with children. It will also be followed by a musical tribute. So you might have seen a couple of bands also. So this is what this gratitude week is all about. I would also like to inform all three of you that we are also requesting the government of India to set up a memorial for our healthcare workers in remembrance as well as in respect for the entire ecosystem of healthcare who are working, and also as a symbol that our society should always remember that health comes first. I would also request my audience to go on the chat box, and there is a link for change.org for the petition to the government to set up a gratitude memorial. Please sign that and share it with your friends. Dr. Diwakar, you want to make a remark?
Namaste, Arun Divanji. Thank you very much for your very eloquent. We saw the whole process live on the Times Now channel yesterday. The execution, which was so brilliantly, seamlessly conducted between the hospital, which takes in the hospital patients who need to be admitted there, in collaboration with the hospitality sector, as in the hotels. So this model, sir, what has been the kind of discipline that you have put in order to make this happen, and how can you share this with the other parts of the country to replicate and take the lessons learned from your end to ourselves?
I would say that this is something which is now going on in Delhi. Many big hospitals have had. See, what we need to understand, when we started the COVID hospital, we were flooded with patients people who were COVID positive but did not require much of care. They only needed to be isolated. And we were overwhelmed. You see, we were initially a 200-bedded facility, and every day we would be discharging 2025, we would be admitting 2025, but we were refusing 2025. So the reason was that relatively normal looking people were utilizing those facilities and we were denying people who were sicker, who were requiring oxygen, who were getting more breathless and unable to do. So this thought came up with the government, and they felt that people who still need quarantine, we have our own healthcare workers, we have nurses who could be staying in a one-room apartment, or we have our GDAs or our technicians who would be staying in small areas, and for isolation you need a separate room and a bathroom. We needed to take care of them, but we still needed to have the hospital for the care of people who actually needed so much of care. So that is why with the hospital, fortunately we have a next door 5-star hotel, and government also came up with guidelines. So we started that facility in that place, which was at a much lower cost, but which only required a care, isolation with some small medication, somebody watching the saturation twice a day, somebody checking their blood pressure, and Still, there were doctors and nurses on call, but at a much lesser level, so that if anybody was worsening, he could immediately be shifted to the hospital. So this really allowed us to always have a availability of a bed to the patients who are needy. And now, fortunately, the guidelines have also come in that yes, you need not even come to the hospital if you have good isolation facilities. And now it is not the severity of disease which is increasing, but it is the people who now need. Even in our ward, we have people who require more care than what we were giving a care 1 month back. So we are now taking care of these people who have multiple associated problems or who have small oxygen requirements, so we can preempt their worsening so that they do not land up in ICU. We have, out of our 200 beds, we have 32 bedded ICU, but that is always full. Even we have 10 beds vacant in our 200 bedded facility, ICU is always full. So we are able to preempt many people who do not need to come to the ICU. We take care of them in the wards, and this has been a very big cushion for us, and it has really helped us. And this is very, very seamless. We would always keep a few beds for the people who are in the hotel, that God forbid in the night they worsen. We would not occupy 2 or 3 beds because they are a responsibility and they cannot go anywhere else. So, but now this is very easily taken care of. So this is how we have been able to take care. This was strategizing like this.
Thank you. Thank you so much, sir.
Okay,
Thank you so much, Dr. Diwan. Dr. Diwan, a question in my mind. Our health minister was admitted at Max Hospital. Was you overseeing his health also?
Anybody who comes to intensive care has to, fortunately or unfortunately, go through me. So we were taking care of him, and we were very happy that we quickly preempted everything. And by the second day, by the third day, he was well, and we shifted him out of the ICU. And then he remained for a few days. He became COVID negative, and we sent him. So we could immediately start the things. We preempted everything. That's what I'm saying. So earlier we were dealing with severe illness. We are still dealing with very severe illness, but when the people are coming to us early, we are able to take care of many of them, and we are preempting them from worsening. If they are giving us time, we are preventing them from worsening. So we are able to avoid intubations by all other means, by doing everything else, but trying to avoid. We still have a large number of patients on ventilator, but if we did not preempt them, we would have probably all the 32 beds on ventilator.
Thank you so much, Dr. Diwan, for your time. And I actually, so I wanted to go back to Dr. Sanjay Pandey, and Dr. Pandey and Dr. Hema Diwakar and Dr. Diwan also. You all are doing something which is bringing a very big purpose to your passion. Dr. Pandey, you said that by how we can bring actually a lot of changes in life, how we can benefit life. So I remember a story in which I would like to place here in front of all of you. Around 8 years back, I come across a story of a person which was shared by Dr. Pandey with me, a taxi driver in Mumbai who got urinary incontinence because of some accident which led to a trauma. And he, kind of ran out of his job. He was at the verge of committing suicide. And we did some kind of media story at that time, which was talking about how Botox can help reducing or, curing or maybe managing urinary incontinence. Somehow that patient reached to Dr. Pandey at Kokilaben Ambani Hospital. Dr. Pandey was kind enough to manage some kind of CSR fund or something so that he can afford that expensive medicine, but which helped him come back to the normal life. And actually by that small media article or or that piece of information, we saved at least 6 lives, because that taxi driver used to live in, I think, in Dharavi and had a whole family to take care of, but he was driven to the to committing suicide because he was not able to sustain his life, because as a taxi driver he could not do much other, and anything he could do in a diaper and stinking smell coming from him all the time, he could not survive. So Dr. Pandey, I still remember that story.
I'll just add to it. A taxi driver was not able to get somebody to sit into his taxi because he was smelling of urine. Because his bladder was neurogenically overactive as a result of spinal cord trauma. So he was on the verge of a suicide. When your article came in later, it is just a story which is a real-time story. So I said every patient tells a story, and this is a real time. I'm not naming him, but he was in an interview with us, which is on the YouTube. He agreed to say, I would like to be an ambassador to it. And remember, your patients are your best ambassadors. Today, in the society, all those people you across, which we talked about, the COVID warriors, and the way Dr. Diwan did describe about the entire story which doctors go through, and similarly, the entire ramifications of it. So on quality of life diseases, Dr. Hema would tell you that vesico-vaginal fistula was a common issue where women used to live in diapers till somebody would operate. That era is gone. The healthcare practices in gynecology have gone sky high. They beat the world. The Indian gynecologists are up there on the sky, which means that the practices have gone so much. Therefore, the entire Thanksgiving and Gratitude Week also is to look at the Indian healthcare has gone to such amazing levels. The practitioners of the art are really performing and preaching together under Hippocratic oath. So we make it a point that we take it forward. So that was a great example. There are so many such quality of life diseases where people have lived in agony, they live in agony, wish they could speak loud and clear. If somebody is bleeding in urine, somebody has a pain, somebody has a CT scan showing a cancer, he would rush to the best care facility. He would rush immediately to an emergency. But what about those people who live in agony of umpteen diseases, which are quality of life diseases? I think this platform goes very strong and emphatic today to probably help people out to take health on the front row seat. It's important for them to wake up to it that they have to take care of the slightest possible symptom, reach their doctor, and not to take off-label medications from a counter.
Thank you so much, doctor. And I just want to highlight that story gave a purpose to us also. And till today, to my team, this is how I identify that what you are doing, any information, reaching to anyone, bringing any hope in life is something which is a reward for us. So thank you so much for joining, all three of you. We have created a special anthem for all our doctors and our medical professionals. I would like my team to play that, and after that we will move on to our other session where our children, school kids and musical, artists are joining. I'll be happy if you want to continue, or if you go ahead to take care of your work. You spared your time from a very busy schedule. So thank you so much. But before logging off, please hear this anthem which we have created in respect to all of you.
Thanks a lot. Thank you.
Hi, my name is Padamji Chelawat, and I thought of dedicating a special anthem, a song for the real Corona warriors, the heroes, doctors, the nurses, the medical staff, for their tireless, selfless service. Thank you. You are the real heroes. जो मैंने लिखा गाया कंपोज किया वही है. काम निस्वार्थ किया क्या बात है, मुश्किल में डटे रहे क्या बात है, खुद की नहीं परवाह की, क्योंकि पेशेंट्स के हेल्थ की चिंता थी. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. शब्दों में शायद न कह पाएंगे, शब्दों में शायद न कह पाएंगे, आपके ऋणी सदा खुद को पाएंगे. सांस खुद की भी थी दांव पर, डगमगाए नहीं पर तेरे पांव थे. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. You are the real heroes, आपका शुक्रिया. Thank you.
Everyone and all our doctors, thank you so much. Thank you, sir.
अपना सुकून भूलकर वो सबकी जान बचाते हैं। भूख प्यास भूलकर वो डॉक्टर होने का फर्ज निभाते हैं।
Someone has rightly said, as God cannot be everywhere, so He has sent doctors for us.
You are risking your life at every moment. You are not afraid of this pandemic.
ਤੁਹਾਨੂੰ ਦਿਲੋਂ ਧੰਨਵਾਦ ਕਰਦੇ ਹਾਂ ਕਿ ਤੁਸੀਂ ਇਸ ਮੁਸ਼ਕਿਲ ਵੇਲੇ ਆਪਣੀ ਪਰਸਨਲ ਲਾਈਫ ਆਪਣੀ ਫੈਮਲੀਜ਼ ਨੂੰ ਪਿੱਛੇ ਛੱਡ ਕੇ ਸਾਡੇ ਲਈ ਔਨ ਫੀਲਡ ડ્યુટી તે હંમેશા અવેલેબલ હો.
આવી મહામારીએ અમને અહેસાસ દિલાવ્યો છે કે તમે ભગવાનના એક રૂપ છો.
Thank you will never seem enough, but we will say it anyways. Thank you for your countless hours, your unwavering dedication, and the boundless talent that you possess.
माना वो डॉक्टर है, बेशक कोई भगवान नहीं, मगर डॉक्टर का डॉक्टर होना इतना भी आसान नहीं.
I'd like to sincerely pay my gratitude and thank the whole medical fraternity, the doctors, the nurses, everyone who's been working endlessly and effortlessly in this drive to, tackle the pandemic.
Coronavirus, something which we never heard of, something that was totally new to every one of us, even to the doctors. But still, doctors came ahead, they fought this battle, they conquered this battle.
Thank you so much, doctors, that you are there so that we can stay safely at our home.
દિલ સે આપકા શુક્રિયા. દિલો ધન્યવાદ. ગોડ બ્લેસ યુ. થેન્ક યુ.
અમે તમારું ખૂબ ખૂબ આભાર માનીએ છીએ. તમારું ખૂબ ખૂબ ધન્યવાદ.
Thank you so much, doctors, for being there.
I hope you keep continuing the great work. Thank you so much.
We salute all the doctors out there.
We love you, doctors.
Thank you, doctors.
So now we also have some.
Can you hear me? So now we also have our school kids who have some message to share for our doctors. So first I would like to start with Ansh. Hi, Ansh.
Yeah. Good day,
Let's see
everyone.
what Ansh has shared for the doctors.
Good day, everyone. I'm Ansh Gupta of St. Columbus School, New Delhi. Today, with the worrying news of the outspread of COVID-19, we have experienced a society with deserted airports, quiet cities, empty streets, and closed places. From the time where countries had shut their doors to contain the spread of the virus, to now they're opening up, Our doctors are going more than the extra mile to battle this pandemic. Since this adversity has added, the pressure on global health workers has increased to unsustainable levels with limited resources. But I have heard numerous stories of their bravery and sacrifice, maybe because they were trained to be the heroes of our society. Our duty to return a thank you and to show gratitude is urgent, as it is important to be kind to each other more than ever before. I want to appreciate all the inspiring things they do, working tirelessly around the clock, keeping our spirits high, and being the lifesavers while sacrificing so many things for others' needs. We all respect you with a whole heart for humility, kindness, and strength. But our words will not be enough. We have to provide support in every manner, be it TCS providing free courses to all global healthcare workers regarding infection control policies, distancing protocols, virtual awareness, and many other relevant subjects. So, with enormous stress on the healthcare systems around the globe, it is more urgent than ever before to step up collaboration, information, knowledge sharing. Doctors, you represent the hope in the dark, a stubborn hope that everything will be all right. I salute you for being role models of greatness and compassion as we all pray for your families and your safety too. Thank you.
Thank you, Ansh. That was really insightful. Now let's see what our little Faraz has to share. Faraz, over to you.
Hello everyone, my name is Faraz Pasha. I am reciting a poem on Corona Warriors. The world is in a grip of a fright. The Corona is out with all its might. People are suffering and dying. Gloom is everywhere with no silver lining. Everybody is scared to help the sufferer. They fear for their lives and don't go near. But there are our doctors and nurses. They work tirelessly and never deny care. We salute them all and thank to them. They are our heroes and shine like a gem. Thank you.
Thank you so much, Faraz, for your lovely message. You're really cute.
Thank you.
Let's see what Manchester has for us.
Good afternoon. I am Anshita Dogra of Algon Public School, Class 8B. Today, I am going to sing a song for the Corona Warriors. समर्पण को तेरे प्रणाम समर्पण को तेरे प्रणाम ममता का तू है तू जनाम समर्पण को तेरे प्रणाम आपदा से ये रंग तू है लड़ रहा मौत का कर रहा कारवां तेरे हाथों से ही जग का शीश है तेरा जीवन तेरा ना रहा इस पथ पर चले ना रुके ना डरे विश्व तेरा ऋणी हो गया सूरज की तरह तू अखंडित रहा तेरा जीवन ही है प्रेरणा समर्पण को तेरे प्रणाम समर्पण को तेरे प्रणाम ममता का तू है तू जनाम समर्पण को तेरे प्रणाम Thank you, doctors.
Thank you so much, Manishta. That was really awesome. So now we also have a band with us, Taqdeer band. Guys, Are you there?
Hi, can you hear us?
So over to you guys now. Let's see what you have for us today.
Yeah, thank you so much. Firstly, I'd like to thank everyone for having us here today for this beautiful session and such a beautiful initiative. Mostly IHW Council. Thanks to them for having us here, and of course, thanks to all the healthcare workers and doctors who are there on the front line, working day and night, fighting this pandemic. Thank you so much. Now we'll give you a break from the typical COVID-19 discussion which is going on here. Let's just forget it for a while and let's just indulge ourselves in some beautiful music. Let us take you down the memory lane to the good old days of the 90s music, the early 2000s, the good old days of 70s, the 80s. And let's do this together, all right? Here we go. La 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 le, la la la. 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 Duba duba रहता हूँ आँखों में तेरी, दीवाना बन गया मैं चाहती तेरी. डूबा डूबा रहता हूँ आँखों में तेरी, दीवाना बन गया मैं चाहती तेरी. अब दिन गुजरती नहीं, रातें कटती नहीं, तेरी तस्वीर से बात करती नहीं. तो आजा ला 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 रे या ला ला. La 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 la. कोई जाने ना पहचाने ना ये हुआ कैसे. आ गए ख्वाबों में ऐसे, कोई जाने ना पहचाने ना ये हुआ कैसे. आ गए ख्वाबों में से बेवफा बेवफा न जा. ला ला रे या ला ला. La 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 रे या ला ला. शाम सवेरे तेरी यादें आती है, आपके दिल को मेरे यूं तड़पाती है. ओ सनम मोहब्बत की कसम. तो दस्तूर हो गया, यादों में तेरी मजबूर हो गया. ओ सनम तेरी यादों की कसम.
ये दिलों ना जाना है क्या है दिल का लगाना नजरों से ना कभी हमको गिराना मर भी गए तो भूल न जाना आंखों में बसी हो पर दूर हो गई दिल के करीब हो ये मुझको है यकीन ओ सनम तेरे प्यार की कसम
Guys, is it clear? Can you hear us properly?
Yes, yes, we can.
Perfect, fair enough. Now let us take you back to the good old days of music, the good old days of 70s, the 80s, the iconic numbers. Let's do this.
लफ्ज़ों की है दिल की कहानी क्या है मोहब्बत क्या है जवानी वो लफ्ज़ों की है दिल की कहानी क्या है मोहब्बत क्या है जवानी दिल की बातों का मतलब ना पूछो कुछ और हमसे बस अपना पूछो दिल की बातों का मतलब ना पूछो कुछ और हमसे बस अपना पूछो उसके लिए है दुनिया दीवानी क्या है क्या है जवानी हम सोती है दिल की कहानी क्या है मोहब्बत क्या है जवानी कश्ती वाला क्या गा रहा था कोई से भी क्या गा रहा था ये कश्ती वाला क्या गा रहा था कोई से भी क्या गा रहा था इससे पुराने यादें पुरानी क्या है मोहब्बत क्या है जवानी दिल की कहानी क्या है मोहब्बत क्या है जवानी ऊंचे ऊंचे पर्वत जब चूमते हैं अंबर को प्यासा प्यासा जब चूमता है सागर को ऊंचे ऊंचे पर्वत जब चूमते हैं अंबर को प्यासा प्यासा जब चूमता है सागर को प्यार से बाप में जाए तो आ जाए ऐसा कोई साथी हो ऐसा कोई प्रेमी हो प्यास भी बुझा जाए मिले अमर जब आए प्यार बरसाए हम ऐसे कोई प्रेमी हो प्यास दिल की बुझा जाए हम कर चांद बरसाए प्यार बरसाए हम बरसाए ला 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 we are happily taking your requests as well, just in case you like to listen to something, or else we'll just continue with our favorite numbers. And I'm sure you guys, I just hope you guys are having a good time. Yes, no, maybe.
Yes, obviously.
Thank you so much. जानिया हाड़िया जानिया हाड़िया तू भी सिख के दुख सुख बोलना तेरे बिन नहीं लगता दिल मेरा ढूंढना 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 जानिया हाड़िया तू भी सिख के दुख सुख बोलना तेरे बिन नहीं लगता दिल मेरा ढोलना तेरे बिन नहीं लगता दिल मेरा ढोलना कुछ काले बदना तो सीने विच लागे कहीं बरसाता कुछ काले बदना तो सीने विच लागे कहीं बरसाता तुर गयो सजना नींद न खोके जाग के कटिया राता आप जा न सका वास्ता प्यार दा खेलता सोनिया उड़दिया माड़िया तेरे बिन नहीं लगता दिल मेरा ढूंढना तेरे बिन नहीं लगता दिल मेरा ढूंढना जानिया हाड़िया आगे सच्चे प्यार के तपोड़ना लगता दिल मेरा ढोलना लगता दिल मेरा ढोलना लगता दिल मेरा ढोलना लगता ओ दिल मेरा ढोलना all right, thank you. We've got your requests as well. Let me just see. There were, I guess, 2 or 3 messages in between.
Yes, so we are getting messages from our Facebook audience. I've shared 2 with you.
Yeah, right. शाम भी कोई जैसे है नदी लहर लहर जैसी बहती है कोई अनबड़ी कोई अनसुनी बात धीमी धीमी कह रही है कहीं ना कहीं जागी हुई है कोई आरज़ू कहीं ना कहीं खोए हुए से मैं और तू खामोश तो सुहानी सुहानी है ये कहानी जो खामोशी सुनाती है उसे तुमने चाहा होगा वो तेरा मुझे वो बताती है मैं मगन हूँ पर न जानूं कब आने वाला है नंबर हौले हौले धीरे धीरे So we've got another request, but we're a little unsure about the chords for that song. So we'll continue singing our numbers. And
जाने क्या ढूंढता है मेरा दिल फ्रॉम लकी अली
जाने क्या ढूंढता है मेरा दिल तुझको क्या चाहिए जिंदगी I but उसके आगे की तो मुझे you remember the no we'll do G major पे this one this from the Aryans you remember ये हवा ये हवा कहती है क्या सुन तो मेरी जाना What do you remember? तेरे में कैसे No, we'll do it a medley after that. Yeah? ये हवा कहती है क्या सुन तो मेरी जाना ये हवा कहती है क्या सुन तो मेरी जाना कहती है क्या मेरी जाना आंखों में तेरा ही चेहरा धड़कन में तेरी ही यादें करती है दीवाना आंखों में तेरा ही चेहरा धड़कन में तेरी ही यादें करती है दीवाना आए कहाँ गई वो रातें मीठी मीठी सी बातें करती थी जो दीवाना आंखों में तेरा ही चेहरा धड़कन में तेरी ही यादें करती है दीवाना से तुम गई हो जब से मुझको भूल गई हो जब से तुम गई हो जब से मुझको भूल गई हो मैं दीवाना लेकर दिल चुरा लिया कर गई मुझको तेरी यादें दीवाना तेरा दीवाना आए कहाँ गई वो रातें मीठी मीठी सी बातें करती थी जो दीवाना आंखों में तेरा ही चेहरा धड़कन में तेरी ही यादें करती है दीवाना
So I'll tell you what. Thank you for pouring in with your requests, but the problem is some songs they take a full setup, like a bigger setup in music.
We totally understand. I'll just give you another request.
Sure. However, it is one of our favorites. We like to sing that. O Sanam. Oh, we already did O Sanam, but no problem. We'll do it again, and then we'll listen to Metro because people are willing to listen to some retro numbers. So we do that. But listen.
शाम सवेरे तेरी यादें आती हैं आके दिल को मेरे तड़पाती है ओ सनम मोहब्बत की कसम ज़माना के दिल में फिर लौटा जाना है क्या है दिल का लगाना नज़रों से ना तो तेरा नाम ही गए तो भूल न जाना आंखों में बसी हो पर दूर हो गई दिल के करीब हो ये मुझको है यकीन ओ सनम प्यार की कसम हर शाम आँखों पर तेरा चल लहराए हर रात यादों की बारात ले आए मैं सांस लेता हूँ तेरी खुशबू आती है एक महंगा महंगा सा धड़कन भी तेरे गीत गाती है। पल पल दिल के पास रहती हो, जीवन की प्यास ये कहती हो, पल दिल के पास रहती हो। सोचूंगी क्यों इतना मैं तुमसे प्यार करूं, तुम समझोगी दीवाना मैं भी इकरार करूं। दीवानों की ये बातें दीवाने जानते, चलने में क्या मजा है परवाने जानते हैं। चलाते रहना आकर भावों में, पल पल के पास रहती हो, जीती प्यार कहती हो, पल पल के पास तुम रहती हो। All right, thank you. And then again, we've got some more requests over here. This one. Finish this. सोचता हूँ उसका दिल कभी मुझ पे आए तो, तू है आसमां, तू है नहीं जी मेजर, तू है आसमां में, तू जो है तू सब कुछ है, ना कोई कमी है। Chalo, let's do this. All right, don't request. Here we go. Yeah. यूं तो है आसमां में तेरी ये ज़मीन है, तू जो है तो सब कुछ है, ना कोई नमी है। तू ही दिल है, तू ही जान भी है, तू खुशी है, आसरा भी है, तेरी चाहत जिंदगी है, तू मोहब्बत, तू आशिकी है, तू आशिकी है, तू है आसमां में तेरी ये ज़मीन है, तू जो है तो सब कुछ है, ना कोई कमी है। तू ही दिल है, तू ही जाती वाले दिल को सुकून चाहिए, पूरी आरज़ू चाहिए, जैसे पहले कभी कुछ भी चाहा नहीं, वैसे यूं चाहिए दिल को तेरी मौजूदगी का एहसास यूं चाहिए, यूं चाहिए, यूं चाहिए, शाम और सुबह यूं चाहिए, यूं चाहिए, यूं चाहिए, हर मंज़िल यूं चाहिए, जितनी दफ़ा All right, thank you so much, guys. बहुत बहुत शुक्रिया आप सभी का हम सबके साथ जुड़ने के लिए. And there's this one last song request that we have, but we don't know that number. But yes, for all the doctors, I've got another beautiful number. और इसी तरह हमारे डॉक्टर्स को भगवान अच्छी तंदुरुस्ती के साथ बख्शे. And I pray to God that He keeps every doctor and every health worker healthy and fit, so that they can continue doing what they're doing, the good work that they're doing. And one last number for this evening. It has been an absolute pleasure playing for you guys. Thank you. Before we leave, I'd like to introduce a band. It's called Taqdeer, the band. TAQDEER. Taqdeer, the band. You can find us on YouTube, on Facebook, and on Instagram. And we are playing here with some beautiful and very talented musicians. That's Dr. Pranav Khanna. He is the percussionist and the drummer for our band. That's Ritesh Sharma. As you can see, he's the guitarist, and I am the lead vocalist of the band. Now, before we leave, this beautiful number not on request, but what we wish to sing. Can we have E major after we get to it? We see this coming up. Or just let's just have it on the normal E. हाँ यही रास्ता है तेरा, तूने अब जाना है. हाँ ये सपना है तेरा, तूने पहचाना है. तुझे अब ये दिखाना है, लोगे तुझको आंधिया क्या जमीन और आसमां पाएगा. जो लक्ष्य है तेरा, लक्ष्य तो जाना है. ये सपना है तेरा, तूने पहचाना है. तुझे अब ये दिखाना है, तुझको आया क्या जमीन और आसमां पाएगा. लक्ष्य है तेरा, लक्ष्य तो हार दिखाना है।
Thank you so much, ladies and gentlemen, and thank you all the doctors and health workers. बहुत बहुत शुक्रिया आप सभी का हमारे साथ जुड़ने के लिए. It was absolute pleasure performing for you guys. We are Takdeer the band signing off for this evening. Thank you so much.
Thank you so much, Takdeer Band, for your wonderful performance, and our audience loved it. And thank you so much for joining this gratitude week and playing for the doctors who are doing their selfless services for our society and the entire humanity during this time of pandemic. It was absolute pleasure to listen to your soulful music. Thank you so much. To our audience, this was a wonderful day, the second day of gratitude week. We saw a lot of inspiring discussions, stories from doctors, and especially those doctors who are fighting this pandemic on the front line of our healthcare system. And with this, we would be signing off for today, and we are looking forward to our third day of this gratitude marathon program, which is going to be a 60-hour long program. We are on the end of second day. So till then, goodbye to all of you. Thank you so much. Do sign the petition for the government to request them for the establishment of gratitude memorial to pay respect to the entire services and efforts of our doctors and healthcare professionals community. You can find the link on the chat box of our Facebook page, and you can go to change.org to share and to sign the petition. Do share it with your friends and families also, and request them to sign as well. Thank you so much. Good night. Stay well. See you tomorrow.